what we term microvascular ischemic white matter disease. There are predisposing risk factors for this, where in some patients it may be accelerated, but it's typically a process that's due to pathology or abnormalities in the very small, some of the smallest blood vessels that supply the brain, particularly around the ventricles.
Then I'll go to the next one, which is 101B, and again call out a section here at the bottom. There's kind of a faint red arrow. Again, did you put that there?
I did.
And why'd you put that there?
Because it again shows the same pattern of white matter disease that was demonstrated on MRI of 2017.
Okay, so again, a finding before the accident that was there also after the accident.
That's correct.
And what's this finding associated with?
The exact same description.
Got it. Okay, then if we move to 101C, there's yet another red arrow. I take it you put that there?
Yes.
And is it again to point out that Dr. Gibby's finding of post-accident problems in that area preceded the accident?
Yes, accounting for technical differences away in the plane of the way this exam was acquired from 2009 to 2017, these findings are identical.
Right, got it. Okay, and they're also associated with the same things you've described already?
Most likely microvascular disease, and that's when he underwent his comprehensive imaging workup at the VA hospital in 2009. It was also attributed to vascular disease at that time.
Okay, so Defense Exhibit 101D is like your same version of that 2017 image that Dr. Gibby looked at.
Correct.
And it has those same spots, so I'll just use the laser here. Again, these arrows are kind of faint on my copy, I apologize, but they're pointing to those same points we've just looked at previously, is that right?
Yes.
Okay, and then if we go to the next image, this is a new image we haven't looked at, correct?
Correct.
And this one's from 2021, as it's marked. Where was this image taken, do you recall?
Yes, this image was obtained at Blue Rock Medical or Riverwoods Imaging, which Dr. Gibby owns, and this is the same sequence that we've shown before as far as how it is technically obtained by MRI. Same slice.
Got it. And again, we have some arrows, correct?
Correct.
And those are your arrows?
Yes.
And they're showing, I take it, the same disease process or same findings that you've seen in the 2009 and then 2017 images? That's correct. So you're seeing this same condition in the brain for many years, both before the accident and after it?
Over an 11-year period, a similar pattern of white matter disease, yes.
And then if we go to the next image, 101F, we call out that upper left quadrant arrow, and again, I believe you put that there, correct?
Yes.
And kind of for the same reasons, to show these conditions persist from 2009 before the accident to this image in 2021.
That's correct.
Okay, thank you.
And
it's so hard to not listen to this guy now.
let's see. So let's.
I'm giving the jury 101G.
He's no longer a lawyer to me. He's Spotify.
That would be the next one,
Beautiful.
which I haven't referenced. But if there's no objection, that's just the next bit of the slides.
No objection.
Okay.
What is that?
You move that. Just let us see it.
I got your back and I got these cool specs.
Thank you.
Is that 101F?
So this is 101F on the screen, and then what Steve has put here is 101G.
We're gonna prove Terry.
Defense Exhibit 101G, is that also for demonstrative purposes?
Yes, Your Honor.
Okay.
hear
Received
me?
for demonstrative purposes?
You guys can't hear me?
Okay, so Dr. Black, you've used various medical terminology that
Can't hear
we
me.
might not all be
What?
familiar with, microvascular disease, for example.
You can't hear me.
Can you give us a sense of what, in lay person's
They're too
terms,
loud, I
what
see.
these sorts of findings are correlated with, how they impact a person?
There we go.
Sure. The microvascular
Adjusting our
disease
levels.
itself is a term that's used to describe micro, just meaning very small, and then vascular,
Hello, is that better?
blood
Are
vessels.
my levels now corrected?
That when these blood vessels over time become diseased, which
My sound
happens
shouldn't be muted.
in a
Can you
broad
hear me now?
section of the population,
How's that
in
sound,
some
guys?
people it's accelerated due
Check,
to
check, check, check,
underlying
check, check, check.
high blood
Hello,
pressure
hello,
or perhaps
hello.
other
Sibilance,
diseases of the
sibilance,
blood,
sibilance.
blood vessels. Then
Sibilance,
you start to see
hello.
scarring around,
Check, check,
initially
check.
around
Right.
the ventricles.
I'm very
These
quiet.
are unlike large strokes that may affect the cortex of the
Okay.
brain. These are smaller areas.
Better now?
where the
Okay,
blood,
good. Sorry, guys.
Blood vessels are compromised, and
I was
it
singing
results
as James
in,
Egan.
scarring of the tissue around the ventricles, and that's why we call it white matter disease. The
I could be
other
your
imaging in
next Chris
2009 from
Martin.
Veterans Administration with the CT angio specifically looked at the larger blood vessels that supplied
Paltrow.
Mr. Sanderson's brain, and in those
I can
images
be
they
your
found plaque
yellow.
or hardening of the arteries in the carotid bifurcation
I
on his
also
right side,
can
and
fix
then
you.
also in the larger blood vessels inside of his brain near where his retinal arteries come off, or the cavernous carotid arteries, and those also show plaque or atherosclerosis.
Okay, is it too reductive to say that these findings are an indication of an aging brain?
Well, aging can result in this because we're all deteriorating to some degree or other every day we live.
Right.
But
Yeah,
because
morning
we have
we're
a
at the
baseline,
gate. We are a
you
commentary
can,
show. We may
attribute
interrupt from
certain
time to time.
Findings if
If
it's
you'd
happening
like
at an
clean,
accelerated
crisp
level, given
court
someone's
footage,
age, then it
there's
might
other
indicate
places for
there's
that.
underlying medical problems. The other finding that was present that was consistently present was the enlargement of the ventricles, which on all images seem to be
Testing,
disproportionate.
testing.
or
Everyone's
out
telling
of
me they can't hear
proportion to
me.
the
I don't
amount of
understand. I'm doing it so I can
atrophy
hear
of the
myself on
brain.
YouTube. Test, test, test.
At several,
When in doubt, go
in
listen on
several
YouTube yourself.
reports, there was
Hello,
a
everybody.
suggestion of a diagnosis of normal
Testing.
pressure hydrocephalus, and in fact, if you go to the image, let's see, that maybe the 2021. We don't have it on here. There's an image you showed that shows what's called transepidermal
Dude, all you guys complain about the sound, go
and
get
that's
new
fluid
speakers,
that
you
leaks
weirdos.
through
My God, it sounds
the side
fine.
of the ventricle due to build pressure.
Played it on my
buildup in the
phone. It sounds
ventricle.
fine. You
And
need a new
that's
computer. I think
supporting
it's you.
finding,
I think it's a you problem.
From an imaging perspective of normal pressure hydrocephalus, obviously that has to be correlated to someone's
Yeah, why
clinical
is this
presentation and
sinking? Come
symptoms,
on.
and that's where a neurologist would play an
Things aren't
important
supposed
role
to
in that.
I see. And just for, I think the jury has heard about this term multiple times, but let's spend just a moment from your perspective defining what normal pressure hydrocephalus is.
Normal pressure hydrocephalus is basically an imbalance of the way fluid's managed within the ventricular system of the brain, and it can result in confusion or unsteadiness of gait when it's clinically applicable. But from an imaging perspective, that diagnosis is suggested when the ventricles seem to be disproportionately enlarged relative to the brain volume itself.
So from an imaging perspective, there was strong indication that Mr. Sanderson had normal pressure hydrocephalus.
It was suggested in every brain study he's had since 2009.
And is it a progressive condition? In other words, does it get worse with time?
Yes, it can.
And then I'm going to go to another image another report, a document that the jury has already seen. This one we looked at with Dr. Gibby. This is his report from March 3rd, 2021. Do you remember seeing this?
Yes, I reviewed this.
Okay. I believe it's also part of Gibby's packet in Plaintiff's Exhibit 31. What I want to point out, I think I called this out with Dr. Gibby. I want you to comment on it. There's a part of this report that says, I don't see any sign of shearing injury. Do you see that?
I see his report, yes.
And do you agree with that?
I agree with this report, yes.
Okay. And what do you understand Dr. Gibby's opinions to be as shearing injury is concerned?
So this report was performed on March 3rd, 2021, specifically looking for evidence of brain trauma. So that was the clinical history provided to Dr. Gibby, and he was looking in detail for any imaging findings that would support closed head injury.
And was shearing injury one of those?
Yeah, the things that Dr. Gibby would have been looking for, or that any of us would look for when we're evaluating a study in a patient with brain injury, would be shearing of the white matter tracts. These are very delicate tracts where if there's a rapid deceleration of the brain, those can shear. When they do shear, they deposit little microhemorrhages that leave blood products in the brain, specifically iron that's found in hemoglobin. So in another sequence, Dr. Gibby would have been looking for any evidence of iron deposition, which he mentions here, pathologic iron deposition. And then the other thing you would look for is bruising of the cortex of the brain. The brain does move to some degree with inside the skull because of it's bathed in cerebrospinal fluid. So if there's a rapid deceleration, the brain cortex can hit up against the skull and cause a bruise. In some cases, it can result in hemorrhage.
Good morning, everyone.
But in other cases, it can result in focal atrophy at those locations. So in this case, none of the imaging showed a contusion, no shear injury, and no evidence of pathologic hemorrhage in the brain.
What would you expect to see in a person's imaging after some kind of traumatic brain injury?
Well, it depends on the severity, of course.
Right.
In mild trauma, nothing.
Okay.
Isn't it hard to see Mr. Eaton now and not be singing songs?
How would you describe Dr. Gibby's
I want him to do this testimony on like a piano.
Trauma in his Mr. Sanderson.
I feel like we need to make a few parody songs. It's just like, oh my goodness.
And Dr. Gibby's
I loved your, like, I
specifically
can be your
was
yellow
looking
and
for
I can
evidence of
fix you.
trauma.
I was laughing pretty hard.
He emphatically states there is no
You got
evidence
it.
of
It's a Coldplay joke.
post-traumatic
Yeah.
brain injury in his report. Now, it is interesting because it
I used to think
contradicts to some
James was a
degree
lawyer.
his description in his deposition.
And how
also
does it contradict that?
Well, Dr. Gibby mentions that in his deposition that the white matter disease that we've reviewed is very typical of shear injury or pathologic brain injury. But yet in his own report of the imaging which was performed at his center, which is identical to the findings in 2017 where he was offering that opinion in his deposition, he emphatically states that there is no evidence of post-traumatic brain injury.
Objection. The state's prior testimony.
Overruled, the jury will have to recall the testimony.
Dr. Black, do you see on this report any indication that this image was compared to prior images?
No,
Is that common to do when you do a report, you compare it to prior images?
there were 3 imaging studies done after the accident. One was a CT scan done again at the Veterans Administration in 2016, which was compared to 2009. The imaging that was performed in 2017 and 2021 make no reference of comparison dating back to 2009. So I presume those images were not available to them.
Is that a problem? Does that lead to any limitations of a study if you don't look back at the prior studies?
It does limit the way that a neuroradiologist can interpret an image. If you have prior imaging, it helps put things into context and can narrow the differential or the possibilities in terms of a diagnosis. For example, in this case, knowing that the white matter disease pre-existed in 2009 is helpful to exclude that it's a result of shear injury from an accident in 2016. So yes, comparison imaging, when it's available, is of extreme importance.
So are you critical of Dr. Gibby for not doing that comparison?
Not necessarily critical. Those images just may not have been available to him. I think if you offer an opinion as to causality and you do have imaging that's available from the Veterans Administration and someone draws a conclusion without baseline imaging taken into account, that can alter someone's conclusion and lead to an error in how they're discussing why that abnormality exists.
And do you believe that sort of error occurred here with Dr. Gibby's opinion?
I do. I think he was limited by the unavailability or lack of comparison to the imaging that was done in 2009. Yes.
Okay, I want to move to another report. This is for that 2017 image we started with, the one with the green arrows that was taken at Dr. Fong's clinic. It's in Plaintiff's Exhibit 33, page 8. I don't know that we've shown it, so I move to admit it.
Plaintiff's exhibit which?
It's Plaintiff's Exhibit 33, page 8. And I guess 8 and 9. There's 2 pages. Just the report.
Just the imaging or the report? Which one? Which one, the plaintiffs or?
Exhibit 33, Fong's packet, pages
Well, all of
8
us are
and 9.
admitted, don't they? All of us are.
Oh, we did already admit it. Okay, great. I just know we didn't admit some of it. Yep.
Is 33 received?
That was
33 was not received.
I don't know what was going on. I'm a simple country lawyer. It was like, yeah.
And may I publish it to the jury, Your Honor?
No objection.
Plaintiff's Exhibit 33, page 8 is received.
And James, do you want it from start to end, or was there just one?
No, just
portion?
2 pages, page 8 and page 9.
Page 8 and page 9 are received.
Yeah, this is, again, the report connected to the image that we looked at first, taken at Dr. Fong's clinic in 2017. Is that correct, Dr. Black?
That's correct.
And I want to point to, I guess we should first ask the question we were just asking about Dr. Gibby. Do you see any comparison here?
No.
Okay, so the same points you made about the limitations of Dr. Gibby's report, you would say about this report, is that right?
Correct.
And if we call out this bottom part that's called impressions, I'd like for you to comment on whether you agree with these.
I do agree with these impressions.
And will you take us through them in layperson's terminology? Maybe we could start. We've covered some parts of the ventricles. Do you feel like you've explained that?
Well, I think we can. Let me just emphasize one other aspect of
Go ahead.
The ventricles. Also, I think it's important to note that the context of this study being acquired was specifically with the intent to look for any evidence of closed head injury or significant brain trauma. And so there are pertinent negatives that are pointed out by the radiologist who interpreted this exam that did not exist, like hemorrhage in the brain or evidence of a contusion. So there are pertinent negatives, even with the strong bias of looking for those because of the history.
So just to make sure I'm understanding you, that when you talk about bias, you're just saying going into this image, they heard a history of traumatic brain injury, concussion, so they're apprised of the possibility of various findings that might be associated with that, and they want to find them. They're looking for them.
Correct. That's correct.
Foundation.
Sustained for leading.
So maybe just comment on bias again, because that term is used in various ways. What do you mean when you talk about bias in these?
When I'm referring to bias, I'm talking professionally. When we interpret an exam, the clinical context of that exam or why that exam is being obtained is important to us. If somebody has an infection or if somebody has a brain tumor, then we understand that and we're looking for various findings that would support that. In this case, if somebody has known trauma, then that would alert the radiologist to look for certain findings. So in the case of the MRI performed in 2017 and the one performed in 2021, there would be an alert to look for findings related to trauma. So the negatives, the pertinent negatives in the exam from 2017, just like the one that was performed in 2021, would rule out imaging evidence of significant head trauma.
Yeah. So in other words, they're looking for trauma, but they did not find it. Is that
yes.
Okay, so let's go to these findings again. Here in number 2, there's normal pressure hydrocephalus. We've talked about that. But there are a couple other things. Normal aging brain, Alzheimer's dementia, subcortical arteriosclerotic encephalopathy, multi-infarct dementia. Did I read all that correctly?
You did.
And those are some big words. Can you comment on those to help the jury understand what these are doing in this report?
Well, some of these are clinical descriptors, which would require a neurologist to make a correlation by examining that patient, because imaging can show a lot of things that don't necessarily manifest in someone clinically. So it's important to always take it into clinical context. The one description here that actually reflects underlying pathology would be the arteriosclerotic encephalopathy. That's just a big word for diseases of the blood vessels, specifically plaque or hardening of the arteries. The comprehensive workup that was done at the Veterans Administration in 2009 did show evidence of vascular disease at that time in the carotid arteries in the neck and also in the brain. And at that time, the white matter disease, which again was present over a decade later, was attributed to vascular disease.
Did you see any evidence in the imaging that correlates with vision problems?
No. There was mention of it with the functional MRI, but that is beyond my expertise.
Okay. You'd leave that to a neurologist to speak to, somebody else?
Somebody has who expertise in functional imaging.
Okay. Okay, so you can take this down, I think. Did you note anything in the... Well, let me ask first. Are you aware that Dr. Gibby actually met with Mr. Sanderson?
I'm aware of that.
And is there anything about that meeting that has any bearing on your opinions today?
The only bearing it would have is that Dr. Gibby makes mention in his report that he had told Mr. Sanderson that it's possible you could go through all of this workup and not find any evidence of post-traumatic brain injury.
And why would that be significant to you?
Simply because obviously the intent of that workup was to specifically look for evidence of brain injury.
I believe the jury's heard Dr. Gibby give an opinion that I want to see if you remember and what your comment might be, your response to it might be. If the images prior to the accident are similar to the post-accident imaging, in other words, if the imaging prior showed things that were post-accident, would that mean that you cannot say the prior findings were caused by the accident?
Objection leading. Ms. State's prior testimony.
As to leading, sustained.
Okay. So do you recall Dr. Gibby giving an opinion that if the pre-accident findings the post-accident findings are found in the pre-accident imaging, that you could not say that the post-accident imaging was caused by the accident?
Objection leading.
Sustained.
Okay. What do you recall Dr. Gibby saying about the relationship between the pre-accident imaging and the post-accident imaging?
My opinion on that would be based on his deposition. If you'd like, I can read 2 areas of his deposition that I think answer your question.
Sure, go ahead.
So,
Sustained.
Okay, so let's just ask you this question. Do you have any opinions about whether the post-accident imaging findings can be attributed to, from an imaging perspective, the collision, the ski collision?
Objection leading.
Overruled.
we ask that again.
Yes. Do you have any opinions about whether the post-accident imaging findings can be attributed to the collision?
Yes.
What is that opinion?
That those findings predate the accident and date back to at least 2009, as confirmed by a comprehensive imaging workup of Mr. Sanderson's brain performed at the Veterans Administration Hospital.
And so do you believe those post-accident, I apologize that I keep messing this up. You believe that those post-accident imaging findings are in any way related to the collision?
No.
And what was the reason for that 2009 workup, to your knowledge?
Unfortunately,
Welcome again, Kurt. What's up?
Mr. Sanderson
Hey, good morning.
had suffered a retinal artery occlusion, a central retinal artery occlusion.
Here to be tortured with us
Really
again.
a really good start this
Blindness in
morning
one
with this
eye,
expert.
and so
I
he
really
was
like the way
undergoing
you're
a
going
workup
about this.
for risk
This
factors that would
expert,
relate to
by
that.
having this prior data,
Okay.
is really able
And,
to say what is or is not due to this injury. And
do
this is just
you
really
know
good
any of the
data,
people
so-
that have done any of his imaging?
I'm familiar with him, yes.
Yeah, and so that 2009 workup, or do you know the people that did that workup?
Yes.
And do you trust the findings that they came to?
Yeah. They're very experienced and well trained, yes.
Okay, great. That's all the questions I have for now. Thank you.
Nice, concise.
Yay!
Point, clean.
What's your point?
He does a very good job of dismantling the other expert by just simply saying, well, he didn't have all the data, so that's why he drew the wrong conclusion.
Yep. It's hard to argue too.
At the
No,
end,
honestly, it's like,
you're not an eye doctor, are you?
I'm not.
Ooh.
And you said the imaging
neither are you.
from the retinal artery occlusion means blindness in the eye. Does that mean total blindness? Or?
That's beyond my expertise, and I'm not familiar enough with his clinical condition to comment on that.
So your
I
term
assume it would be
blindness
enough
is
to
probably
qualify
a
being
little
legally
broad.
blind.
Broad. I only gained that from the histories that were provided with his imaging studies.
Okay, so he may still have some vision in his eye, even though.
Absolutely.
Okay. So I just wanted to point that out.
Okay. Bueller, what's going on?
Do you have any other questions, counselor?
Let's see. Is it true you were a partner of Dr. Wendell Gibby's?
Yes.
And how long ago was that?
It's been probably over 10 years.
Okay. And so you know his work, correct?
Correct.
And you're not critical of his work in general, are you?
No, not at all.
Okay. You never conducted an exam of the client, Terry Sanderson.
No.
You understand there was a sudden change after
can
the
read a
ski
brain
crash in
scan, though.
Terry Sanderson's
Yeah.
condition, brain health.
From my review of the records, that's my understanding.
You understand that through, you read before and after witnesses who confirmed there was a sudden change after the collision, correct?
Would you mind asking that again?
Did you read before and after witness testimony? You
No.
didn't. So you didn't read. Isn't before and after witness testimony important to understanding someone's brain injury?
I think it's very important, but it was beyond the scope of what I was to do. I concentrated only on his imaging.
Okay. So you didn't have the before and after information that would improve the diagnosis that you might, or the opinions you might give today in court to this jury.
I understood that with respect to the imaging, we were looking for evidence of brain trauma as would manifest on imaging, and so that's where I concentrated my focus.
Well, you said that MTBI may not be shown on an MRI. True?
A mild brain injury?
Yes.
Correct.
Okay. So Dr. Sanderson could have a brain injury, mild traumatic brain injury, and it not be shown up on imaging, right?
That's correct.
Okay. Now, the 2009
You could also
imaging,
have an invisible
it was
teapot
asymptomatic, true?
circling a planet
Again,
somewhere.
I don't understand. I'm not the clinician who examined him at that time, and I can only look at his imaging in the context of the information, so I don't feel qualified to answer your question.
Thank you. So from the imaging from 2009, 2017, 2021, there's no change, right?
Very little change.
Okay.
It's bad for you. It's a problem. It's bad.
Dr. Black, no one's given a diagnosis that Terry Sanderson has clinical NPH or normal pressure hydrocephalus, true?
I don't know that for sure.
Okay.
We talked about the water in the brain
So the,
yesterday, though. That was confirmed.
NPH was not clinically diagnosed by his VA doctors, as far as you know, correct?
As far as I know, it was only suggested, well, it was suggested in most of his imaging studies, but I don't know what clinical correlation was made.
Okay, and so clinical correlation means that some specialist at the VA or elsewhere that understood his NPH was showing symptoms, correct?
That's correct.
Okay. So you don't need pathological evidence of to have a MTBI, correct?
When you say pathological, are you saying imaging evidence?
Yes.
That's correct.
I feel like I'm watching this in slow motion.
He's so slow.
Like,
Dr. Black,
oh my gosh.
imaging can show a lot that
He just seems
that
so
hasn't
dumb.
really manifested or shown up. correct?
We state that one more time.
Throwing shit on the wall.
Imaging can show a lot of things that
Nothing
hasn't
definitive or confident about this
shown up
lawyer.
in
Well,
a clinical setting.
seems deflated.
Correct.
So Terry could have these problems that
I
show
don't
up
like
on
Droopy the
imaging,
dog here.
but there's no symptoms that would affect him from or stop him from skiing, for instance.
It's possible, yes.
Let's put in a plug for Toastmasters right about now. If you need help with your public speaking skills, Toastmasters is an outstanding organization that can really help you, and it's very inexpensive, so something to look into.
Oh, that was like a food delivery. That's something else.
Say, do you have a promo code?
That was,
And in
that was
general,
more for the attorney's benefit.
You would
than,
prefer to
yeah.
have an actual exam of the patient to render your opinions true?
I think that imaging correlated with a clinical exam is the correct way to assess a patient's condition.
So you would prefer to have an exam, correct?
Yes. Well,
Yeah.
I think they correlate.
Okay.
The information's valuable in both circumstances, but optimally in decision making, you want both types of information.
And so your opinions are not as strong as they would be without this exam, right?
Without a clinical exam,
Yeah.
my opinions are certainly limited to his imaging.
Thank you.
You bet.
Thank you, Mr. Bueller. Mr.
Bueller?
Egan?
Bueller? Mueller, isn't it? He's calling him Bueller?
Dr. Black, you were asked about before and after witnesses, the family members. people close to Mr. Sanderson before and after the accident?
I'm not sure I understood that question, but...
Okay, well, my question is just whether opinions from such witnesses would affect your read of the objective findings in the images.
No, they would not.
And what about if you actually met with Mr. Sanderson, would that change the objective findings in the images?
No, because I would defer to a neurologist or a neuropsychologist, someone who with that kind of expertise to evaluate Mr. Sanderson. My area of expertise is in brain imaging.
Do you typically evaluate patients when you read their imaging?
With regard to brain imaging, no.
And then after, let's see. I guess we did show one of these boards, but you didn't get to see it. I want to make sure you see it so the jury knows that you've seen
okay.
it. And I'll show you. This is 101G, and these are the same. Are these the same images we were looking at on the screen?
Yes.
And they show that before there was a finding that was also after the collision. Is that right?
Correct.
Okay, so I think the jury's already seen this. And then we also have two more boards which we didn't show. Your Honor, I move to admit 101H and 101I for demonstrative purposes.
No objection.
Defense Exhibit 101H and 101I, or is this plaintiff's exhibits?
These are ours, yes.
Defense exhibits are received for demonstrative purposes?
So I'll show you first, Dr. Black. Is this the same idea as the board we just saw?
Yes.
Okay, just with different findings?
Yes.
Okay, and then that was 101H. And
Objection beyond the scope.
Overruled?
And then this is 101I. And it's
yes.
the same idea?
Yes.
Okay, so I'll just show the jury 101H, 101I. And then my last question for you, Dr. Black, is whether after questioning from Mr. Bueller, you have your opinions about these objective findings you've been discussing on the imaging changed?
They have not.
Okay, thank you.
What now?
So earlier you said you preferred to have objective findings from a neurologist or neuropsychologist, correct?
For clinical correlation, absolutely.
Yeah, for clinical correlation. Would you defer to someone like Dr. Goldstein?
I mean, I don't know him, so that name doesn't mean anything to me.
He's a neuropsychologist who testified in this trial. You didn't know that?
No.
So Dr. Goldstein provided clinical correlation, and that would help your opinions if you had that, true?
Sure. I mean, if somebody has expertise clinically that I don't have, but it doesn't change how I interpret the images or my view of these findings.
So your opinions are limited to your view of the images and not the clinical findings, true?
Correct.
Like he said before,
Wow,
right?
that was just so insightful.
You may be
Thanks.
excused.
That's
Thank
great.
you.
Our lives are forever changed.
You can call our next witness or take a brief break.
Is this witness going to take a bit?
Robert Hesh, sorry. And I would think I could be on and off in a half hour, I think.
Okay. Why don't we go ahead and take a break because there will be cross-examination, I'm sure. We'll take a recess now.
Start it. Jesus.
Owen sounds awful, though, today. He's going through it.
Well, Clark Kent lawyer continues to shine. He did a very good job on direct. He came in, he got what he needed. He got out before he overstayed his welcome, which is definitely not a trait that many lawyers have, especially with experts. They'll go on forever and beat it 8 different ways. But I kind of like this style better. I think it was more effective in balance. I also like the data and just the blow ups. I mean, those cost money, but it's very effective for the jury to be able to see them in large size, be able, here's image A, here's image B. You can see that there's not much difference between image A and image B. And here's an expert to tell you there's not much difference between image A and image B. And here's, this image is from 2009, which is well before the accident. Here's an image from 2017, which was after the accident. You know, so there's not much in it. So whatever's happening in terms of brain injury, it's like, first of all, where is the brain injury? And second of all, if there is, it's so minimal, it's not there. It's like, is it possible there's injury that's not on the MRI? Yeah, but, you know, absence of evidence and everything, so.
I think the other thing that got me so much when they were focusing on this idea of that, you know, meeting with the patient and talking to the patient. And normally I would say, yeah, that is important, but we've already established that Terry lies to his doctors. So the people that have had the clinical sit downs with him, their testimony and their knowledge has basically been dismissed because we know he's been manipulating it. So maybe in this case, the better thing to focus on is the scans, because scans don't lie.
Yeah.
Right? Like, that is just kind of, and that was why I had a lot of issues with that one doctor that analyzed his concussion and had the clinic, like with Tom Brady and all of that, because she was so open that she's like, I listened to what he had to say and I diagnosed it accordingly. And it's like, but scans matter. And I feel like now we've kind of gone back the other way, and it's like, this is weird. Like, you know what I'm saying? Does that make any sense?
Yeah, it makes total sense to me.
Yeah, like, I don't get it. And it's just such a stupid thing for him to be fighting about at this point when we have established so strongly that Terry is a liar.
Right, he's admitted it.
Yeah.
Kind of nuts.
Yeah.
What were your other takeaways today from this expert, though?
He had white matter in his brain before the accident.
Yeah.
That's it. Janabal just saw the judge isn't wearing a bow tie today. He's not. He has like an actual tie and then like a patterned shirt on underneath. We hadn't seen that before.
I hope he didn't take our criticism to heart.
No, I've been commenting on his bow tie every day. I'm like, it's another bow tie.
I noticed that all black on black lawyer wear different choices today.
Oh,
man bun.
Memo.
Yeah, man bun.
Man bun, yeah.
Spring Storm in the chat just said, I love the professor behind Kim, my blue professor. Yes, he does have jelly beans. They're in his satchel.
I have no idea what that means.
It's a YouTube show, and the character itself has jelly beans, and I get that question from time to time. That does he actually have it? And yes, I committed. It's as close as you can get.
There you go.
Yeah, there you go. What were your thoughts this morning, chat? What did you guys think? I'm just taking a look and seeing what you guys are talking about.
Sorry, I'm also trying not to multitask, but I just did for a second. Now I'm back. So this guy, where are you? This guy did seem much more credible.
Yes.
I do feel like they are doing a good job at bringing in more credible witnesses. And every time Bueller steps up, he really just bumbles it. Like, it just, is that just a bad lawyer, bad firm? What do you think? I mean, am I being harsh, Kurt? I mean, or do you getting the same sense that he's just unprepared and bumbling around trying to discredit credible witnesses?
Well, he certainly comes off that way. His cross doesn't seem well prepped. It doesn't seem well organized at all. You know, most lawyers, when they're doing this, will write out a series of questions because they'll see depositions. They've done depositions before in civil cases. They've had depositions and know the answers to many of the questions, and they've seen reports and they've consulted their own experts who will say, okay, I disagree with this. Maybe he couldn't find anyone to disagree with it, which is sad. So maybe there's no questions to be asked, which is sad. But if so, then you just don't ask any questions. The way he's going about this and fumbling around, it just seems unplanned, unorganized. There's no confidence. It's not, you know, we're a long way from Camille Vasquez. That's all I'm saying right now.
Yeah.
Yeah.
Facts.
She's someone who prepped her questions. She had prepped them. She knew what she was going to ask, and she knew what the answers were. Because when she got the answer that wasn't what she was expecting, she knew exactly where to go look. See, that's when you know that you're well prepped. Every question is prepped, and you know the answer because it's in a prior deposition or a prior thing. And so you just put a little cross-reference next to the question. This came from, their affidavit, page 5, line 8, or whatever it is. And so when they're like, okay, that's not the right answer, let's go to the tape, and you pull the thing and you got it and it's right there, and you show them to be morons and you move on with your life. It's great.
Mm-hmm.
It's not necessarily hard. It just takes a little bit of work.
To prep. No, absolutely.
Yeah.
People don't like to prep anymore.
Yeah. It just takes time because you got to go through everything and you got to read everything and you got to write your questions and you got to figure out the order of the questions. You got to figure out the story that you're trying to tell with your questions. Storytelling is a big thing I'm into in trials.
Well, especially if you're not getting paid, right? Because the problem is you're assuming they're working pro bono or contingency rather. And if they're not getting paid at this point, is there a point you think that they're maybe just checked out? Or is this a point where they should be stepping up even more and working even harder to try to get that payday? Or is it like, let's just call it a loss?
I don't know what's going on in sort of their psychology of the thing, but it just feels incomplete. It feels a little lazy.
Yeah. I mean, I think after yesterday too, just like, it sounds so stupid.
This should have been done months ago, though.
Yeah, like it just.
There's only
ready
so
for
much
the
you
jury
can do the night before.
Once you let them know, whenever they're done. They're still cycling through, I think.
Your Honor, could we wait a few minutes for the warrants to be back?
Yes.
Sorry, guys, I gotta
So
jump
maybe
for
just
1
have them
second. I'll
hold
be
at the
right
door.
back.
Okay.
Sure. Yeah, they're still doing a few things, Mr. Sykes. But
False alarm. They're like, nope. You guys will wait even longer.
Yeah, but during trial, attorneys will often burn the candle at both ends because they're just obsessing over every detail and trying to adjust to things. But there's only so much you can do. You gotta try to. It's a little bit like a military general with a battle. You've got to prep and you got to try to think about everything. And the plan will only survive first contact with the enemy. But if you've thought about everything, or try to think about everything, hopefully you're not having to adjust too much on the fly.
Right.
okay, whenever the jury is ready, we're ready.
There was a little backup.
Yes. They're not quite ready either, so. Thank you. Mr. Owens, you may call your next witness.
Your Honor, we call Robert Hesch to the stand.
Thank you. Dr. Hesch, if you could come right up here to the clerk and be sworn in.
Do you swear that the testimony you are about to give in the case now before the court will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you.
Good morning. If you could start by stating your full name and spell it out for us.
My name is Robert Hesch, Roberthoesch.
Doctor, nice to see you. What city do you live in?
Salt Lake.
I'm going to take this off. I do have a cold, but
What's your current position?
I'm currently the Chief Medical Officer for Intermountain Healthcare in Utah and Idaho.
Does that mean you're the top MD for all of Intermountain Healthcare?
In Utah and Idaho.
Okay. You're pretty young, aren't you? How old are you?
48.
When I hired you on this case, you didn't have such a prestigious title, did you?
No, I did not.
What were you?
I was a neurologist at Intermountain Medical Center and the leader of our neurosciences program at Intermountain.
Good for you. To be clear, you are not here on behalf of Intermountain Healthcare, is that right?
Correct. My opinions are my own.
Thank you. All right. Just undergrad, where was that briefly?
Undergrad, University of Maryland, College Park.
In what subject?
Cell and molecular biology and genetics.
What a nerd.
I am a neurologist.
Kidding. Poli-sci is the nerd thing. All right, good for you. And then your MD degree was where?
University of Maryland in Baltimore.
And what did you choose to specialize in?
Neurology.
Okay, and how many years? So 4 years undergrad, 4 years med school, then how many more years?
Well, then I did a PhD for 4 years as well.
Oh,
in that
did you?
time, and then went across town to Hopkins for my neurology residency. So that was another 4 years.
What a nerd. All right.
What
4
are
years
you doing?
in doctorate. What's that? In?
Neurology.
Okay.
And
Wasn't
then,
cute
and
the
then 2 more
first time.
years as a fellowship in critical care.
But did you say there were years after undergrad before med school?
No, it was during med school. I did my PhD.
Okay.
Nerd.
Not all MDs do PhDs too?
Nerdlinger. I mean, isn't this almost making him
Okay.
seem a
That's a lot of training.
negative?
Fellowship was in what specifically?
Neurocritical care.
All right. So neuro critical care. This is like when people hit their head and they're in big trouble.
That's correct.
Or they get a stroke, they're in big trouble.
That's right.
They call you in, and you sometimes you
"Nerd."
think you're gonna go
Could you ask
go
the
swimming
questions
for
in a
fun,
less
and you just get
patronizing
called
way?
in for
That'd
like
be great.
14 hours straight
That's right.
to work on one patient.
Nerd.
Right.
All right, married, kids.
Yes.
Oh, really, nerd? I'm surprised, nerd.
Have you reviewed some materials in this case?
I have.
All right, so the jury just heard from a neuroradiologist, and you are a neurologist. Okay.
And a nerd.
Distinguish the two again really quick.
So a neuroradiologist reads images, MRIs, CTs, X-rays, all kinds of images of the brain and the spinal cord.
Okay. And you, neurologists, do what?
We
You should go on
diagnose
Nerd
and
Report,
treat
huh, guys?
conditions of the nervous system, so brain, spinal cord, peripheral nerves.
And then this afternoon we're going to hear from a neuropsychologist. What's that?
A neuropsychologist diagnoses and treats disorders of consciousness and awareness and language that are related to neurological conditions.
And do the three of you work together on hard cases?
Yes.
And do you rely, for
Bring back
instance,
Clark Kent.
on a
He's better at
neuroradiologist
this.
and a neuropsychologist all the time?
Yes.
Okay. You know I was kidding when I said nerd. Really, I'm praising you in a backward way. I apologize if that sounded passive aggressive.
We call ourselves nerds. That's okay.
All right. You were here for Dr. Black's testimony on the neuroradiology. Is that true?
Yes.
And one of his opinions was that Mr. Sanderson's brain problems that he complains of as a result of the collision were actually all pre-existing. Did you hear Dr. Black say that?
Yes, I did.
And do you agree with that opinion?
Yes, I do.
Let's talk about what you've reviewed. So I think yesterday you told me you had received some 3,000 pages of junk. Just kidding. Materials, right?
What is
Correct.
he doing?
And a big chunk of those
He's
were medical
checked out like
records,
I
and a
am.
big chunk of those
What
were
the-
depositions.
Correct.
What are you doing?
And then you also received a lot of
what do you mean,
images
just kidding?
before
What-
and after.
What is going on?
That's correct.
And did you review all of that?
Yes, over several years.
All that junk, you nerd.
Do you believe you have foundation to render the opinions you're about to render in this case?
Yes, I do.
In addition
thing
to
that
what
you're
you've
paying him
reviewed, your background, education, training, and experience, do you believe that all comes to bear in rendering the opinions you're about to give?
Yes.
Are you going to ask to admit him as an expert?
So, Your Honor,
Good point.
I think this will be most efficient. He's prepared a written report that has some headings, and I would like to just go to the and have James bring up just the headings.
Well,
I guess the answer to that question is no. We're not going to admit him as an expert, but he's going to offer expert opinions anyway.
I think, are we talking about a demonstrative exhibit to illustrate this witness's testimony?
No, we're talking about just the headings of his report.
All right.
Reports are not admissible.
Not admitting them.
Agreed, but I think it might be efficient to do it that way. It's no different than the witness walking up to a chalkboard and writing the words out on a board. So I'm fine with it. If you just show the headings.
Thank you. So, did you prepare a written report, by the way?
Yes, and I have it with me.
And it's broken down into some headings?
Yes.
And I thought this would be helpful. Can you read heading number 1?
The persisting neurological symptoms Mr. Sanderson
At this
reports
point, I'd be such a dick.
since
I'd
the
stand up and
February
be like, objection, he
2016
hasn't been
ski
admitted as an
accident
expert.
are likely attributable to pre-existing health conditions.
Okay. Is that indeed your opinion?
Yes.
And on what is it based?
So based on my review of the records, his mental health professionals that evaluated him before and after, if you look at the trajectory of those evaluations, it looks essentially the same before and after. Also based on review of the imaging, and afterwards the neuropsychology testing that was normal or above normal compared to population.
Okay, let's hit all of them, and then we'll go back if needed. Are you able to bring up 2? Well, he brings up number 2. Comment upon the patient's pre-existing injuries. Which ones did you find particularly important?
The pre-existing condition of depression and anxiety is the most salient.
Okay.
Pre-existing condition.
And how is it that his pre-existing depression and anxiety
Sorry, didn't mean to do that.
is related to his complaints of post-collision symptoms?
So the depression and anxiety can cause all of the symptoms that he is complaining of post-collision. And if you look at the records and you were able to remove the collision, just so you just make it evaporate, the history reads coherently. This is a man in his 70s with depression and anxiety, and it's gotten bad enough to the point that it's impairing memory and concentration and other activities that he was used to doing.
So is another way of saying that if we removed the collision, he never had a collision that day, it still makes sense, his trajectory?
Right. If you read the medical records from before the injury through now, and you remove the injury, it doesn't change the trajectory of his complaints.
So
his
for
evaluation
instance,
by his health professionals.
For instance, if we look at his medical record, let's say just 2 weeks before, 3 weeks before, did you know he went to the VA doctor that day?
Yep.
With complaints of, I'm feeling really old, I can't do what I used to be able to do. That was pre-injury, correct?
Correct.
And then you compare it to his records even soon after the collision. You're saying it doesn't really show anything happened, correct?
Hasn't changed his course.
Okay. And whenever you're ready, James, can you read your opinion number 2?
The only neurological problems, Mr. Sanderson.
I object to reading a report to the jury. You can tell it. No problem with that. But you shouldn't be reading it.
We already dealt with this.
Yeah, overruled. I think I ruled on it.
Go ahead.
The only neurological problems Mr. Sanderson has had maybe partly The only neurological problems Mr. Sanderson has had that may be partly attributable to the ski accident are those associated with the mild concussion he experienced during the accident.
Okay. Can you fill in the meat on those bones? Help us understand that a little.
Yes, so my opinion is if he had a concussion, it was very mild. More likely than not, I would say 95% or more that he would have made a full recovery from that concussion within a few weeks. Not more than 99% within a few months, based on the severity of the concussion. So,
I think he's saying, I'm in that like 1%. I'm not in the 95 and the 99%. How do you respond to that?
So I would say, if as a neurologist, I have patients that come in. They complain of cognitive symptoms, memory loss, attention problems, difficulty doing things that they used to do, and they can have depression and anxiety. They may have early signs of dementia. Those things are far more common for someone in Mr. Sanderson's category. Man in their 70s, they don't feel the way that they used to feel like they're getting old, like he said before the accident, or after the accident, concerned that they may be getting Alzheimer's disease. So I think those things are far more likely than a very minor concussion causing symptoms 7 years later.
Do you see hundreds of those patients a year who've never had a ski
bitter
collision?
old man.
Correct.
Which I understand. I'm a bitter old man.
Okay, any other comment on your opinion number 2 that you would like to make?
No, I think that concludes it.
Thank you. James is going to bring up number 3.
So how much NyQuil is Owens on right now?
Too much.
He grabbed the wrong bottle. He grabbed NyQuil.
And do you have it there?
I do. Should I just read it?
Start reading it. There you go.
The neurological problems associated with the mild concussion Mr. Sanderson may have experienced resolved within months. They were not permanent, as plaintiff's experts claim.
Okay, mild concussion. You weren't here, but did you hear Dr. Edgley testify or read his deposition?
I've read the deposition.
All right. So did he talk about, hey, a couple things we look at is length of...
I didn't like the testimony
There's
earlier
no deposition.
We get old. We get old and we're decaying.
Okay.
I did like that testimony very much.
I did misspeak. I forgot you didn't take his deposition. Is there some importance in determining the severity of concussion in terms of how long they're unconscious? Is that a factor?
Yeah. Length of amnesia, length of loss of consciousness, or length of confusion.
All right. I think those were the same 3 he said. All right. What do you know about length of unconsciousness?
From my assessment, looking through the records, I don't think that there was loss of consciousness.
Okay. even if there was some loss of consciousness, it would have been brief. Is that fair?
Seconds, yeah.
And let's see, in terms of, I think, to be fair, I think Mr. Ramon said he was spread eagle, head down, out cold, over 2 minutes. I just want to put that in the record. Not substantiated by any other witness, but did you at least observe that?
Yeah, you know.
Well, Your Honor, I object. He's not competent to assess someone's credibility, and he wasn't there.
Welcome,
That's
Mary.
what I'm going
Planeteer.
to.
Woo!
Why don't you clarify your question?
I'll get to your comments in a few, guys. Keep them coming. Thanks for the support.
What do you know about that? Isn't that someone saying longer period of unconsciousness?
Your Honor, he can't comment on.
I'm actually trying to help the plaintiff.
Well, don't do
Go
that.
ahead.
He's not asking you to comment on whether you believe the witness. He's asking if you remember reading that.
I do.
Okay. Is the significant time to be unconscious, is that 5 minutes or over?
Yes.
All right. And then comment, you said period of amnesia. What do you understand on that? Length of amnesia. What do you understand?
The period of time that the person that has the injury is not able to remember either before or after the event.
All right. And are you acknowledging that Mr. Sanderson had a mild concussion?
It's more likely than not he did. He had headache in one of the, I think it was the Instacare report, and so that would be consistent with a mild concussion.
And it resolved within months. What do you base that on?
I believe there was a report where he said it's getting better.
Okay, and they are not permanent, as plaintiffs claim. Please comment.
Correct. So the head injury was very mild. I mean, it fell in the most mild category of concussion, so kind of a grade 1, and the rest of the symptoms that he has, what could be caused by other conditions, which I would say are more common.
And do you believe that more likely than not, that is why he continues to have some symptoms?
Yes.
In other words, not because of the ski collision, but just because of his aging, progressive brain.
Correct.
Let's read your fourth opinion. There are a total of 6, by the way. And the latter 2 we might just touch on briefly.
So the fourth opinion is that Mr. Sanderson does not currently need ongoing neurological treatment.
That's related to the ski collision?
That's related to the ski collision. So I will, yeah. So I have to modify that slightly because this report was written before
just saw your comment in the chat.
the assessment.
Wonderful. You guys have a wonderful day.
By Dr. Goldstein was available to me.
Right. Goldstein, I think, recommended some care with regard to dementia.
Correct.
Did you hear that personally?
I didn't hear it personally, but I read it in his actual report from when he evaluated Mr. Sanderson.
Do you believe Mr. Sanderson to have sort of dementia symptoms?
Yes.
Your Honor, he's never evaluated him. Can't possibly comment on that without a clinical evaluation.
It's a speaking objection.
No foundation.
Is it in the report?
Do you have symptoms? So he's commenting on his further needs, and he's commenting on Sam Goldstein.
There's nothing in the
Why don't you
report.
ask a question,
Nothing in the
then we'll
report about
see.
it, Judge.
Go ahead and ask your next question.
Okay, so you said Mr. Sanderson does not currently need ongoing neurologic treatment, true?
Correct. That's what the report says.
Okay. Since you wrote this, did you then read Sam Goldstein's updated opinion?
Yes.
Objection, Your Honor. Can't offer new opinions.
Sustained.
Thank you.
Is there a drug that treats dementia?
Yes.
What is that called?
It's called Excerpt.
Your Honor, I object. There's no opinion on dementia.
Sustained?
Thank you.
Why is it your opinion that Mr. Sanderson does not currently need ongoing neurologic treatment related to the ski injury is the addition you made?
The ski injury caused a mild concussion, more likely than not, that was self-limited. And his ongoing symptoms are more likely due to ongoing pre-existing conditions and possibly new conditions.
Let's bring up, if we can, D106.
Has it been received?
I don't think so.
No, it has not.
D106.
Any objection?
Can I see it? Oh. This is for demonstrative purposes only? Sure. Okay. That means we can also write on it, can we not?
Why don't we address that if we need to later?
Thank you. There's a lot missing.
Defendant's Exhibit 106 is received.
They want to write on the man's whiteboard. They want to write on his
Yep.
And do you have
his
it in
white
front of
poster
you?
board.
May I approach it?
Can't resist writing on things.
I want to make sure you can
Dude,
see
just
it.
like
And James,
go to
if you
Dollar
bring
Tree and
that,
buy a
that
couple
would be
Bristol
good.
boards at least. You know, try to do something. Stop taking their stuff.
Oh, yeah, we can
I
wait
think you
for
might
it.
see it right on your monitor.
Okay.
D106, James. All right. I got it. You see it?
Yep.
I won't get you a hard copy now. Have you had a chance to read this document?
Yes.
And do you agree with it?
Yes, I do.
It's entitled Mr. Sanderson's Brain Imaging Both Before and After Ski Collision. Did it show atrophy, loss of brain cell sign of aging brain before and after?
Yes.
Did his images... I actually have a roaming microphone, but maybe it needs to be higher up. Volume loss, diminishing brain size, sign of aging brain. Did he have this before and after?
Your Honor, I object to this testimony. This witness is a neurologist, not a neuroradiologist. I don't think he's competent to comment on radiology readings.
I could establish foundation if you want.
Go ahead.
Do you look at images all the time, all day?
All day, every day.
So the neuroradiologist reads them, but do you just rely on their written report, or do you personally read them too?
I look at the films, then I confirm with their report, and then I bring it together with what we see clinically.
So I think the objection is somehow that you're not competent to talk about the imaging before versus after. Do you agree or disagree?
I disagree.
How so?
So I've looked at the images. These are pretty standard MRI images that we see every day, and a major part of my practice as an outpatient neurologist was evaluating patients for dementia and specifically NPH. Saw hundreds of patients with the question of whether they had NPH.
Which is that hydrocephalus?
It's the hydrocephalus at the bottom.
All right. So is it true that neuroradiologists essentially serve you? They don't personally talk to patients. You order the neuroradiologist to do a study, then it comes back to you, and you are the one who's face-to-face with the patient.
Correct.
Thank you, Lee.
I translate the...
Just a second, sir. I'm sorry. Sustained as to leading.
Okay. Have I established sufficient foundation?
This does have the scientific, technical, or other specialized knowledge that will help the jury, so you may proceed.
You know what would have been
Okay, we
great
talked about
is if you
atrophy and
admitted him as
volume
an
loss.
expert and you
Enlarged
find the area of
ventricles.
expertise when you
A ventricle is
stand up
what
and
in
really
the brain?
helpful.
Is that like at Halloween when we see a mold
This is
of a
bad
brain?
lawyering,
It's
and it's
the
making me sad.
It's the little gooey stuff going out? You tell me.
No.
Okay.
It's inside the brain, there's fluid-filled sacs that contain spinal fluid.
Okay.
So it's the black thing in the middle on the MRI that Dr. Black went through.
All right. And is that like the main blood feeding the brain? What are they?
No,
What purpose do the ventricles serve?
They buoy the brain, so it prevents the brain from having as much shock when we just move around in everyday life.
All right. Chronic microvascular disease, is that something he had before and after?
Yes, that was described by Dr. Black.
Is that associated with cognitive decline?
It can be.
And why does he have that? Is that from this stroke event years earlier, or just bad luck, or eating too many donuts, or what?
I think it's a combination of his high blood pressure and high cholesterol with a little bit of genetics that makes our blood vessels harder than average.
White matter disease, we've talked about that a little bit. It says they're damage to nerve fibers associated with memory, balance, and mobility issues. Did he have that before and after?
Yes.
And is that progressive in nature?
It didn't look that like unbelievably progressive. It looked stable over time.
And why did he have that? Was that associated with the stroke event?
No, I think it's probably associated with the chronic microvascular disease. The stroke event was in his eye.
Okay. No evidence of trauma before or after. Is that true?
That's correct.
Concern for disease due to excess fluid buildup. That's the NPH. Was that a concern before and a concern after?
Yes.
Does he in fact have that condition?
So that would be a condition that I would need further clinical evaluation to determine, but his MRI would be consistent with that condition.
You mentioned earlier that his conditions are not permanent, as plaintiff's experts claim.
Sorry.
And I just want to comment, do you believe Dr. Fong to have used unreliable science to make some of her opinions?
Objection, leading.
Sustained as irrelevance.
Irrelevant.
So if I sustain an objection, just hold on. Sorry. Thanks.
They're about to get up and criticize you for not seeing this patient. Why didn't you? Why wouldn't you? Why would it be necessary if you needed to?
Yeah, well, I would always
Objection,
be willing.
compound. What's the question exactly?
Actually, didn't know that was an option. But in this case, and with many patients in my practice, we review tons of records before we see them. And actually, Mr. Sanderson probably had 10 times the amount of records that I have before I see my patients in clinic. You said 3,000 pages and lots of imaging. So I can know with 90% certainty going in based on the before and after imaging, the neuropsych testing over a period of years, his reports over time. I can know with 90% accuracy what's going on. So if I went in there, I'd be trying to figure out, does he have NPH or not, and what can I do to help him with his depression, anxiety, and other memory problems.
Would you be treating him or evaluating the ski injury?
No, I'd be providing counseling that the ski injury was not part of it.
Now, you refer people all the time to neuropsychologists, is that true?
Yes.
And we're about to hear from two. But you did have the benefit of multiple neuropsychologist exams at the VA, is that true?
Correct.
And do you know them to be good neuropsychologists?
I don't know them.
Okay. Do you know them to be not hired by either side, his normal treating providers?
Yes, that's my understanding.
And these were voluminous evaluations, were they not?
Yes.
And what did they conclude?
They were essentially normal, and they showed that he was performing above average.
Now, is that above average for everyone on the street, or for 75-year-old men with college educations, or what?
For a 75-year-old man with college educations and
okay,
with a high baseline.
So, in some places, even like near superior
correct
levels.
Yes.
So, I'm going to grab one thing. I think the jury's seen various neuropsych overviews, but do you agree he was tested in tens and tens and tens of categories?
Yes.
Did you see any of them below average?
No.
Did you see many above average?
Yes.
IQ, for instance, was 114. Is that right?
That's my recollection.
And for like a 75-year-old man with a college education, is that good?
Yeah, it's above average.
Okay, what's average again?
100.
Okay. Now I think they're going to say, hey, the family members are saying,
I mean, 100 is the average.
We're noticing
for
he's angrier than he used to be, or that he can't drive and read at the same time. There's things he can't multitask with. Can you comment on that?
So, in people like Mr. Sanderson who are high functioning at baseline, above average IQ, superior in some categories like you described, a drop in functioning might still look like he's really high functioning compared to the average population. And the family will pick up on some of these changes, right? They see what they see. That concludes that.
Okay. So if you did meet with Mr. Sanderson and he kept obsessively bringing up, I think the ski collision caused this, what would you say?
I would say that it's my job as a neurologist to help him accept that that's not part of what he's experiencing now. Way more likely than not, he has a history of depression and anxiety. We know he continues to be anxious, so that needs treatment. And I would, evaluate for dementia, like we said, as would be indicated by his imaging.
Okay.
And so my job is to help the patient and family gain acceptance that this mild event 7 years ago isn't causing all these problems that he's having now.
Or any of them.
Right.
Didn't you tell me the cure for Mr. Sanderson is the end of this lawsuit?
Correct.
Your Honor, no foundation, relevance, improper questioning.
Overruled.
Go ahead. Is that your opinion?
Yeah, I felt anxious coming here.
I also object to that. It's not in his report. Nowhere to be found.
Overruled.
Go ahead. Just explain that, and then I'm sitting down.
The suing somebody, going through a trial that has national recognition can bring on a lot of anxiety, and if you're prone to that, it's gonna make it worse, and it's gonna slow your recovery.
His daughter said this notoriety makes him feel.
You promised to sit down.
Powerful. Did you
Why
read that
lying?
in Jenny's deposition?
I did.
Objection, Your Honor. Jenny's deposition is not in evidence.
Sustained. Is it coming into evidence, counsel?
If we have time, we're going to read it in.
Well,
you promised
to
sit down.
referenced
Sit
multiple
down.
times.
Ain't here yet.
if you're planning to ask this witness about evidence that's not part of the case,
We're
or
getting the whole
won't be part of the
deposition?
case, then it's an improper question.
Okay, if he's read it as part of his opinions, experts can rely upon hearsay.
They can.
Yeah, but it's not referenced in his report, Your Honor.
Well, if it's not in his report, then sustained.
Okay, I'll let you go. Thank you.
Thank God.
Someone please let Owen
Mr.
lie down.
Sykes.
Get a caffeine pill or something, I don't know.
Oh no, he's got.
Get some no-dose.
Oh gosh, stop falling.
Steve North was one of those.
Every time I see this guy, all I can think is,
No. Doctor, do you commonly...
can you hear it? I don't know if you
We
guys
didn't hear it well, I don't think.
render opinions
screaming nerd.
on your patients without a clinical exam?
No.
And the last 100 patients that you've seen or that are referred to you, how many have you rendered opinions on for other doctors without an examination, a clinical exam?
So, I mean, we do have conversations with other doctors where they say, hey, you know, what do you think about this case? And I may render an opinion without seeing the patient. But if it's my own patient, then it's part of my standard evaluation to see them.
If it's your own patient, your last 1,000 patients that were your own patients, you would never render opinions about them without a clinical exam. Is that a fair statement?
No,
Never.
I would form an opinion, but I wouldn't create a treatment plan and execute on it without seeing them.
So, a clinical exam, would you agree, for this jury, is an important factor for a physician?
Correct.
Yeah. Did you read the opinion of Dr. Edgley, testified yesterday?
No, I did not.
Okay. If he called a clinical exam the gold standard for a physician, would you agree or disagree with that?
Overruled as to relevance, the jury will recall the testimony of Dr. Edgley.
Well, in all honesty, he didn't say it in his testimony, he said it in his report. I'm asking if he said it in his report, would that make a difference?
Your
Trying to be
Honor,
honest
that's
here.
referencing testimony that's not. There are no facts and evidence.
I will draw the question.
Thank you.
But would you agree that a clinical examination is the gold standard for a physician who's treating somebody?
I'm not sure what a gold standard means.
Pretty important.
It's a big part of my evaluation.
Excuse me. Secondly, I'd looked through your opinion pretty carefully. It was about
You've been
4 or
on the
5
gold
pages.
standard since Nixon.
I noted, let me see if I can get it here handy. Yeah. Well, I'll just ask you if you remember this. It's on my computer. But you had a list of things that you reviewed, is that right?
Yes.
Okay. Can you tell this jury a summary of what Carlene Davidson said in her deposition about Terry before and after the ski crash?
I can't from memory.
Okay. Can you tell the jury what Holly Gresham, the daughter, said about Terry before and after the ski crash?
Yes, I did read Miss Gresham's deposition this weekend, or her statement.
But you didn't read Carlene Davidson?
I think I did, but I can't remember all the names. If you want to show it to me, I can comment on it.
Tell the jury, if you can, what important information about Terry before and after the ski crash Holly Gresham said.
So she feels that he, is not as engaged and able to do things in the way that he used to. I think that's probably the summary.
That's a pretty mild statement of it, isn't it? Didn't in fact she say, Holly Gresham, daughter, excuse me, that there was a marked and sudden difference in her father in a wide variety of areas: personality, executive functioning, social problems after the ski crash, almost immediately. Didn't she say that?
I'm not sure she said executive functioning, but the rest of it sounds familiar.
Did you read Shay Harris' deposition?
Remind me of the relationship?
Daughter.
No, I did not.
Okay? Those three are listed, did you read or not read Carlene Davidson?
I read it, but I can't remember what it says.
You read it, but you can't remember it. Tell the jury if Shay Harris is listed there as one you had. S-H-A-E.
I don't see it.
One second,
Well, look here. See, see.
Random observation. I feel like when he's speaking at the podium, he's holding on to it for dear life. I've noticed he just does that, and then it's like, and then the only time he lets go is when he does these really animated movements. Am I the only one who finds
I
that
do
kind of
declare
distracting?
that I'm a triangular man myself.
Also, I've never seen a lawyer spit while speaking on the podium the way we just did. We've just been like,
He is never wearing a mask.
I just can't believe we have so many doctors and yet
Get a
still so many people
lozenge.
sick in this room.
Yeah, I would not want to watch this trial given all the germs that are flying around, all those people in the courtroom. What are you doing?
Oh no, I'd have a KN95 on this whole time.
Can,
No, thank you.
can we move to admit our report?
Just for illustrative purposes, I want to show him what he wrote.
I guess I don't, you may be opening the door to the report.
You want to do that? Okay? Take a look at it. Items 4, L, M, and N.
Correct. I don't see Shay Harris, like you said. I think that was the question.
Okay. You know what? You're right. I don't see her there. I do see Carlene and Polly. So, the defense did not give you Shay Harris, right?
Correct.
Hypothetically, if Shay said there was a very, very sudden change in my dad, before and after, for what we call neuropsychological symptoms, would that make a difference in your opinion?
It might have made a difference at the time,
Okay.
but at this point in time, it would not.
Carlene Davidson testified. She was the second witness in the trial last week. Does this ring a bell that she was living with Terry for about a year and a half before the ski accident? Does that ring a bell?
That does.
And she was up here about 300 days a year in Salt Lake.
From St. George, right? That was, yeah.
And they also spent time in St. George together.
Yep.
And they went on international trips together.
Yep.
Is that right?
Yes.
Do you think she would get to know him pretty well during that time?
Yes.
She testified that there was a rapid and severe change in Terry after the ski crash that lasted, and she stayed with him for 6 months, and then they parted ways. She said she was heartbroken. She was hoping for a marriage out of this.
Your Honor, just compound.
Sustained?
Okay? She was hoping for a marriage out of this. Do you remember that in her deposition?
Yes.
Yeah. But he changed fundamentally after the ski crash. Now, does that make a difference in your opinions at all?
I mean, it would be part of the whole compendium of what I would put together. Yes.
I didn't read anything about that. I read your report. It's about 4 pages. Aside from their depositions that you referenced, you don't say anything at all in your report about the rapid and fundamental changes that occurred to Terry after the ski crash, do you? Don't even mention them. Is that correct?
That's correct.
Okay. Now, are you familiar with the term executive functioning?
Yes.
Is that something that neurologists use, a term that neurologists use?
Sometimes, yes.
Yeah. Because you realize, of course, as a neurologist, that you can have massive changes in a person with a mild TBI that don't show up on imaging, right?
Yes, that's possible.
Yeah, you mentioned that earlier in your testimony. Yeah. And a category of those changes is called executive functioning, right?
That is one manifestation, potentially, yes.
It's one category.
Yeah.
And I didn't see the word executive functioning even addressed in your report. Not even a mention, correct?
Sorry, is that a question? Or
yeah, correct.
A question?
With an inflection for a question, yes.
Is it in my report?
Yeah.
No, it's not in the report.
Okay. Hey, Pete, would you... Now, while he's doing that, could you define for the jury executive functioning in a medical sense?
The ability to do things, to start actions and carry through with them.
To start actions and to what?
Carry the actions through.
Yeah. That's self-regulated, self-directed action, right?
Correct.
Okay. And that people use that to manage their affairs effectively.
Correct.
Right?
Yep.
Have you heard of Sam Goldstein?
I mean, I know of his report, as I testified earlier, and I read some of his deposition. Actually saw his testimony.
He testified here. And by the way, were you aware that he is a world-renowned neuropsychologist from Salt Lake City?
Yes.
Yeah. And he developed an executive function test.
Correct.
Can you see it on your screen there?
I do.
Yeah. And here's what he recorded with a high confidence level. That this man, Terry Sanderson, who is a former captain in the United States Army, ran eye clinics for the Army, has an advanced degree in optometry, which I think is a 4-year degree, if I'm not mistaken, and ran 2 clinics in southern Idaho. Okay? Would that indicate to you a man of superior intelligence and executive function?
Yes.
Yeah. Let's see what he did here. Okay? On attention, he was in the 25th percentile. Does that strike you as strange, or just average, by the way? 25th percentile. In other words, out of 100 people, he's 25 lowest, right?
That's correct.
That's what that means. Yeah.
Yep.
That for a man of his attainment, he's only the 25th percentile on attention? World-renowned neuropsychologist recorded this. Does that strike you as odd?
Strikes me as him having issues like we talked about.
Let's go to condition. I'm sorry. I'll skip emotional just to say.
I was saying, I think these are data and they're good data, and it reinforces my stance that Mr. Sanderson needs help. He's got depression and anxiety, and I think this could be consistent with dementia as well.
Okay. By the way, let me show you our exhibits.
But the thing is, though, okay, yeah, that test is great, but wouldn't that test have taken place after he had his stroke?
Yes. It's just an exhibit notebook here. May I approach?
Strokes kind of affect a lot of that kind of stuff. I think.
Do you have the number of that?
Yeah, it was 43.
Sir, can I just ask what date this is?
Okay.
So,
was this 2021?
Lack of foundation to the witness, Your Honor.
Okay. I lay before you defense exhibits and plaintiff's exhibits. Can you show us where there's a diagnosis of dementia? This is going back to 2009 and up through, I think, 2021.
What hasn't been made yet?
Hasn't been made. Okay. So, you would agree, for the jury's help here, despite the fact that we're in a very important worldwide case, okay, like you mentioned, kind of, paraphrasing your words, there's no diagnosis of dementia.
Hasn't been made yet. Yeah, because we're talking about a minor brain injury that happened in 2016 and not allowing him to move on to have a true diagnosis.
Let's talk about flexibility. Exhibit 43. Low average, 23rd percentile for flexibility of a man who ran 2 clinics in southern Idaho. Does that sound really low?
Sounds low, yeah.
By the way, you asked me the date. I think this was done in 2020.
Okay.
I mean, people have weaknesses, though. You know?
Okay.
You can't be good at everything.
It's just organization. Now, the ability to organize things is a very important part of the executive function, isn't it?
So.
Correct.
Yeah.
Very important part.
You're not going to be above average in everything.
3rd percentile. Now, I'm just a simple country lawyer.
Oh my God, he actually said it?
But
again,
I didn't run
Someone
cheap.
please clip that. Whoever
Okay.
is it, Claire?
3rd percentile.
Give me,
Does
I'm
that
just a
strike
simple
you
country
as
lawyer. That's becoming
indicative
a
of
drop.
something wrong here?
Yeah.
Yeah.
He
Planning.
really said the line.
Oh, by the way, below
He
average.
said it.
Below average.
Wow.
Excuse me, planning.
You're not supposed to
He's
say
that
the
desperate.
line. Oh my
Below
God.
average. Does
I
that
hate
strike you
you so
as
much.
very low for a man of his attainment?
Very low.
Self-monitoring, 10%. That strike you as very low for a man of his attainment.
It does.
What about working memory? For a man who did everything he did, working memory of 5 percentile.
It's low.
All right, now.
Can we make one more comment on that, by the way?
Well,
or do you want to move on?
Oh, let's just move on.
It's related to Goldstein's report.
What's that?
You know, my impression from Goldstein's report is that that's why he was recommending the cholinesterase inhibitor.
They have country lawyers in Utah?
Well,
which is a treatment for dementia.
If you don't remember specific things about his executive functioning from his family, do you?
No, I don't.
Yeah, or from Carlene. But Carlene told this jury just a week ago that there was a major change in these things overnight, and she couldn't live with it. All right, now, excuse my cough here.
Oh my
I
God,
don't get a
dude!
cold very often, but this is a killer.
Hold on, sorry.
Did you see anywhere in these records? Okay, now let me just patient of Veterans Administration. He was a veteran.
Yep.
I think since the early part of the century, early 2000s, when he moved down here from Idaho.
Right.
And he's got a lot of records there. And there are a lot of records that you read after February 26 of 2016, correct?
Right.
Yeah. Now, in those records, do you see anywhere where Terry Sanderson was accused of faking, malingering, or magnifying symptoms for money?
No, sir.
Nothing there, is there? Okay. No, where he says, I'm in it for the money.
No.
And did you read the reports of Goldstein, Fong, and Gibby?
I did. Yeah.
They're all treating physicians for him.
Correct.
You aware of that? Treating.
Yes.
Okay. They're all pretty competent, aren't they?
Yes.
Dr. Fong said she's treated thousands of patients with mild TBI. You aware of that?
Wasn't aware of the number, but I
Yeah.
know that she treats.
She
mild
missed
TBI.
trial here because she's lecturing over in Holland on what she does. She's lecturing in the Netherlands. You aware of that?
No, I'm not.
I think she was going to
What,
Spain.
what's this
after
that's
that.
supposed to mean? She's
and
lecturing
she
all the
said-
way in the Netherlands?
And by the way, are you aware that
That's some
these
sort
kind
of
doctors,
special
at least
thing?
neuropsychologists, they give
Well,
tests
I mean,
that
it
have
is all
embedded,
the way in the Netherlands.
cleverly embedded tests for malingering. You aware of that?
I am. Yeah.
And neither the
It's harder to do it
DA
there.
or these three doctors found any
He's a
suggestion
simple country lawyer. That's very
Any
impressive to
suggestion?
him.
Surprised he's heard
of
of the
faking or
Netherlands.
malingering or magnification. Or you aware of that?
Correct. I
Or
agree.
any
Which
suggestion
county
that he's
is
doing
that
this
in
for
Utah?
money.
The Netherlands?
Oh my
I'm not
gosh.
familiar with
It's
that
an
one.
insulting comment. But there's no suggestion of that, is there?
I didn't see any evidence.
Do you think he's doing it for money?
I don't know. I have no opinion on that.
Thank you. Now, with respect to you had a thing up there about his scans, CT and MRI. Do you remember that chart?
Correct.
And you saw Dr. Black.
Yes, I did.
His testimony a few minutes ago.
Yes, I did.
Okay. And do you remember him saying that from 2009 through 2021, there's no indication of a change on these scans?
Correct.
Yeah. So there's no deterioration. That's the big point. He hasn't deteriorated on the scans, has he?
Correct. That was Dr. Black's testimony.
And you agree that he had a mild concussion?
Correct. More likely than not.
More likely not. Okay, that's good enough. And you also agree that he's got, and I think in your report, you said, Mr. Owen said 1%, but you said 5% of people with this condition, mild traumatic brain injury, do not recover completely.
Correct.
Okay. Now, do you think that an executive functioning outcome like that is more toward the 5%? What do you think?
I don't.
You don't?
No.
Okay. Is the fact that the people that love him, that know him the best, say there was a significant and sudden, dramatic change in him after this ski crash, do you think that moves him more toward the 5%?
I don't.
You don't? Okay. Do you think the fact that no one has diagnosed him with any other condition like dementia moves him more toward the 5%?
No.
You think that the fact that no one's diagnosed him with faking, malingering, magnification moves him more toward the 5%?
No.
You okay, Andy?
We need to liven this up. If we get a 50, I will dress as a superhero.
We talked about
If we get
atrophy in
50
the
right
aging
now,
brain.
starting now,
Yes.
I will dress up as a superhero.
That is a normal condition.
Who wants to
right?
see it?
It can be.
You're already
And it's
dressed up as a
asymptomatic in
superhero to
many
me,
people.
Andy.
It can be.
Oh no, trust me, you're gonna like this. Chat,
Okay.
don't miss this one.
All right. You too, Kim.
I don't have
Yeah, one more
superhero
question.
costume.
No, I meant you're already dressed up as a superhero to me.
I am currently dressed up as someone
Are
who
you
is
familiar
freezing.
with the pre-existing exacerbation issue medically with brain injury? In other words, let me explain that. If you have a pre-existing, let's say you have a problem
look
with
super,
anger
though, too, Kurt.
regulation,
We're all superheroes.
Yeah.
or some
We're all
other
making it through
negative
this.
That's my attempts
quality,
to
okay,
be nice to
then
my host.
oftentimes a
Doesn't work.
TBI, even a mild TBI,
You're doing
can
great.
exacerbate those symptoms. You aware of that?
I am.
And that's a true principle of medicine, isn't it?
Correct.
Okay, 1 second.
Fine.
You Care, thanks for the 10. I'm catching up on some old ones. Let's keep the super chats going because, yeah. You know what I realized, Kim, and Kurt? I realized that if a stream gets demonetized because we play those songs, YouTube takes the revenue from the stream.
Who's had a concussion.
But what I'm currently trying to figure out is, do they also take the super chats?
Risk.
No,
if they
I
have
don't
another
think so.
concussion. Second injury syndrome, they call it.
I don't know, Kurt. I'm finding out. I may need
That's
your
all I've
legal
got, Joe.
expertise if they do.
Oh, dear.
Thank you.
So
Mr.
no music
Owens?
today.
Oh, is it over?
Oh, good.
Oh no,
We got $2 towards the superhero fund. Thank you, Stilla. You Care. Hi, Andy. I've been a fan since the JD's trial. I am proud of you and admire your determination. God bless you as a mom. I want to send your mom a hug. To someone who hurt your child is the worst. Thank you, You Care. But thankfully, no one's hurt my children. Superhero fun has begun. Janabelle, Stilla, Carbonized Stardust. Whoa, bring up the cape. Boom! Just tipped $5.50 in the stream elements.
Oh my goodness.
Guys, use the stream elements link so it goes through PayPal and it doesn't take the YouTube percentage, and then none of it doesn't. They can't steal it from us. Carbonized just did it. All right, I'll be back in a second as a superhero. Thank you, Stephanie. Thank you, Paul. Thank you, Katie. Who else is going to keep it going? Super Andy. Oh, here we go.
And maybe just bring up just number 2, if you would.
Sometimes I do
don't know
shots
if
for
you're
money.
able
Sometimes
to
that goes really wrong.
Clear number 2. Do you remember?
We've done that a few
this
times.
is
I'm surprised
Dr.
some of us are
Fong's
still alive.
document.
Yeah.
Yes. And do you recall plaintiff's counsel say,
First
show
super
me
chat
in
from
those
Sarah,
records where it
what?
says the word
Yay,
dementia.
Sarah!
Yes.
All right, so let's look at this. The most likely diagnosis for this appearance is
This is
normal
brutal.
pressure hydrocephalus. The differential would include
Right there.
normal aging brain, Alzheimer's, dementia, subcortical arteriosclerotic encephalopathy, and multi-infarct dementia. All right, this is plaintiff's own retained expert, right?
Yeah.
And she's talking about, hey, could be some dementia stuff going on here, right?
Correct.
Objection, Your Honor. That's a differential diagnosis, and it doesn't suggest it's going on.
That's a speaking objection, Your Honor. It's inappropriate.
It's an inappropriate question.
Overruled. You can cross-examine. You can cross-examine the witness,
And
counsel.
then, Peter, if you can hear my voice, come back in. I had him go make some copies of another dementia reference that we'll pull up in just a minute.
Do you remember any reference in the VA where the patient actually came to the doctor and said, I'm worried that I am getting dementia?
Yes.
And what do you recall? I think that might have been his treating psychiatrist, Michael McIntosh. Does this sound familiar?
I think that's right.
And,
we would see, yeah.
Do you recall, Peter's making copies, but do you recall what he responded?
I don't.
Okay, we'll pull that up in just a minute. In terms of how close these daughters were in their personal observations, did you observe that Polly Graham Sanderson had not even seen or talked to her dad for 3 months prior to this ski collision?
Yes.
What's up, guys? Spidey here to make things more interesting.
They all lived out of state.
God, these spandex
Is that
suits do
fair?
not fit
all
big
three
guys.
daughters lived out of state from him.
I'm here with my Peter Parker quips. What's up, everybody?
Yes.
Man, how do they see through these things?
They don't. Not well.
And he had, in fact, at the time of the ski collision,
That
he
guy
wasn't
in a
running
Spidey
a
suit.
two-office optometry visit. He'd been retired many years, correct?
Correct.
And there's been evidence that
It's better
he
than the
left
Mandalorian armor.
on
My God, I don't know
bad
how he
terms with
fights
his
in that
partners.
thing.
There's no evidence of that, and it's beyond scope.
Overruled.
And it's irrelevant.
Do you recall this?
I'm sorry, I don't recall that part.
That he left on poor terms. He left his community on poor terms. His business. I'll clarify my question. So I don't want just continuing speaking objections.
Sure.
Oh, yeah. Spidey's having a blast. I've never worked with Gwyneth yet, but I would. Oh, wait, I did. Yeah, I did. She was Pepper Potts. That's right. That's Tony Stark's girlfriend. Oh, God, I love her. She's the best. What's up, Pepper? How are you doing? I miss Tony. He's dead. Oh, spoiler alert. Damn, I ruined it. How are you doing, Kim?
Right
So
now,
good to see you. You just
we talk about
spoiled
this.
Avengers for me. How dare you?
I can't get this to clip in the back. It's like a zip. How am I supposed to zip this? This was the double XL one. I got. What's up, Kurt? Uncivil law at the best. Pew 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 pew.
We've got to talk about your vigilante ways, Spider-Man. I think you're infringing several laws.
Can you be my lawyer?
Okay, I understand your issue that you think it's collateral impeachment and that it's beyond the scope of cross. I'm going to overrule the objections, but ask that there not be a lot of repetition. I think that the door was opened when this witness was asked about that before and the after from family.
The really bad one
I'm
is
trying
Batman.
to recall my last question too.
Because
that was the objection was sustained.
Batman is technically a state actor, so the Fourth Amendment
rejected.
problems for Batman
And then,
are
but there was continuing
massive.
talk, and I never
really?
even got to
It's a
ask
fun
it.
stream.
Well,
Should
you'll
do the
have a few minutes to
superhero laws.
reorient yourself.
Yeah.
I'm just a country lawyer.
During the break.
Yeah, all those people that Batman is detaining and arresting, they've got Fourth Amendment problems out the ass.
Ready for the main cam? Oh, look, he's here! Spider-Man, you ready for my superhero landing? Yeah! Yeah! Pew, 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 pew.
I thought there was testimony of both
It's
parties.
like a poster, Kim. You like it?
I thought there was
I'm doing
testimony
like the Spidey poster.
of issues with when he left his business, that there were issues.
Simple country lawyer looks like he's gonna kill the judge. Like he looked mad there. You look amazing, Andy.
Thank you. I feel good when you put
I'm
these on. You feel like
asking
you're a
you
superhero.
to explain where. Well, first of all,
I have
where
to
did that
ask.
come
Pepper
in?
Potts. Hey, Pepper.
Is Spider-Man wearing
It's
sheet?
in Terry's
How's
deposition,
Tony?
by the way. I think he even used the word like his partner had
If it's in his,
cheap shotted him or something.
deposition,
Is
then
she
it's
allowed to
not
be on her
Spider-Man
phone like
used
that,
sheath for a
Kurt?
Spidey sack.
Only because I haven't
Kurt,
been able to finish
is
with
she allowed to be on her
Terry,
phone?
But his own daughter, for instance, said
What?
he left.
Gwyneth was
he
on her
enjoyed
phone
a good
texting.
reputation until his
Yeah.
affair in that.
Isn't that kind of a
community.
faux pas?
That was in the
Yeah,
record.
I don't
That's
know
in our,
why
that's
this
that in the
court
record?
allows
That's
people to use
in
phones in the
evidence.
courtroom. I'm not sure why, but some courtrooms won't even let
No.
you bring phones into the courtroom.
No, it's in
Because of this
evidence
kind of
because you were
crap.
making him out to be just this beautifully respected man in the community, and his own daughter said, not so.
Well, I think
Fair is one thing, but I mean,
Business partner problem.
I don't think that's come up, Judge. I'm saying it's wrong about it. I don't think it's come up.
I know I've read it. I just don't know if it came out on the record. I don't think it did.
So I know it to be true because Mr. Sanderson actually. So
My Face
I asked
ID doesn't
him,
work on my phone.
We're not proving
Big shock.
truth necessarily right now.
Only
We're
thing I will
proving,
say though was apparently
did you
Terry
see
was
it
on his phone
in
as
that
well, and he
record?
was
'Cause they can
texting. So both of
testify
them are doing
as to
something.
what they've
So
reviewed.
both of them are on their phones.
And then I can follow up on it. So
I
it doesn't
think-
have to be in as a fact. As a fact.
I think under 403, I'll
It
exclude it.
used to be the
That
policy for the
question-
federal
Which
court
one
in the Eastern
again?
District
You're
of
on
Virginia.
about
Couldn't even
business
bring in
dispute.
electronics into the
Business
building
okay.
at all.
Really?
And
Yeah.
like a certain amount of cross-examination with this witness, and the closer it is to what the daughters observed or didn't observe,
At the time, I had
the
a
closer
Pebble
it's tethered to that,
smartwatch,
the more
and I got
relevant
into
it
an
is
argument with the marshals about it. They kicked me out of the
responding to
building.
the cross that came out. But if you're, to pull out, I guess, the
Oh,
defense's
wow.
laundry
That's
list
a-
of complaints about the
that's
plaintiff,
very
or not
strict.
complaints, but
Yeah.
points. I don't
the
know
U.S.
that
Marshals
this is
tell
the
you to
correct.
leave, though.
This is
It's,
the
you
more
know,
appropriate place to do
Hey,
that,
guys.
given the scope of direct.
I can trust you with my secret
All the
identity, right? None of you
family
gonna tell
members are saying
anybody?
He had dramatic changes before.
Between us
They're
and the
saying-
2,500 people here, you
Actually,
got it.
they're
Oh,
pretty
please, don't tell
distant.
anybody, okay?
And
Woo!
So questions that are tethered to those issues are fine.
Don't tell anybody, guys.
So we know what we're doing as soon as we go on. We're going to present VA record 922 to 924.
And then what? So that's defense exhibits what? Are you introducing these, or are you just showing them?
I'm about to find out.
I'm about to find out.
I just need to know if you're using them already.
And just,
It's nice
just
and
for the
smooth.
future, I'd like to reiterate that when you have an objection, all I need is objection and the rule. What rule? And if I need more information, I'll ask for
I'm
it.
having Murdoch flashbacks right now.
We have another few minutes to run down the rest of the
Sure. We usually take about 10 minutes for these breaks. So.
He uses his orange sippy cup. I don't like judges when they don't have good control of their courtroom.
Yeah.
As a general proposition, I just don't like the way the attorneys are acting, just in general, shows that this judge doesn't have enough control of his courtroom and he isn't putting the hammer
Thank
down.
you. They've been doing.
Yeah.
They've been running roughshod this whole time. None of them
Well,
are
that's
prepared
because-
for this.
Well, because like children, they keep testing the boundaries and they don't find boundaries, so they keep acting more and more aggressively because judge says things and he doesn't put the hammer down.
Yeah. Limit does not
It's
exist.
like, it's like I prefer judges who are more like, okay, I am your new demigod. You are in my domain. Here's what's
you
happening.
should fear
now.
them.
Yeah.
Is that how you will judge Kurt? If you become a
Oh, yeah.
judge, walk in and
Oh,
go,
hell yes.
I am Kurt
yeah.
and I am your demigod now.
That's right. That's right. You know how they say tell to the judge? That's me. Yeah. So. So.
I do want to very quickly say thank you to a few people. Thank you to Virginia. Thank you to Judith. Thank you to Stephanie. Thank you to Sandra. And thank you to Dave for the PayPal tips that you've given me. And I had a comment here. Here it is. And it was from Sandra. And it just was, love seeing you on Andy's channel with the other YouTubers. All of you keep me laughing. I so enjoy how you all sync so well. And then she had a few other things, but she ended it very nicely by saying, P.S. Adore Kurt too, with a kiss emoji.
Aw, thank you.
Ooh,
So you have a fan in
a kiss
Sandra.
emoji.
Holla at me.
Send those kiss emojis to Kurt.
Great.
Uncivil Law. You can find him over on YouTube. Go support. He's been. It's been great to have the surprise of him going through this torture with us. It's hard to type with Spider-Man gloves.
The constricting.
Yeah.
Yeah.
There's pros and cons to this suit, I gotta say.
Yeah, on my channel, we do a lot of Supreme Court analysis, Court of Appeals analysis. We do some pop culture stuff. Friday, I'm going to be doing an oral argument react to this case that was heard at the Supreme Court last week called Jack Daniels versus VIP Products, dealing with these novelty dog toys that look sort of like Jack Daniels' bottle, and Jack Daniels got sat on trademark law. So we'll be doing an oral argument react to that on Friday. And also cover just Supreme Court decisions as they're coming down. Some really interesting cases this term, of course. There's the one dealing with Students for Fair Admission versus Harvard is probably the big one this term, dealing with affirmative action at colleges. And then there is some other stuff that's happening that's, of course, interesting. So tune in to Uncivil Law, where we try to dissect all that stuff and let you know how the law is changing. Exciting.
Yeah. I have to say, I'm very jealous of the both of you right now because I believe, Kurt, you're in Texas, right?
I am.
Yeah, and Andy's in Florida. And I am in
Where are you-
Canada.
Okay.
It is much colder here than where it is for you two.
I'm from Brooklyn. What are you talking about? It's me, Peter Parker. Just your
Still
friendly
probably
neighborhood
warmer.
Spider-Man. No, it's very nice here. I just, when I went to get my water, I went outside to get sun too because I was like, oh, this is brutal. All right, I have some chats while we're waiting. We're waiting for them to come back. Mary Treesh, thank you. Love your channel. I've been watching your channel for a while now. I'm a member, so happy I am. Woohoo! You guys can become a member today. Hit that join button, pick a tier. Steph and I are going to be working on perks. She's actually been researching that today. We are going to adjust our levels. We're going to make a new trailer for the perks. We're going to make new perks. Look, the perks are benefiting the channel. You're supporting us in another direct way, but more stuff will be coming exclusively to you guys, your members. So thank you for joining. And we did do it. If you didn't notice, we have a new system. You'll see your member badges are now bronze, silver, gold. Bronze for your new member, silver for 2 months, and then you get no medal, and then you get a gold at 6 months, and then if you make it to a year, you get that illustrious 1, or then like Matthew Coburn right there, the 2, or a 3, and yeah, even a 4. There are people who could have been members here for 3-4 years at this point. So get earning now. You can get there. Appreciate all you guys who have supported. See, Kim's got the 1. Woo woo, go! It's Kim. You can get your badges and feel even more. It just helps me remember to appreciate and thank you guys for all the people who have been members for as long as you guys have. So, because some of those other colors I established I just couldn't remember which one red was or blue. But now it's a little bit clearer to me. So hopefully you'll start noticing that. So thanks to all the golds. I see you've all been here for over 6 months. Woo woo! Christy B, I think we're all going to need a neuropsychologist after this trial. Indeed. Sarah Wingham, Andy, amazing laughing from Oxford, UK. Kaylee Regan, Andy is the best Spidey. I think so too. So do my kids when I dress up like Spidey. Kim is cozy PJ Masks. PJ Masks of the PJ Masks. PJ Masks of the PJ, because of bedtime is the right time to fight crime. I forget the rhyme. DC can see Spidey senses are tingling. Oh yeah, am I tingling all your Spidey senses? Wait, I gotta pull it down. Popcorn Planet. Wait, now's the screen cap time. Wait, block. Yeah. All right, there we go. Kim, can you call someone a hoser?
Any rulings of the court, any arguments of the lawyers, anything that's going on.
Who's the biggest hoser of this trial so far?
I would hate to have to ask, someone to leave.
Oh, I have to give that to Simple Country Lawyer
keep your thoughts to yourself, keep your reactions, your emotions,
well, they just had to ask someone to leave.
Facial expressions until the court's not in session. So thank you. We're ready.
Andy, we get kicked out so fast.
I would get so kicked out. It's
no
so
facial
true.
expressions, and the both of us are just
I could not not react. Not because I'd disrupt, but I'd be like, what? I'd be like a DUI guy during Morgan Tremaine.
What a great little moment that was in LawTube life there.
So amazing. It was so amazing.
Mr. Owens, you may continue. Just to let you know, I've got another court hearing at noon.
Thank you, Your
What?
Honor.
He has another court hearing at noon?
Defense Exhibit 114. May I approach you?
You may.
This is possible. I mean, if there's a large team, he might have more than one thing going on at the same time, which would be hilarious, but
Do you mind if I hand it to the witness?
You may.
We may get you a copy.
Excuse me.
Okay.
Oh, I thought that was in the court.
114.
No.
Did you say D as in dog?
D as in defendant, yes.
Okay. And does the plaintiff have any objection to this witness or this exhibit? Defendant's Exhibit 114D is received.
We're trying to blank out.
All right, if we get another 50, I'll break out a wig and I'll be a whole new character. I have a Karen wig. I have a bunch of wigs.
You have a Karen wig?
Of course, Kim. I'll break out the wig box every 50. We'll mix up the wig and I'll speak in a new character. Who wants to see me do some character play today?
Okay.
Keep me interested because I don't know what the
Have you
hell's
seen
going on. I'm
this
like that lady who's falling asleep. Did you see that?
I can't
That's the lady
remember.
falling asleep.
This is part of his VA records. It's dated May 22, 2017. Bottom right is marked VA 922.
Yes.
So if the incident was in February 2016, this is about a year and 3 months later. You with me?
Yes.
And if we go to the second page, VA 923, and
Welcome, Annie. Woo woo, Annie Still.
James is going to bring this up. You see under the subjective, and James, I think the address is there, so you want to get rid of it. I'm going to come show you where I'm going to start reading. Patient reportedly.
Yes.
Okay, that's the first paragraph, and where's our cool laser? I'm going to start, this is a big sentence, but I'm going to start right here. Patient reportedly, and I'll read this, patient reportedly sought out neuropsychological testing for these symptoms, but also feared he may be experiencing early dementia symptoms. Mr. Sanderson noted that he felt reassured following the testing, but is still concerned regarding some of the cognitive changes he has experienced. So that's another reference to him being concerned with dementia. True?
True.
That's all on that. You can take that down, James. Executive function testing, does that rely on the patient, some subjective reports from the patient?
I believe so, but I'll have to defer to our neuropsychology experts later today.
Okay, they're going to come up here and talk about that, so we'll be okay with that.
Oh, can't wait. I can't
Patients
fucking
can
wait.
throw neuro testing, though, can't they? Can
Yes.
they, like, fill in the tic-tac-toe, and the patient can actually say, I don't know.
Objection, beyond scope.
Overruled?
Yes.
I mean, we can't force him to put a 0 where it belongs and an X where it belongs. Fair?
Correct.
And are you aware of studies that say being a litigant in a case like this actually frequently leads to patients overstating their damages?
Objection, 401.
Apparently, that is my new YouTube partner
Overruled?
manager who wants
Go
to
ahead.
talk to me about growing my
Yes.
channel.
Woo!
Yay!
So I would say it's more just
Exciting.
knowing from
Good for you.
medical
I look
school
forward
and
to their
learning
very
about,
generic advice.
what malingering is, as opposed to studies that you state.
At least they
Okay,
acknowledge your existence.
Malingering is a word that means basically not trying as hard. Is that fair?
Correct, for secondary gain.
If I malinger, if I have a stubborn cough that's malingering, is that the right use of that word?
No, it would be if you
If YouTube could stop community
symptoms,
striking
like you said,
my
not filling in the tic-tac-toe
FBIT videos that I
in
did,
order
that'd be
to
from
have
2 years
some
ago,
type
that'd
of
be
secondary
great.
gain.
Because every once in a while they decide to flag one of them.
Yeah.
What we do know is that he ran a business in Idaho many years earlier. True?
True.
Objection, Your Honor, same thing we talked about previously.
Overruled?
True.
And then he retired in part due to his failing eyesight. Do you know that?
I don't know that.
All right. And do you know anything about losing the respect of his community, which his daughter reported to this jury?
Objection, leading.
Overruled?
Sounds familiar, but I don't know the details on that.
Due to an affair he had. He thought.
Objection, Your Honor. 401, 403.
Sustained?
Thank you.
I think it's in evidence, and I think he should be able to reference it.
Same objection.
But
You
I'll
think?
respect your ruling.
Okay.
Can anxiety
This
and
was brought up
depression
when Tyler
and
was here.
hyperfixation, can they
Your job to
throw off
remember what's in
executive
evidence.
functioning?
Yes.
All right. One thing Sam Goldstein said the other day was that he's obsessed. He's obsessed with this case, this notoriety, this media. Can that throw off if someone's obsessed, can that throw off their executive functioning?
Yes.
Objection, foundation.
Overruled?
Just comment on that for me, please.
Yeah, so being obsessed, being extremely anxious, or having other, being depressed, kind of that's a whole continuum, can cause a whole host of cognitive dysfunction, including executive function, but also problems with concentration, attention, memory, all the above.
I'm being told to sit down. I'm sitting down. Thank you.
Thank God.
I'm just a simple
Sykes?
country lawyer.
I got it. It's now in the drops.
I'm just a simple country lawyer.
Oh, God.
Just in time.
I'm just a
Is the
simple
button on your
country
soundboard
lawyer.
now? Is that what's going on?
Yeah.
It's on my
yeah.
soundboard now. It's
That's
become part
good
of it.
news.
Legendary.
Great.
I'm just a simple country lawyer. Doctor, in that, I'm just a simple country lawyer.
We're so
Progress
close. Oh my
note
God. 20. Look at
from
that.
The VA, May 22, 2017. I'm just looking at
We're
it.
like
Exhibit
$10 away from a new
114.
wig.
Okay.
Yes, sir.
This was the reason. Read that to the jury. The reason for the visit.
Would you like me to read it? Oh,
Yeah.
Scheduled psychotherapy intake.
Okay. And the chief complaint: anxiety, adjustment to medical condition. See that?
Yes.
Okay. And then on page 2, some of the things that weren't read. Let me see if I get those up there. Let's see. No. It says subjective. Now, Mr. Owens,
Do you have Daryl Brooks on your
read you
soundboard?
part of that.
No, I should. Which one?
Oh,
Okay.
just
Browns.
like Browns.
Can you see what I'm referring to here?
That'd be a good one.
Yes.
Okay.
Is it lawful
Says,
law?
Recently
Yeah.
referred by Dr.
Hey,
Nance to the
Jigs.
following neuropsych testing, where
I should-
anxiety
we
was
should get- is
suspected
that
to
lawful
be
law?
affecting patients' cognitive functioning.
Is
See
this
that?
an Aberley core?
And Mr. Sanderson reported that he was in a ski
Yeah,
accident.
somebody give me, is that lawful law?
ago, where he was hit by another skier who lost control. He reportedly had
Grounds for the
5-minute
sustained,
LOC
or sorry, substained.
and broke 4
Oh
ribs.
God,
See
we can
that?
laugh about it now.
Yes.
And he was
You have
evaluated
to
and
laugh
told he
about
had
it or
a
you'll
concussion.
Yes.
Right, and that's actually what happened. He was evaluated and told he had a concussion, wasn't he?
Yeah. That's
by,
what we
by
discussed.
several.
Yeah.
He stated over the past year and a half, his cognition has gradually improved. Right?
Correct.
Now, people that are malingering don't go tell their doctors that they've improved, do they? Do they?
Sometimes.
I don't
It depends
know that
on
I
the
can make
outcome
a
they
general
want.
statement, but
Depends
I
how
think
clever
the fact
they
that
are.
he improved, we talked
What
about,
they're trying to
which
do.
is a sign of.
But he has continued to have
concussion.
difficulties.
Your Honor,
With,
Bob interrupted my client.
I'm sorry, I didn't mean to.
Sorry, my expert.
I'm
Can
sorry.
you
I'm
finish
sorry.
his
Would you-
answer?
I didn't mean to interrupt you.
Yeah. Did you finish your response?
Well, I was just saying that we did talk about this earlier, that he had gotten better from the concussion.
Not gotten completely better, but he improved, right?
He improved.
Says his cognition has gradually improved, but he's continued to have difficulties with motivation, energy, and anhedonia. That's a term that the jury may not understand. Loss of enjoyment of life?
Correct.
Okay.
That sounds a lot like
So,
depression.
at least 2 of the 3 of those are things you commonly see with executive functioning problems, aren't they? Motivation, energy.
Correct.
Okay. He also described difficulties with spatial
Sebastian,
tasks,
sit
such
it
as
over. All right,
driving,
getting a new wig. All right,
getting
coming back.
lost, and puzzles. Those are frequently executive functioning problems, aren't they?
Yeah. There are also major signs of dementia.
Okay. He reportedly sought out neuropsychological testing for these symptoms, but also feared that he may be experiencing early dementia symptoms. Okay?
It was smart for him to think that.
Smart. Mr. Sanderson noted that he felt reassured following the testing, but is still concerned regarding some of the cognitive changes he has experienced, right?
Correct.
And you understand that he was tested and told he doesn't have dementia. You understand that?
Yes.
And no diagnosis of dementia, ever. Right?
Correct.
Okay. Now, also,
This entire trial is just a test of my resolve,
patient,
isn't it? It's a test of
sometimes
character
neuropsychologists call them
and my
clients,
will
but, you call them patients, right?
to persist.
Patient or a client who has high scores in some areas is not generally a person who's trying to fake it, right?
Correct.
High scores, right?
Correct.
And in some areas, some intellectual areas, Terry Sanderson has super high scores on testing, super high, right?
That's right.
Okay. Hold on one second, Your Honor. I think I'm done here.
Bye.
No further questions.
Mr. Owens?
No, Your Honor, no more questions.
It appears that
All
the
right, thank
Utah
you, Dr.
bar
Hess.
is
You're
in desperate
excused.
need of
Thank you for coming.
better lawyers. So
Just leave it right there in front. Thanks.
Oh, is it over?
Oh,
I don't.
I thought he was coming back.
What is happening here? I've been waiting for my
He's
latte
excused.
for like
Sorry, Mr.
15
Sykes.
minutes.
Do you have another minute?
very short.
All right, come on.
Your
in.
Honor? Your Honor?
You're still under oath?
I need you to pep this up. I need to go pick up my kids at soccer.
Your eyebrows with that wig are killing me.
Yes.
Normal pressure hydrocephaly or hydrocephalus?
That's correct.
Okay. That is a condition, is it not, that can exist for years and years and years without any symptoms.
Correct.
And the three main symptoms of NPH, if it's active, I'm just a simple country lawyer, okay, are ataxia, dementia, and loss of continence.
Correct.
Okay. And
Ataxia being problems walking.
problem walking.
More
And there's no diagnosis anywhere in those records before you that anybody ever diagnosed him with NPH.
That's right.
Okay. And a lot of good doctors looked at him, right?
Correct.
Thank you.
Mr. Owens?
Entirely separate from the ski accident, do you believe Mr. Sanderson would benefit from anti-dementia medications?
Your Honor, I object. That's beyond the scope. I asked only about NPH.
That was Your Honor, he...
Oh, how gross,
overruled.
making me watch you pick your nose.
I think it's worth a try.
I don't know what's happened to
Low
that
side
nostril,
effects,
but
and it could help him.
And Sam Goldstein felt the same way.
Correct.
That's all. Thank you.
I'd like to speak to your manager,
Mr. Sykes,
please.
anything further? Okay, thank you.
You should now run from the courtroom.
problem is the manager isn't managing right now, so we're in a state of chaos.
Mr. Owens, you may call your next witness.
Thank you. James
Oh.
has this one. I'm giving the clerk the official 114.
How come they do not respect our time here as viewers?
Your Honor, we call Dr. Angela Eastfold, our neuropsychology expert.
Thank you.
More experts? I wanted to see Gwyneth's children because I'm a shithead who wanted to judge them.
The case now before the court will be the truth, the whole
Kim
truth,
went away.
and nothing but the truth. So help you God.
Kim did not.
Thank
Oh,
you.
Kim couldn't handle another woman on the stream?
Would
Jeez,
you
Kim.
take a seat
How
and
dare
then
you
state
just
your name
leave?
and spell it?
Bye.
My name is Angela Eastfold, ANGELA EASTVOLD.
Thanks for being here, Dr. Eastfold.
Hello.
And I believe, Your Honor, you said you have a hearing at noon.
Ooh, lunch.
So we'll be quick for the first part here. Would you like to
Say
end
hi.
right at noon or a little bit before?
Maybe a couple minutes before would be great.
Okay, great.
One or two.
Sure. I'll keep my eye on the clock. Dr. Eastfold, what do you understand your role to be in this case?
I was hired to review the records and provide opinions on the facts around his injury.
Okay, and were you asked to look at Dr. Goldstein, plaintiff's neuropsychology expert, and his evaluation in particular?
Yes,
But you looked at everything. You looked at all the records?
I did.
And we don't have to name them all. There are thousands, correct?
Yes.
And they span what period, do you recall?
2004 to 2022.
Okay. And
They brought me lunch and it's cold. How dare
after we
they?
come back from the break, we'll do what we did with Dr. Hesh. You have
I
a
feel your
report that
pain,
also
I
has
really
some
do.
headings, and
Mhm.
that will help us help us take you through those. But if we may start with just a general understanding of your expertise and why the jury should listen to you about these matters.
So I'm a board-certified neuropsychologist. I have a PhD in clinical psychology with a specialization in neuropsychology. I then completed a 2-year fellowship.
good for
at the
you,
Veterans
girl.
Hospital
Brag much?
in Tampa, Florida, where I received 2 years of specialized
Tampa,
training
Florida,
in the
that's
full
where
spectrum
weirdos
of brain
live.
injury, from mild to severe. And brain injury has been my primary area of expertise since. I was then a faculty in the neurology department at the University of Utah for 6 years, and during that time, I regularly lectured to physicians and psychologists and trainees on concussions and provided continuing education courses on
What do you want, a
concussion
prize, lady?
diagnosis and management of this. And then since 2011, I've also been an independent consultant to professional sports teams as part of their concussion protocol. That is all required now. So when a player gets a concussion, they are required to have an evaluation by me in order to be cleared to return to play. So I am deeply involved in concussion. And for the past
you
2
see
years,
the movie
my work
Concussion
is
with Will Smith?
primarily is 80% concussion.
So in your review of Mr. Sanderson's medical history and other records, I guess we should mention, did
This
you
guy
review
is
the
a
Deer Valley
dreamboat.
records?
I did.
Okay,
Even
the
Karen
incident
loves them.
report and the instructor comments, these accident records, you reviewed those?
Yes,
And you reviewed depositions connected to the events of the collision.
I did.
So in your review of all of that, what is your opinion about Mr. Sanderson as it relates to concussion?
You want me to go into my first opinion?
Yeah, we'll get to it, but just for the general overview.
In
yeah.
general, that if he suffered a concussion, it was at most a mild concussion.
Great. And what about the symptoms connected to that concussion if he had one?
I believe that the symptoms resolved, or the symptoms that were there might be better explained by other conditions.
That pre-existed the collision?
Yes.
Okay, so that's a good just general overview. Anything else you'd add as a general overview of your opinions?
No.
That's a good just short, again,
It's a good
we'll get into
introduction.
details.
Yes, there's a lot of details I'm looking forward to going into.
Okay, great. So
Of course you are.
The
She's smart.
exhibit
I
that
think she's pretty,
the
too.
jury was just looking at with Dr. Hesh. It's a plaintiff's exhibit P43. I just switched my iPad here into the system. It looks like it's taken a second.
Oh, take your time, sweetie. You can take all
This
the
is
time in the world, James.
Executive functioning table.
Sorry you have to deal with these
Do you recall
bitches.
seeing that?
I do.
And do you recall reviewing that in
Kim came back. Hi, welcome back, Kim.
Dr. Goldstein's evaluation of Mr.
I was
Sanderson?
going to say, Annie, I'm very offended.
That's where this comes from.
Because you're filming
Oh,
me
shut
and you
up.
don't have my consent, and I have
I'm
rights,
going to just
and you're going to be
pull it
hearing
up
from
right
Melcher.
here and ask you,
Oh, shut up, Kim.
what does this table, what is it
Miss
trying
Nice
to accomplish?
Kim. I'm
Okay,
so
this
nice.
is important.
I'm the nicest person.
So this is a self-report measure that Dr. Goldstein himself designed and published. I can't speak to it. It's not something that is commonly administered in clinical practice for adults. I've never seen it used anywhere other than Dr. Goldstein. So I can't speak about the validity of these scales. But what I can say is that this is a really nice quantification of the patient's subjective
I use big
complaints.
words.
It is not evidence of objective deficits. It's just a summary and quantification of what the patient is reporting.
And so
Oh,
if you would
big
for the
word.
jury, when you use those terms subjective and objective in a neuropsychological sense, what do you mean by them?
So subjective is just the patient's opinion or perception. Objective
I know what that
is
means.
something that
Don't
is
have to talk down to
measurable.
me.
And when we get into the neuropsychological test results, those numbers are objective data. And I will later show you how some of these contradict some of the objective data.
So is it your opinion that the results here that plaintiff's attorneys have been going through, those represent only Mr. Sanderson's report of his own sense of his executive functioning?
Exactly.
And there's other evaluating
James is so cute.
physicians or neuropsychologists
I love his
that have
braces.
done objective
Taking care of
evaluations.
his
Is
teeth
that correct?
and his wife.
And can you give us just
He's
a brief
so
sense
lovely.
of what those are, when they happened?
Really
So he
respect and
had,
appreciate him.
A battery of tests that measure multiple areas of attention 1 month post-injury. He had a battery of tests that measures multiple aspects of memory 2 months post-injury. And then he had a full neuropsychological evaluation 1 year post-injury.
And what did those exams
And then he had
show?
Dr. Goldstein's evaluation, which is 4 years post-injury.
Right, thank you. So in all of those evaluations, what would you say as a summary of the findings? You
No.
can take them one by one if that's best.
Your Honor, I object. There's nothing in her report about this.
Of course you do, foghorn.
It is in my report, and I would love to be able to talk about it in the context of my first my
So you have
opinions.
to listen to the
I'll have to deal with the objection. That's okay. That's quite all right.
I'm just a simple country.
I will do that.
Doing sound
Maybe
with-
we
we're
could
doing
do
full of
that
soundboard
over lunch.
voices Sure. now?
And do you have another area that you want to go into for the next 5 minutes?
Seems like this is a good time to wrap up.
Okay. Why don't we take our
Soundboard
recess
war.
now, and then we'll return at 1:25.
Recess? What are we, like,
Thank
5?
you.
I'm an adult, Judge. I don't need you talking down to me. Jesus. Oh my God, Becky, look at her butt.
That's so bag.
Ugh.
Well, here's a new voice I haven't tried yet, so this will be interesting.
Oh my gosh!
Hello, Curtetta. Oh, there's Gwyneth. You know, I really respect Gwyneth. I am an often buyer of Goop products. I have a jade egg inside of me right now.
Deposition.
And I
Is that
use
right?
her sex pills.
Okay.
They make
Let me
me
pull
have
that
so
up,
much
and then
more
I can
sex with
address
my
your
husband,
objection.
Jacob.
Good products are the best balance. I use them all the time, and let me tell you, they have just improved my life in every possible way.
Oh, do you have a jade egg inside you, too?
Of course I do. Jade eggs are best eggs.
We should take
Okay,
each
yeah,
other's
we can
jade
do that
eggs
over
out
the
and
noon hour.
swap them.
Sisterhood.
All right.
I
So,
feel like I'm the least
remind me
feminine
again, what was
person
your
here.
question, Mr. Egan?
I was just asking about the post-accident evaluations, and she does discuss those, I believe, under...
Can we see James, please? I don't want to see this old cranky judge.
and maybe also in...
Oh my God, how many tissues you gonna take there, lawyer?
He's so wasteful.
You gonna go to the bathroom and jerk off or something? Jesus.
About Goldstein's in the 2017 Dr. Madsen
And what's with Nancy Grace in the crowd?
Okay. And so that was the direction
Is that
you were
Wednesday
going
Addams?
based on using the parameters of her reporting?
All she talks about is March and April of 2016, March 8th of 2016.
And this is under 3, neuropsychological evaluation.
Oh, now Terry's here.
Madsen, 2017, and then she touched on Goldstein's evaluation in 2020.
Okay. It's different than what. So the subject matter in general is certainly within the scope of her report, so objection will be overruled.
Your Honor.
As I said, it's under point 3, and if you go a couple paragraphs in, you'll see it.
Stop coughing. Oh
I'm
my
just a simple
gosh.
country lawyer.
All right, so objections overruled on that question, and if you need the court, this pretrial should take no more than 45 minutes, so you can let the clerk know and we could get back together if necessary, but otherwise, 1:25. No, I'll go to the
All right,
next
so we're
court.
taking an hour and a half break, I guess, or something like that.
People.
He scheduled another hearing.
To the stand, can we confirm?
Your Honor,
Will he in the courtroom this afternoon?
Your Honor, they released Terry Sanderson. They said they weren't going to call him again.
Yesterday.
Yeah, yesterday.
So were you
That was for the to complete their cross of the scope of your direct. they're going to call him under the rules as the adverse witness in their own case. So, anything else, counsel?
No, I
We're
just
getting
want to
more
make sure he's
Terry?
in the courtroom this afternoon.
In the courtroom or available to testify?
Oh, I thought he was going skiing. So
Okay. Can you make him available,
Yeah, I thought he was
Mr.
still on the
Sykes,
stand
this
too, but
afternoon?
apparently
No
you guys
problem,
had to
right?
talk about this yesterday.
Thank you.
Okay, so is it happening or is it not?
Did the
Yeah, it
judge
seems like-
really just hold on?
I need to take the voice off. Did the judge really just make a joke? I thought he was going skiing because that's pretty fitting, given that's what actually he
The
does.
plaintiff has used 42 minutes, and the defendant has used 1 hour and 35 minutes. 42 minutes for the plaintiff, 1 hour and 35 minutes for the defendant. Thank you.
I mean, that's
Which
typical.
includes their closing. If that includes
If I
their
have
closing.
time.
That's going to be one hell of an interesting closing.
Oh wait, so sorry. What was that's how much is left?
Apparently, yeah.
1 hour and 35 minutes. Plaintiff has used 2 minutes, and the plaintiff has used 42 minutes, and the defendant has used 1 hour and 35 minutes. 42 minutes for the plaintiff, 1 hour and 35 minutes for the defendant.
That's how much they used.
2 minutes for the plaintiff, 1 hour and 35 minutes. Plaintiff has used 42 minutes, and
Yeah, that's how
the
much they've
defendant.
used. So that means that's not much time is left. I would have been far more intrigued.
Because they said no. There's 2 different time brackets.
It was the same times.
The plaintiff has used 42 minutes, and the defendant has used 1 hour and 35 minutes. 42 minutes for the
135.
plaintiff, 1 hour and 35 minutes for the defendant.
Okay, fine.
Thank you.
I'm sorry. I interpreted them as 2 different time
No, I
brackets.
got
I did
excited
too,
there.
don't worry.
No, y'all. That's why I was going back. I didn't get it till the second time, but it would have been far more interesting to hear them tell us how much they had left. Anyway, wow.
Yeah.
Oh, we're zooming out again. Who are we going to see this
where are we
time?
looking now? Where are we going to look?
We are going to look at a camera instead.
We're looking at doorway, and
From the
only one light is on.
window
Someone
to
needs to
the
change the
wall.
bulb.
Why don't they just
The
keep
wall.
the camera on the courtroom itself? Aren't they allowed to do that with the audio off?
I mean, it depends on the court's order in terms of what they do or do
Wow,
not
I've never
allow.
seen this. Look, they're giving us
No, I've
full
never really seen
coverage.
this. I've never really seen this either. Normally, you just focus on the seal or clock or chandelier, and then I have to make up a whole love trilogy during the. Did you guys see when I did that during the Murdoch trial?
A little
You
bit,
see
yeah.
that? I was writing fan fiction between clock, chandelier, and seal.
I missed it, but that sounds amazing.
I feel like I remember you talking about that on
Yeah.
Friday Night Frenzy or something like
Yeah.
that. Yeah.
It was good times. The love interest between chandelier and clock, or chandelier and seal with clock trying to interlope between them, trying to break up the love romance. Had a whole telenovela thing going on.
It was pretty epic. It was pretty good.
Yeah.
I gotta say, speaking of epic, this hair gives you power. I just feel it. It's the constant throwing the hair out of my face that gives me attitude. Just like,
Well, I have to say, Andy, I mean, I know that people say that side parts are the millennial thing and they're very chuggy or however they want to put it, but side parts look good on everyone. You work.
thank you.
Work.
Thank you, girl. I'll allow it. Coexist. Thank you for making me laugh nonstop being a Karen. You got it. Christy B was falling asleep until Karen's Signore gave me life. Char says, with your Karen hair, I only hear, oh God, Becky, look at her butt. It's so big. Yeah, I try to do it for you in the voice. Callus Sandy. Andy, where's your vibrating necklace? Nobody's bought me one. Who's going to buy me a vibrating necklace? I have a P.O. box. I will accept. If you'd like to go, I'm now challenged. You guys are all watching.
No.
I challenge you to go to Goop, go to the sex toys section or somewhere, find the most silliest stuff like the vagina candles or whatever. Wellness. Is it under wellness? Sex toys. There you go. You can find a lot, vitamin, whatever. I will review Goop items you send. I mean, if you get me a dildo, I'm not gonna, give me the suction device. I guess I will
No.
review it from the box. I'm not gonna actually use it. Somebody
Just
already
say,
sent me one of those.
respectfully,
Kim,
Andy, I
didn't
don't
use
want
it.
to know.
Yeah, or at least be funny to open them. So yeah, any weird Goop items, I will review them as a Karen. So please, or a vibrating necklace would be good for a character. So please, yes, send on over. The P.O. box is in the description of this video. You can send whatever you like. Support the channel. I think the other, since I have, where's my thing here? If you go to my link tree also, There is a wish list. I'm trying to upgrade the lights to be able to do more automated things like Steph does. She has better lights than me. She invested better. So if anybody wants to still, I'm going to probably just buy them. But if anybody wants to get in on that, there are a few they're a little pricier because it's the Philips Hue. But that way they're all linked to my Stream Deck and I can create like the red theme and then boom, it all will go. So if anybody wants to help, there are some random gifts and cute, fun little things that I did add.
Philips Whiz, which are a bit cheaper, and they allow me to do the light effects and stuff like that. So that's kind of
do it on Stream, but can you do it on your Stream Deck?
With webhooks, you can through if then that. So I use an intermediary. It sends a webhook and then it talks to my devices. I have buttons, so I can push.
I can add the Philips scenes to my Stream Deck exactly.
I have a button to change lights like I just did. So I just push the button and it changes the lights.
Have the mood lighting. See, yeah, exactly. It's a nice feature that I can't do currently without going to an app and moving it all around. It's not easy to do. So it's a fun little perk if anybody wants to help upgrade. People have asked. Yes, you can still be part of the studio. So Callie, that's where my vibrating necklace is. It's on goop.com. So if you'd like to surprise me, go for it. I'll check out the P.O. Box next week. Thank you for the 6. Guys, we're here every day, just so you know. Just because there's a trial and we're all hanging out longer doesn't mean we're not also here regularly talking about other fun pop culture events. I feel like this trial and trials tend to bring us more together. So yeah, we'll do these for sparingly. Usually if it's a celebrity trial, we'll probably be on it. As long as it's not really, really bad. This one took some life out of me. Rose Marie Cato, can't wait for the wig. Hopefully you enjoyed it. We have more wigs. I got a whole box of them. Sebastian, thanks for making it go with the new wig from Sarah, Alice, Spidey Rave, Michelle P, Emily Morse, bring on the Karen wig, bring out everyone wanted the Karen wig. Dave Rollins, thank you so much. Sarah, again, go for it, Andy. Mary Trish, love your channel. I've been watching your channel for a while now. I'm a member, so I am happy. You guys can become a member too. Hit that join button anytime. Pick a tier. You'll be able to support us. Let's see. Did I catch up? Toshia Poundstone, good to see you. It's been a little while. He has no brain for a lawyer. He is not in the courtroom. There you go. Good to see you, Toshia. Mary Trish, I've been watching your channel for a while and so happy I'm a member. Oh, yeah, you did that again. Well, I got double, so thanks. Sarah said I've been watching for a while as well. Thank you. Katie Artist earlier did the Super Andy Fund. So did Paul. And I think Josh McKenna from earlier. Ferris Bueller gets an F in public speaking. Kataya, he reminds me of Mr. Bean. Okay. Dave Rollins, sorry, Andy, missed my name off the last Stream Elements referring your duet. We're being treated to the musical stylings of Popcorn Planet duo today. Hey Kim and it's Hey Andy and it's Kim. Yes, we were doing some Coldplay, James Egan music. Tristan King, good to see you, Tristan. Kim, I have a present for you. I looked in your link tree a while back and didn't see a way to send it to you. How can I send a present to you?
I did respond to Tristan a bit earlier. I do not have a P.O. box at this time. I do appreciate your thought though, and I think I remember you from Vegas. So
yes, she was in Vegas.
Yes, I think I do.
She was
we
very
had
nice.
a few really nice conversations. So I'm glad to hear from you.
Kim, Tristan just reminded me. I have a present for you. Would you like to see it? I have to ship it to you. Do you want me to show you the present?
I
was supposed to give this to you when I visited Canada. I was going to give it to you in person, but we didn't get to see you. But would you like to see the present I got you?
Sure. I am terrified. Oh my gosh!
Look at that chat. It's Cinderella in Rolling Slipper magazine, done in the Britney style. I was like, oh, Disney and Britney?
Yes.
I gotta get this for. Isn't that adorable?
Hello. Yes.
I forget who the artist was, but anyway, I'm gonna send it to you, and you can choose where to use it. But it's not too big either. I don't want to get you too massive to buy someone art, but I thought that was pretty on point for your pop culture Disney love. So yeah, there we go. Stay tuned. Send me your address again so I can send it to you. I hope you'll let me.
Okay. I need to do stuff over here. I have a lot of like empty space here that I need to.
Yeah. So I thought it could fit there if you like it. No pressure. Apple and Moses testimony reading was terrible yesterday. Agreed, Josh. It was really awful. Tristan again. Sorry, I've been a minute since I've sent one of these. Life gets busy. I always watch the replays and clips. Keep on. Much love. No, Tristan, no need to apologize. I always see you in there. We appreciate you. You're a good one. Thanks so much for supporting. Ray, this trial is so botched, in my opinion. If Gwyneth Paltrow loses this case, it's because of this judge. It just doesn't feel fair. But what do I know? I'm with you 100,000%, Ray. Because Kurt yesterday was like, oh man, this is getting crazy. Yeah, it could win. I don't see it, but he knows better than I. I'm going to be super pissed. I don't understand what on earth would make people think that. These are from last night. I missed a couple. MC, after learning my lawyer misrepresented me when I sued a scammer contractor, I'm really angry. I'm glad I got to laugh at this case with all of you. Take the edge off because I was burning mad. Well, sorry you went through that, but glad we got to help. And then Holly Mommy, family was there yesterday. Moses is missing school. They went to a reading transcripts to save time. Yeah, it was brutal. And thanks to everybody else who supported. All right, I'm all the way caught. And then Donna W just sent one. I think they're keeping Terry out of the courtroom so he doesn't get pissed off. Maybe. What is your thought on that? What the idea that he's not in the courtroom is? I'm going to take my.
It's not a good look at all because Gwyneth is there. Like if they both weren't there, then that wouldn't be that big a deal. But the fact that only one of them's not there, it's a bad look for him. It's like because he doesn't care enough about his own case to be present, and she is present. I mean, there's no particular need for her to be there, except that it shows that she cares, right? So,
right,
the fact
her
that
not
he's
being
not
there,
it's like it can't help his case. It's got to hurt.
Do you think that's him insisting it since he's the client, like he gets to make that call? Like why do you think they're not like, dude, you got to be there? Or do you think there is maybe a little bit of they're worried if he's there because it's not going to play well?
I mean, I don't know enough about the issues to have to know who's making that decision and who's not. But the fact that the client's not there, it's like it would make me very uncomfortable if I were trying to do this case.
Kim, go ahead. We're waiting. By the way, we're on lunch break for about an hour. Go ahead, Kim.
Can I get the speculation screen up before
Yes.
I say what I'm about to say? I can't help but feel like when I step back and I look at this whole situation, I don't really think the lawyers could tell him to be in the courtroom or not be in the courtroom. Because we've seen how he listens to authority when it comes to his own survival and his reactions. So it makes me a little bit hesitant to think that even if the lawyer said to him, well, Terry, you probably should be here, he could probably be like, I don't care. And I also can't help but feel like I'm seeing the word being thrown out a lot. And I know that it is a bit of a buzzword right now, but I'm definitely seeing a lot of stuff lining up. And I'm nowhere near the only person who thinks this. I wonder if he has narcissistic tendencies or if he is a narcissist. And at that point, it's, he had to be in the room when Gwyneth was on the stand. That was important. He had to be there because it was about the dialogue. It was about the fame, that he thought it was cool that he was with the famous person and everything else. And now that, famous people aren't on there, it's not as important that he's in the room. Now, he has to be there right now, I think, because there is a possibility of him being called back to the stand. And that's, I don't know.
Yeah. His own lawyers being like, "Oh, you
Kim,
released
sorry, I
him
just text
from
you a boss
testifying."
level.
Yeah.
You're on. Thank you.
Okay.
His own lawyers trying to argue that they released him from testifying. I'm like, that doesn't really even make sense. I mean, I don't think you can release the parties. You can release the other witnesses, and they're no longer available because if they're there under subpoena, and like it's like, okay, we're done, so you're released. And it's like, no, come back. But the parties are the parties. So it's like, it's like, what is this, unfair surprise? We had no idea our client might be asked to testify. I mean, what are you trying to do here?
Yeah, exactly. I mean, it feels a bit like playing dumb, but I mean, it's just a simple country lawyer, and we're just trying to do the best we can. I don't know.
Simple country lawyer. I'm trying to decide who I hate more between that and gum chewing guy. I think it's still gum chewing guy because that's just like blatant disrespect. These lawyers though with like nerd, and I'm a simple country lawyer. I'm like,
I missed some of the nerd. I heard about it. I came back in the room and my sister was like, "This is one of the most cringe things ever." She's like,
"It was pretty cringe.
I don't know what's happening." And I'm like,
he called his own expert witness nerd twice. He trying to be cute about it. Like you're the chief medicine for like 2 states for your hospital. Yes, what were you before that? Chief neurologist, nerd. And what'd you go to school for undergrad? I went to school for biochemistry and whatever nerd. I want to die. Yeah, I was definitely having secondhand cringe for sure.
Oh, I hate that. Oh my gosh. Do you
And
think
then
he
later
was
it's like,
trying
you
to
know,
be?
he was
So
trying to
go-
be cute, and then later, like 15 questions later, out of nowhere, it's like, well, you know, when I called you nerd earlier, I was just kidding around, right? I'm like, oh, ugh, kill me. And then he said also the lawyer's trying to be cute. It's like, oh, yesterday you read like 200 pages of garbage. I don't mean garbage, I mean documents. I was just kidding. I'm like, what do you mean you're just kidding?
I honestly, and again,
What are you talking about?
This is speculation. I wonder if it is that Mr. Owens is feeling so terrible today. Maybe he took some medication and the filter is a little bit more off, because he kind of sounds like me when I have NyQuil and like a muscle relaxant in me and I start laughing at stupid things and saying stupid things.
Yeah.
You know what I mean?
So between the two lawyers on their side, there was definitely some, or those two lawyers, there was definitely some maximum cringe. I could not believe the lawyer actually said, "I'm just a country lawyer." You're not supposed to say that. That's just like a meme.
He said it before though. Like that's why
Did
we
he?
started saying it, and because it was like, I can't believe this is real. And I remember, like, I started
You
talking.
can't do that. You also can't do that unless you're wearing suspenders and or seersucker. You know, you don't have the right look for that. I'm sorry.
Well, just now I mentioned it to my husband and he showed me the clip from Futurama of the chicken lawyer, which is like scary like, oh my gosh. Like, does he not understand that he's like almost like a walking joke when he does that?
I don't think he understands those things. No, it's just their overall presentation and the lawyer also not being ready for cross-examination, apparently, with the clipboard in hand, and just like the presentation and polish is not there. It's not what I would come to expect.
Did you notice though this morning they gave one of the witnesses though a pointer? So
yes,
right?
They discovered pointer technology. Wow, amazing.
The more we know. Just the technology.
We want to
astounding.
write on their big whiteboard again. It's demonstrative. We want to write on their white thing that they printed out and spent money on. We would like to write on it. I'm like, no. I want to write on another man's demonstrative. What are you doing?
I'd hope they'd have the money to go to Dollar Tree and get their own little Bristol boards or something. You'd think. But I'm not assuming anything anymore.
Yeah.
Oh my goodness. So just taking a look to see what you guys have been sending in the chat.
Wait until he loses and he tries suing his own lawyers for malpractice. That's just the next step of this thing.
That's going to be the funniest thing. I hope that is recorded. I would watch the heck out of that. Let me take a look here. I did actually get another PayPal. I wanted to say thank you to someone. Thank you so much to Lloyd. And Lloyd asked me a question about my hoodie, and I've had a couple people in the chat asking me about my hoodie, so I'll just say it's from Aritzia. It's from the brand TNA. I believe it's called the Cozy Fleece Boyfriend hoodie, and I buy it in tall, so it's longer. And I've been buying them for years, so a number of them that you'll see me wearing, that you can't buy them anymore because they're old. Some of them I've had for like 10 years. They're that good. So there's that. We also got a super chat from Stepcat. Differences in trial / presentation. Speaking as a once juror. Oh, pop up, go away. I can still remember a lot of the Depp trial. I cannot tell you anything of the expert or other witness testimony from yesterday or previous days. We blocked it out. It out. And then we also had a comment earlier from Claire that I think I missed. Yeah, I spent the day visiting my dad in the hospital, and then I come home to Karen, Andy, you've made my day. I haven't laughed so much in ages. Well, I hope your dad is doing okay, and I'm glad we were able to make you smile. That's always a good thing. So do you guys have any questions for us that we can answer while we are waiting for court to come back? If you guys have, I'd love to know your thoughts of what you thought about this morning. If you have questions for Kurt, let us know. Thank you so much for being here. If you guys have not subscribed to him yet, please check out Uncivil Law on YouTube. And I would appreciate it, mods, if you could drop his link so our viewers can support him because he deserves it, and that would be awesome.
Thank you.
No problem.
Yeah.
Okay, someone just said, so UKR said, do you think GP can lose the case because of Owens?
Yeah, I think when you're trying to remember that the standard here is preponderance, so it's slightly more likely, so it's 50.1%. So that's one of the reasons that when I'm trying to score this, I'm trying to be a little bit cautious about it, because and also, as I was trying to say, like, the question of who caused the accident and the question of how much they're responsible for are different questions. And I think sometimes, based on some of the questions that we get, that there is a lack of understanding of that. So I can conclude, for example, that Gwyneth Paltrow caused the accident, but it doesn't require me to conclude that the injuries that he suffered are a result of that accident. Those are completely separate questions. So it doesn't necessarily flow that if I were going to rule for Gwyneth, which I personally would not, because I don't think the evidence is there. But even if I did reach that conclusion, the evidence, especially from this morning's expert, which I thought was very, very well done. The first expert this morning, I thought was just a very nice presentation, about as well as I could have expected it to be done. Just very in out, got what you need to get done, didn't sit on it too long. I mean, some of that's time constraint, but sometimes constraints can really produce some good results, and I think this is one of them, because I think that was better for the constraint. In terms of looking like, here's a photo, here's an image of the brain from before the accident, here's an image after the brain, after the accident. These are the same images. There is nothing here. And I'm like, okay, that's really good. So it helps to suggest very much that the mental conditions are not a result of this. So if I were inclined to think that Gwyneth Paltrow caused the accident, the damages I'd be looking to award would be for the broken ribs and the injuries there too, not any of the mental stuff. And that's how I would split it. But again, I wouldn't rule for Gwyneth, but I just try to remember the fact that it's a simple, it's like, well, which of they're both suing each other. So they're both claiming that the accident occurred. It's just who hit who. I mean, technically they can both lose. You don't have to believe either one of them, incidentally, which is also nice. But if you believe the accident occurred, the question is, okay, which do you think is more likely on balance as to who's responsible for this, and go from there.
Yeah, absolutely. Rhonda just asked, is Kurt married?
I am not married, no. I am single and looking.
There you go.
So.
Okay. Randy asked, I have a question. I have friends everywhere, but no Canadian friends. Will you be my friend? Sure. Take a look. Kurt, how did this case get past a motion for summary judgment? From Jennifer.
Yeah, so a motion to summary judgment or a motion to dismiss, you don't weigh competing evidence. So in a motion to dismiss, you say, is there basically any way to get there? And there is a way to get there. I mean, and also in the summary judgment, there's a way to get there. So a motion to dismiss for summary judgment, it would be improper because he has his own testimony and the judge doesn't weigh the evidence. He simply says, could a rational juror, based on the evidence that's available, reach this conclusion? And the answer is yes, you could, especially because he does at least have one other witness. The degree to which you believe him or not is, of course, a question, but it's a question for the jury. The judge doesn't weigh competing evidence. So in a motion to dismiss, you're asking, does this legal theory even make sense? Is there anything here legally? In a motion for summary judgment, you refine the evidence a little bit more, but if the question is questions of competing evidence, then you shouldn't grant it. So I don't think the motion to dismiss would be correct, or the motion for summary judgment would be correct based on what we see. A rational juror could choose to believe Terry. There's a lot of evidence to the contrary, but it's a question of weighing.
Yeah. Yeah.
And, one of the things that the jury does is weigh witnesses. They weigh credibility. They can believe witnesses in whole or part. As to expert witnesses, they can believe them in whole or part. They're allowed to discount their conclusions. They're allowed to discount things because you have competing experts who tell competing things. So of course they're allowed to. It's like, who do you believe? Who do you not believe? Do you believe them a little bit? Do you believe them in whole? Do you believe them in part? Do you believe the thief or the 10 nuns? I mean, it's sometimes the thief is telling the truth.
Yep.
So I mean, it's just a question of fact. What do you believe?
It's a very good points for sure. Somebody asked, Kurt, random question. What do you think of the lawyer from Breaking Bad, Saul Goodman?
His ethics are deeply problematic, and he does many illegal things in sort of his things. But I did like when he was doing that commercial, when he was working for that one law firm, and he has that sort of more flamboyant style, and the firm he is working for is sort of old school and real traditional and stodgy. And I kind of like a little bit more of that, a little bit more flamboyant style, a little bit less, reserved. And so there are elements of him that I did appreciate.
That's good. Catherine DeHaas, I see what you're saying. I'm assuming you are referring to Terry, that, we know he was in court today, and he has been in court some days, but there were a number of days where he was not. And they said that he said it was because of his daughters, but he also was not there for a number of experts. So it's the confusion of them saying, well, he didn't want to be in the room because of his daughters, but then when his daughters weren't testifying, he still was not there. So that's what we're referring to when we talk about events from last week going into this week. We are aware that he was in court today, and we have discussed that. Oh, you definitely have some people that are thinking you are cute, Kurt, in this chat.
Well, hope. I'm not beyond meeting my future partner through my YouTube work. So if you want to contact me, you can DM me on Twitter, or you can send me an email. My contact information is through my link tree. It's kurt@uncivillawllc.com. You can find that on my link tree as well. And I have a Discord, and there are lots of ways to get in touch with me. So I do some cooking as well. I did a cooking stream recently where I made some soup, very popular. I make a good beef Wellington. So I got that going for me. I can do some grilling.
No, that's good. Rhonda actually just said something of Kurt is too cute, could get lost in those eyes. And then somebody else just said, Kurt, was it Fope? I'm sorry, I don't know how to say your name. When are you going to share another recipe?
Yeah, well, as it happens. Yeah.
That's good.
Stuart, I'm not a fence sitter. I've told you my opinion. I don't believe Terry. I would rule for Gwyneth. I told you that. So I told you my opinion, and then I also told you what is possible for a jury to believe, because I'm not in their shoes. I'm like, here's what they could do, because I understand that they are not me, and a rational jury could see things in a way different than me. So I'm not fence sitting. Also, since the standard is slightly more likely than not, it's like which side of the fence do you fall on is a bit of a question here. So I object to the characterization that I'm a fence sitter. I would rule for Gwyneth. So I don't know what more you want from me.
Yeah. I can say myself as the person who tries to be empathetic and kind and try to look at things from different perspectives and put myself in other people's shoes and try to understand. I get the fence sitter comment a lot, and that's not necessarily the case. But I think a lot of the time, sometimes some people want you to have the same opinion that they do, and if you don't, they have opinions on that, and we cannot make everybody happy, and diversity of thought is important and a very good thing. It's good to not be in an echo chamber. It's good to have differing opinions and explanations as to why. So Stuart,
one of the things they teach you about in law school in particular is thinking on both sides of the fence, because every lawyer has to think both ways, because I've made the analogy before this stream and I'll make it again. It's a little bit like a general preparing for a battle. If you're not trying to put yourself in the mind of the opposition force and be like, how would I attack me? You're not really doing your job. They're trying to think about how to attack you. And, it would be nice if you could think of all those things before they do, so that you prepare yourself accordingly. So one of the things every lawyer should do if they're running a case, any case, is think, how would the other side attack me? How do I beat myself? And, it's not that you'll necessarily think of everything, but you try to think of as many things as you do and try to look at like your weaknesses and blind spots, and you try to assess things. So I'm like, okay, well, if we're looking at this as a jury, like where are the possibilities? And, go from there. Plus, I've been surprised in the past as well by jurors. There was the recent case of the ice cream murders in Florida where he was just convicted. And what was interesting about that, it was a retrial after a mistrial because the previous jury came back 10-2 in favor of acquittal. So the previous jury voted 10 acquit, 2 guilty. And I didn't really think the state put on a very strong case in the retrial, but they just convicted the guy. So, when you're forecasting this and trying to be this, you got to remember that sometimes things come out other than the way you expect things.
Mm-hmm.
So.
Absolutely. Absolutely. The Knight of Lore just asked, I want to hear what Kurt's favorite legal field is. I think I might know one of your answers we talked about yesterday.
Constitutional law is my favorite.
Mm-hmm.
I love constitutional law. The Supreme Court is my favorite.
Mm-hmm.
Because it is almost by definition, the highest level of thinking about the legal issues. It's the highest level of philosophy as it applies to law, and you have really interesting legal questions where you're competing on interesting legal principles and trying to resolve things. I find that it really heightens my senses, and every once in a while when I get a case and I'm like, these are both really good and I don't know what the answer is. That happens sometimes, and that's thrilling for me because it makes me think.
Yeah, absolutely. Sorry, I'm trying to keep up with the chat, guys, and you guys are interacting, which is awesome, which I really do appreciate. Wanted to say to Betty, just said, it's my birthday. Could you wish me a happy birthday? Happy birthday, Betty. I hope you are having a lovely, lovely day. And I'm just taking a look here.
Kurt does not believe Terry. Stop saying it. Stop.
Oh my goodness. Okay, so
doesn't matter how much I say, this is my opinion, this is what a jury could do. They still conflate the two. It's killing me.
Yeah, it's okay. You can't. I'm sorry, I don't know how to say that word, and I apologize. Me and pronunciation are not friends. Miralesti Art Studios? Or Miralest? What do you guys think the chances are that there could be a hung jury? I think Gwyneth will win, but you never know.
Unlikely in a civil case.
Okay.
Because the standard is so low, it's unlikely. Also, I don't know what this particular jurisdiction requires, but most jurisdictions do not require unanimity for civil verdicts. That was a bit of an unusual feature in Virginia, where they did require unanimity. There was a 7-member jury in Virginia, and they required unanimity. But that's unusual in a civil case. Most jurisdictions are like 10 out of 12 in a civil case. So hung juries in civil cases are pretty rare as a result.
Have you ever seen it?
No.
Okay. Good to know. Good to know. Oh, Carbonized Stardust, I love you. Just said, Kim, you're Canadian. We're wired to look from both sides. We are, and it pisses a lot of people off. Patty B, I don't believe Kurt said that he would vote for Terry's side.
I said pretty much exactly the opposite of that.
Exactly. What he was talking about is the possibility that a jury could, because it's hard to anticipate what a jury is going to do, because as he explained with the ice cream case, you could think they'll go one way and then they go another. It's always different.
Yeah, especially like in a criminal case, you figure there's like a 10% chance that they'll convict no matter what's true. It's like there's just like a sitting percentage chance. You walk in and you're sitting at the defendant's table.
Mm-hmm.
Things are not going in your direction. We tell them innocent till proven guilty, but what jurors really do in the real world, and that's in criminal cases where that happens. In a civil case where the standard is so much lower, beyond a reasonable doubt, supposed to be something like 95% plus. I mean, judges won't quantify it, but that's normally the kind of numbers we're talking about. It's like a 95% level certainty or greater, depending on what lawyer you ask. But this is a 50% case. It's like, who do you believe ever so slightly more than 50%? 50.1 probably fine. So to not give the devil his due and be like, well, it couldn't, and of course the jury comes in with their own sets of prejudices too. They could do it just simply because Gwyneth is rich. They could do it simply because she's a celebrity. They could do it simply because they don't like her personally. Then jury may not necessarily realize that's why they're doing it, but people with cognitive biases,
Absolutely.
people are able to come to all sorts of strange conclusions without really necessarily knowing why they're doing it. So to not say that there's some probability here that Terry could win would be insane. He's clearly suffered an injury. He suffered a rib break. That happened. Now, who's responsible for that is a question, but it's not like there wasn't something that happened. So for the jury to conclude, that's that Gwyneth did something is not, completely unreasonable.
Absolutely. Daenerys just asked, or Daenerys, I'm not sure. Daenerys? I hope I'm saying that okay, and I apologize. Do you guys believe in any of the testimony of Terry's daughters? I can strongly say I believe one very important part of the testimony of the daughters, particularly Shay, and that was her unhideable terror of being on that stand. And I don't know how much of that was she was afraid that she was in a courtroom being filmed or that she was afraid of her father. That was my opinion. That's what I took from that. I'd love to know what you thought, Kurt.
Yeah, no, I tend to agree. I think Terry seems like a guy who has some real anger control problems and seems like he has some issues in his life. And, his daughter probably loves him and is worried about upsetting him and, all the rest of it. So I tend to agree.
Bella J just said, how much did Terry sue the ski resort for? To be honest with you, Bella, I don't know. I know they've been dismissed from the case. Kurt, are you aware of that? Because I personally do
I'm
not
not
know.
sure.
Okay. If there's anybody in the headline chat that has a moment and you guys would be willing to look that up, please let me know and I'll see if I can get that information for you. But I can't stop now and go and find out for you. I apologize. Cheermaster, are we on a lunch break? Yes, we are. Yes, we are. We are on the lunch break. We currently have 51 minutes remaining of the lunch break. Let me see what's going on. Every time I hear ice cream, I have to think of Johnny Depp now. I agree. I desperately, after he said that comment about the Festival of Ice Cream, honestly, since then, I've been like, I want to go to a Festival of Ice Cream. That sounds like the best day ever. Are there festivals of ice cream? Because I would very much like to go. Okay,
Well,
Chris,
Austin, where I live, has a museum of ice cream.
shut up.
It does.
That sounds like so much fun. I'd love to do that. That's amazing.
Yeah, museumoficecream.com/Austin. You can find out all about Austin ice cream glory. And visit me and visit ice cream.
I have to ask, can you eat ice cream while you go through? Because I feel like it would be cruel to look at all of these displays of ice cream and not be able to
There's
indulge.
an ice cream eating portion of it for sure.
That is awesome. For the record, Your Honor, my friend Linda, I love you. I love you. Which witnesses do you guys feel have been helpful to Gwyneth Paltrow?
To Gwyneth Paltrow?
Yes.
Oh, Math Daddy was good, and the witness today was good. I liked actually the witness today. I don't think his presentation was as good as Math Daddy, but I think on a technical level it was more helpful.
I would agree. I think Matt Daddy was great. Just going through my head on the witnesses for GP. I honestly think that the experts on the plaintiff's side contradicting themselves was contradicting each other was helpful to Gwyneth. That would be something that comes to my mind. Sarah, if this was a Jane Doe rather than Gwyneth, do you think he would have brought a lawsuit?
Probably. He seems like a guy who's looking for a reason to blame someone else. I think he would probably sue anyone who's convenient.
I wonder if the obsession of the accident, because I feel like either way, if his health was in decline, he was looking for a reason, to blame, something to blame, and I could see him being obsessive about it. I don't know if he would have gone as hard with the lawsuit, but you never know. Colin, does anyone think it's Kate would run away with a Packer fan? Lol. I am married. I'm very married. Thank you. Just taking a look here.
And the chat is instantly much sadder.
Sorry.
Thank you for holding the fort.
You guys good?
Yeah, we're doing good. We're doing good.
Now we have to fill more time.
We're answering questions. People are asking Kurt questions, and
smart,
some of
'cause we
them
got
have been
48
really,
minutes to
really
kill.
good. Yeah. So at Kurt, now that Stephen Smith is ruled a homicide, do you think they will be able to link anyone?
Probably not. I would doubt it very much.
That whole thing is so tragic. It's
That whole Murdaugh thing was just a really weird case on a whole lot of levels.
Yeah.
And I still don't. I mean, I don't really feel bad for the man, but I still don't know about the verdict on the guilty thing. I still have questions on the timeline. It just seems so tight on the timeline. But, I'm also concerned about the amount of, I'm really concerned on the appeal issue, on the amount of the stuff on the financials that came in, because that seems like a 403 problem right out the ass. Like, it's so much stuff that is off point and prejudicial defense. So if I were writing this appeal, man, that 403 issue is going to be very, very prominent for Murdaugh.
Yeah, I think the thing for me with Murdaugh was the way that the crime scene was treated that night. I wonder how much was missed. I wonder how much was lost. Just with so many people coming in and out, I don't think that helped.
Yeah. Someone asked me about the Donald Trump case in New York. So for the New York case, I have some doubts. I did a video about it. There's a couple of problems with it. New York wants to charge him with as I understand it, they want to charge him with essentially what amounts to a campaign finance violation. But they have some technical legal problems. They can't charge him with falsification of business records because in New York, that would be a 2-year misdemeanor for statute of limitations. 2 years is what I mean. And 2016 was more than 2 years ago, so they can't charge him with the misdemeanor. They can't charge him with the state level campaign finance violation because under the relevant law, as I understand it, that would have been a 5-year statute of limitations. And 2016 was more than 5 years ago. So what it seems like they want to try to do is they want to basically leverage the idea that he committed a federal campaign finance violation, and that itself gives them jurisdiction under New York law, which seems legally dubious at best, because it would be a little bit like New York charging him because he committed a crime that's under Florida's law. Right, it doesn't really legally make sense because they're separate sovereigns, and the United States is a separate sovereign from New York. So this entire legal theory doesn't really quite make sense. So I have problems on the underlying legal theory. Then, of course, this only works if he committed a campaign finance violation, which isn't itself at all obvious, because what the New York seems to be saying is that when he paid off Stormy Daniels, that was a campaign expense. And he didn't report it as a campaign expense. He basically treated it as a personal expense, and it wasn't on the campaign books. The problem with that, of course, is that it seems that Donald Trump has paid off other women in the past at times when he wasn't running for office. So those obviously can't be campaign expenses because there's no campaign. So if those are personal expenses at those points, then one raises the question, what's the difference here? Just because it happens during a campaign doesn't necessarily make it a campaign expense. You can obviously have personal expenses during a campaign, just like you can have any other time. So they want to say that although the other ones were personal expenses, this one is really a campaign expense. He didn't report it as a campaign expense. And then the next part where it gets tricky is that he has to have knowledge of that. Because if he just told Michael Cohen, pay the woman off without like more specific instructions, that's not a problem. It's only a problem if he knew that it would be falsely reported. And that was what he was trying to do. So you have all kinds of problems legally. You have problems on the underlying legal theory because they're trying to basically bootstrap this into a New York specific case using US law, which I don't really think makes sense. They're trying to say that this is really a campaign expense when the other ones are personal expenses, and I don't know how you prove that. And also, I don't know how you prove his specific mental state of his intent to do things. So I have many, many legal problems with this on several different levels. How's that for some legal analysis?
It's incredibly complicated. I think wherever you sit, it's very complicated for sure.
Yeah.
You Care just said, are you bringing back Florida Man Fridays? Andy, are we bringing back Florida Man Fridays?
I don't know. Maybe. Sometimes we don't always stream Fridays is the other thing, just because Fridays are a little lower. Unless there's really breaking news, I notice just don't get as many views on our channel. So I usually take that as time to take a break. So, when we're here, we can try and do it. But doing it as its own standalone thing, probably not. But as a part of our Friday streams, sure.
I have to ask, Kurt, have you seen the people going up an escalator on edibles?
Oh, you want to play that one?
Can't say I have.
That might be a good one. You may enjoy that. Yeah,
I have a couple
funny.
actually. We can play some funny ones.
Yeah, definitely.
Hold on, let me see here. I had a good one. I usually send them to Jami. This was a funny one. Have you seen this lady?
Like you want Jim time, then I'm Wish Jim Carrey. Like you want Jim Carrey, but you go to Wish, and then you get me. Like, why does my Jim Carrey have a vagina somewhere? I think. Maybe. It is kind of ironic that I have this face and I've always wanted to be a comedian since I was a kid. But, like, what else am I going to do? Like, imagine if I was a doctor with this face, just walking in like, bad news. It's cancer. Good luck. I believe the universe is fucking with me. Not only do I have Jim Carrey's face, but tonight I chipped my tooth. Now I look like fucking Lloyd Christmas? Come on!
All right, now we're gonna test Kurt and Kim. You ready? And see who laughs. Wow, both of them kept a straight face. There we go. So anyone else who laughed, you're going to hell.
Oh my gosh. Andy, I'm going to pop off for a minute and just get some food, and I will be right back.
Okay, no worries.
Okay.
I'm going to play some Instagram videos that made me laugh. Kurt, what would you do? Like at this point, he literally just wiped his chin on the dude's nuts. It's a little, I mean, that's intense. I guess you got to keep going. The fight goes on. I don't know. I feel like I would eventually just stop and like, fuck it, you win. Tinkle Tits, what would you have done? You would have liked it, I guess. Here we go. This was really funny.
Oh, I've seen this one. Simply attach the special double back fastener to...
How many times has this happened to you?
You need phone relief.
Damn
the
it!
ultimate and hands-free phone design. Watch. Simply attach the special double back fastener to any phone. Then attach the phone relief headset. It's that easy. Hands-free, pain-free. You'll wonder how you ever lived without it. It's perfect for remotes. Now talk hands-free anywhere, anytime. Office work is a pain for Mr. Phone on the Neck, but you won't miss a beat with hands-free freedom. A must for the entire office. Work goes quicker and easier. The padded headset removes this easily and is fully adjustable. Best of all, Phone Relief works with your favorite phone. An amazing breakthrough product you'll use every day. Now only $12.95. Call toll-free to order by credit card and make this your last Phone on the Neck call. Is talking on the phone getting out of hand?
Wow.
Look out!
I mean, that happens to you all the time, right?
I was definitely solving a very specific problem, but that's, hey, it's an invention. It works. So,
I'm trying to find the edibles one.
Show me an edibles one.
Hold on.
Entertain me.
This one's funny. I like this one. I can't play the song, but this goose will not stop attacking.
That can happen.
What's with this goose? And then it goes in the car.
She abandoned the purse.
It's in the fucking car. Oh, that made me laugh. All right, I think it's on this page. We've been here before. Drunk people doing drunk things.
Okay.
Has a lot of silly ones. I got to go down to find the one specific because there's a bunch. I mean, we could just play a lot of these, but hold on. I'm looking for. Gonna find it. The edibles on the stairs. Hold on, bear with me. I'm gonna cut away from that so you guys don't get a headache.
Edibles on the stairs. It's edibles on the stairs time. Here on Popcorn Planet with Andy.
You gotta. So wait, how does your soundboard do all the? Your soundboard's putting mine to shame.
That was just me singing.
No, but you have one that changes up your shit. What are you using?
Oh, I mean, there's a software called Voice Mod that I have.
Which is software.
Yeah.
Oh, you have to send it to me. DM it to me. I'll look. Here we go. This is what happens when shopping on 500 milligrams of edibles.
Yeah, that's a problem. That's definitely
They're going
a problem.
upside down. Oh, there goes the bag. They're still not up.
Oh, that's got to be really painful. Someone press the button. Someone press the button.
It's still going. There was one that really makes me laugh. Hold on, I gotta find that one. I sent it to her a while back. Oh my god, this one. Wait, I gotta find this one because it's the funniest one. It makes me laugh every time. I sent her too many of these. Hold on.
If you ever see this, by the way, there's a little button on the side of the escalator. You can see it on the right-hand side. Push the button. Get the escalator stopped. Give him a break.
Oh, you mean at the bottom? Yeah, if someone else had caught it.
Yeah.
Hold on, you're watching it again. Sorry, but
No, I'm enjoying escalator shenanigans. I'm glad they're not too badly hurt. You can get really hurt on an escalator. I think only like a dozen or so people die by escalator every year. So
why can't I open this in a new? God damn it!
I think it's roughly.
This one's really funny.
Die by a vending machine.
This one's really funny. This is the state of social media. What is the world we live in? Why is everyone always dancing?
Hey, dancing is fun. We can dance if we want to. We can leave our friends behind. If they don't dance, they're no friends of mine.
I got that, but still, it's cardio shit.
Okay, well, I enjoyed all the dancing.
His recreations are pretty damn good. I hate Instagram Reels because when you want one, you can't find it. It's impossible to find the one you want. Oh, come on. It went too far. Where the fuck is it?
I have to say, I've never walked into a business and just seen the employees just dancing, so I guess I'm missing out on whatever this is happening. As Andy looks desperately for the clip that he's trying to find, just a friendly reminder to all of viewers of Popcorn Planet to please make sure to hit that like button because it helps with the engagement. And are you subscribed? Are you sure? You might want to double check because YouTube from time to time just unsubscribes people for no particular reason. So make sure that you're still subscribed and check out all the good things here on Popcorn Planet.
I can't find it. Oh well. It's the funniest one, and I can't find it.
Also, if you send money to Streamlabs, or through Stream Elements, I think you send money through Stream Elements, then it goes through PayPal, and PayPal only takes 3% of a cut, as opposed to YouTube, which takes 30% of Super Chats, and it's sad. So you can donate the exact same amount of money, costs you no more, but Andy actually gets more of it because YouTube won't steal as much. So you can go through Stream Elements. And
did you know the other trick they just did? They changed the contract so everyone could monetize shorts.
Yeah.
And they tricked everybody because they're not paying well on shorts at all. They pay fucking pennies on shorts. The shorts are fucking not worth anyone's time, and they're making you all do it. I mean, us will do it, and they're like, "Oh, we'll pay you now. Oh, we'll pay you 10 cents for 10,000 views." And when you go and accept that new monetization rule to get your shorts monetized, you are giving them even more percentage of your overall revenue. It went up to like from 35, I think, to like 45 or 50.
Really?
So it's like, if I read it, I'm like, well, fuck, I'm not going to monetize shorts. I'll wait. I'll ride this as long as I can.
Can I opt out of it now? Or is it too late?
I'm like, well, no, I think it's like June or July. You have to, or you're demonetized. So I'm just waiting until the cutoff point, and I'm like, fuck you. I'm not going to give you more because the shorts revenue is bullshit. I thought like, oh, okay, well, at least we can monetize our shorts and do decent on the revenue there. But no, they're not paying shit. Have you tried shorts?
I've tried them. I have difficulty like with creating them, and they don't really seem to help. I just saw a announcement from TubeBuddy though, which I don't use. I use vidIQ, but that they say that they'll help me like find the best parts of my content to clip out. So I need to go look into that and see if that's a thing.
Well, yeah, good luck. That sounds like bullshit to me. How the fuck do you figure that out? Unless you're actually watching and paying
AI
attention.
magic.
I guess. I mean, if the only thing that would help is if they're actually getting the data of when people are watching and replaying or going back, you know, like what's the most replayable parts of your video? Because I don't buy it. But if they can, fuck, great. Let me know. I want to do it too. Anyway, I've scrolled through like for hours. I can't find it, which makes me sad because it's a fucking great video. And now I'm just sad because I wanted to.
It's very disappointing for us all.
And I've just wasted all this time, and I can't fucking find it.
Okay, nothing else is happening.
Oh well, I tried, guys. I'm doing one. Oh, here it is! I found it! I found it!
Victory!
All right. There it is. Ready, guys?
Yes.
Have the Star Wars Lego set Death Star, but can he chug a sparkling water and not burp? Oh my gosh. What do I do? I might have the Star Wars Lego set Death Star, but can he chug a sparkling water and not burp?
Oh god, that makes me laugh. I'm so dumb.
Oh my gosh. What do I do? I might have the Star Wars Lego set Death Star, but can he chug a sparkling water and not burp?
None of this matters. So he's chugging the drink. It's the sudden realization that you can't chug it to the, what do I do? What do I, and then the
oh my gosh. What do I do? I might have the Star Wars Lego set Death Star.
He'll be fine.
But can he chug a sparkling water and not burp?
Oh god, but I don't know who that man is, but my god, that makes me laugh. But I can laugh because he'll live. You got that same feeling. He didn't actually hurt himself. I mean, I'm sure he hurt himself, but he survived. Claire, thank you for the 6. He wasn't that worth it, guys. I've spent the day visiting my dad in the hospital. Then I came home to Karen and Andy. You have made my day. I haven't laughed so much in ages. Well, I'm so glad to help, Claire. Stepcat, send you and your dad the best. I hope he's okay. Stepcat, differences in trials, presentations, speaking as once a juror, I can still remember a lot of the Depp trial. I cannot tell you anything of expert or other witness testimony. It was from yesterday or previous days. Yeah. I'm sure they're falling asleep through a lot of it. Linda, what's up? Which witness do you guys feel was most helpful to Gwyneth Paltrow? That's good. Did you answer that one? That's a good one. Alice, thanks
we
for
answered
the
that one before.
fun court. Oh, you already did. All right. Well, who did you say?
I said Math Daddy and the witness this morning. I thought the witness this morning was better on the technical merits, but Math Daddy was more engaging.
Math Daddy was pretty damn good. We have 28 minutes, guys. Killing time for 28 minutes. Math Daddy was pretty good, I gotta say. I think he was.
I've got about 15 minutes, and then I've got to hop off.
Okay, so we got Kurt. So let's take advantage of him here. What do you guys want to ask? More lawyer stuff or anything, just smart stuff. Kurt and I will try to answer for you in the next 15 that he's here. Send on over your Ask Us Anything questions. And I guess what about the, have you been following the Danny Masterson trial? The retrial that's about to happen? I saw Leah Remini showed up in the pretrial motions to support the victims. Where was it here?
Yeah, I don't really have any particular position on that. I haven't been following it super closely. Been following the Marilyn Manson stuff a little bit closer, so.
Yeah, we've have too. We had Ashley on, which was crazy. She called in while we were reporting that she changed her testimony. It was a wild day. And that was a huge game changer. I assume you agree when you have a witness coming recanting and saying that Evan Rachel Wood is.
Oh yeah, for sure.
Did that change your mind? Had you been one way or the other before that?
Well, I hadn't been super deep into it. Colonel Kurtz, who I respect, has done the deepest dive work onto this, and based on her analysis, she thinks that's kind of crap. I've done a more superficial analysis. Based on my superficial analysis, I also think it's crap. But yeah, the fact that you have this person come forward and say, I was basically recruited to make up lies and it's not true, doesn't really help. So it seems like they're in real trouble there. So
it does. It sure seems like they're in trouble. And I'm just, I'm glad more people are starting to finally pay attention to it. It took a while, but he's finally dropped some evidence that I think is getting people's minds more in the, oh wow, maybe he is fucked. Because he was just an easy target. People think Marilyn Manson, beautiful people, and all the makeup and all the stuff he does. But as we've learned, we can't judge people by what we think. I mean, who would have thought that James Egan, our amazing lawyer here, would be a Coldplay-esque singer-songwriter? I mean, look at this man. Ooh, yeah, there he is. He's getting excited there.
About myself.
Your opinions about this image.
Like I'm not living up to my full potential.
I mean, seriously, he's doing more than most of us. It's kind of wild. Good for you, Mr. Egan. You've had a lot of new fans here. And he did demonetize my stream. He demonetized the stream yesterday from his Spotify songs. Thanks, James. He gets to profit off of it, yesterday's revenue. Him and some of the other clips we played, but I guess he did. Not only did he get on Spotify, but he got it through YouTube's algorithm. Good for him, man.
Nice.
Because I don't think James was up last night clicking monetize these streams. I think he was probably pretty busy. Let's see here. 25 minutes. Let's say there was another trial I was trying to think about. What do you think about the TikTok China bullshit? You think they're going to eventually ban it? Have you seen that at all?
Well, the bill that's currently going through Congress looks really, really scary because it's giving quite a lot of power to the federal government to ban and regulate the internet in ways that are extremely concerning, and not just like every sort of technological growth. The way it's written would allow the government basically to make VPNs illegal on top of everything. It is a really intense power grab. So the issue of should we ban TikTok is now a separate issue from should we pass this bill to give the government massive amounts of power. I have deep reservations about it because, yeah.
Well, it's interesting because that makes me think of this case too. I don't know if you've seen this one. At Utah, is where we're at, says that they might dramatically limit teens' access to social media. And off of like just seeing it from afar, as a parent, I'm kind of like, you know what? That's a great idea. I think it is actually a good idea. But I just don't trust the lawmakers to not put more in there to then actually make it more dangerous for the rest of the world. And they're sort of power hungry moves. You know what I mean?
Yeah. I'm not sure TikTok as such is necessarily the issue. The issue is more for me.
This is separate though, right? This has nothing to do with TikTok. But I'm just saying it's another one where they're trying to regulate the internet in ways. And don't you think we are fucking addicted to this shit? Don't you think it is hurting our brains in certain ways?
Yep.
It's like, I don't know how I don't want the government in charge of it, but it does feel like there are not the best parents all around the world. And I feel like too many of them are just throwing iPhones in little 8-year-olds' hands. And I do think that's actually going to have a crippling effect on the generation. And it's dangerous. You gotta parent the iPad. And I do think that the idea of this for children, especially, I think would protect them in a way. But then you go through some of the deal parts and you're like, oh, you're also trying to do this and that too. Why are they always going to fucking shove other things in the clear law? It's so fucking bullshit. It's why I don't believe in politics anymore. I just can't trust anybody.
Well, you never let a crisis go to waste, right? As Rahm Emanuel once famously said.
Oh, look, we got the whole team back.
Two lovely ladies.
Hello. Hi, Deb. Hi.
I think I'll take this opportunity to take my leave because I do have an appointment in a bit that I got to get to. So I just want to say it's been a pleasure, and hopefully we can do this again soon.
Please, anytime. Check out Uncivil Law on YouTube. Always a pleasure, sir.
All right, I'll talk to you guys later. Bye-bye.
Have a good one, man.
Bye.
Ladies.
Hi.
Welcome. We were talking about some of the crazy legislation that's coming, but this one's complicated for me because I support the idea of this. I do. I'll say as a parent, I do think there's a lot of parents who don't police social media. And I think it's really bad for children's growing minds to just be in that world, scrolling through Twitter or whatever bullshit they're doing at 10, 11, 12. And I don't think it should be allowed. Just like alcohol and other things that are addictive, social media is fucking addictive and dangerous and so much more. So I'm not against the idea of this, but the laws always get shoehorned. You know, they throw in so many other things into these laws that make it harder to support. And that's where things get scary. But what do you think? He was talking about the TikTok bill actually is going to be scary because it's not just about banning TikTok. It's also potentially banning VPNs and other stuff that does make the law scarier. Either of you have a thought on regulating the internet? Do you think it'll ever happen? I mean, at some point the government's going to get there and do it. Trick us all, don't you think?
Steph, do you have an answer? Because I've been here for a bit, so I want to give you a chance to talk.
Okay. Do I believe in a social media law to regulate children's access to social media? Yeah, I do. However, the thing is it's not just, how do I put this? What the legal system is doing is putting the onus on the parents to, regulate their children, which I get. That's what a parent's supposed to do, right? However, it's then shifting the responsibility solely onto the parents when the social media providers also have a responsibility as well to ensure that when children are on their platform, that they are safe and protected. And there's not enough of that going on at the moment. Why? Because big tech lobbies hard with the government. Big tech funds government. Yeah, they don't want to be losing those big mucho bills and, peeing off those tech companies and social media companies, do they? Not really, not in the grand scheme of things. Otherwise, those politicians are going to lose out on a lot of money and they don't want that. So, do I agree with this to a certain extent? Yes. However, there needs to be a heck of a lot more regulation and laws built in on the side of the social media providers to ensure that the platform they provide, again, is safe and suitable for children as well. Simple as. This whole thing of the law regulating children for the parents to do, it works only to a certain extent. It's like putting a plaster over a crack. The crack's not gone. We need something a little bit stronger than that. So yeah, they're my thoughts on that.
Well, and it's well said, because what's the number? Well, I mean, actually, I didn't realize the number one channel now is
T-Series.
Hindi music, so I didn't realize that. I thought it was Coco Melon, but it's Coco Melon's up there too, which is all just garbage for children. Like Coco Melon's like the fucking worst. Coco Melon's not played in my house, and I can't stand it. It's just so cheap and bad, and it's just what kids though want. And then you know, there's tons of it, tons of this Vlad and Nikki. It's just all this entertainment education is what they're like calling it, but bullshit. And YouTube's making a fortune off of that shit, off of kids content. And they got in trouble, right, with the whole issue that happened, but way back, because they were advertising to kids, and then everyone's like, whoa, 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 whoa. And they've made YouTube Kids, whatever, but most parents don't even know. And then they've separated it, so they're not responsible, but then kids still have YouTube in their hand and aren't really actually being checked. That's what's scary about it. How do you check that, right? Because it's like the parent just throws the iPad in the kid's hand, they hit the button, and they don't really realize that the app they just gave them isn't kid safe. You know what I mean, Steph? Is the parent then responsible? Or is how do we know? Half the accounts on Google and YouTube aren't even actually correctly their age. That's the other thing most parents do, is they lie about their kid's age to put them on YouTube. I don't know without the parents actually paying attention, the kids are screwed. That's what's really scary about it all.
So the thing is okay, when, just for example, this might be out of left field, but there's a point to be made. If you want to sign up to a app service whereby you are able to buy and hold Bitcoin, for example, right? One of those cryptocurrency exchange apps situations that you can go on to, right? You sign up, but you've also got to provide your ID and all that lot, right? So in terms of fixing that, well, hang on a minute. The kids are signed onto YouTube, but the parents go in and they fix their age so they're older than they actually are. No, provide ID. Provide their birth certificate, something that proves their age. Simple as that. Alternatively, at that point, the only other way around it, I would say, is for the parent to sign a waiver and be like, right, you've put this in. Anything that happens is on you, not us. But that's kind of like a pussy way out for the social media companies. I still think they have a responsibility nonetheless to ensure that the platform a child is on is safe and fine for them to do. Because the parents' influence and everything can only go so far anyway. Once the child is on the platform, what can the
they're
parent
never
do?
going to the sites are never going to do it, because like I think of Twitter right now with Elon Musk. Like there's no way he can afford to put that lock in, even though it would, I think, cut down on the bullying, the spamming.
Yeah.
He's going to lose so many users if he requires that identification. But the problem is, by doing that, you're going to make it safer, and I think actually make it a more valuable platform, because then it is really, everyone is held responsible and accountable for the shit they say on social media versus just playing like an account. So I'm all for that move. I think these sites should require it. Like YouTube, when we monetize the stuff, we have to give them our stuff and our bank accounts so they can, do. So there's ways that they can confirm certain accounts. So I know it's like, we don't want to track things, but no, at this point, I think, you need to, for some of these legit accounts, to protect kids, to protect the users, to protect the experience. I don't know why more places aren't requiring sort of like scanning ID, so this is who it is. Even if you want to keep your identity, private, okay, but then at least there is a clear, this is who this user is. This is who this random Twitter troll is. There's a they can't just create it through a dummy Gmail account and a VPN. There's actually responsibility and accountability to these accounts that are made. It would cut down on so much spam and hate and bullying, I think, if they were able to do it. Kim, what are your thoughts?
I wrote them down because my brain kind of went into like I call it the spinning teacups of things. So here's the thing. When I look at these types of lawsuits, I don't trust governments that literally put faith in a politician to stand publicly and say that the internet was a series of tubes. I find it that when it comes to anything to do with the internet, whether it's DeFi or media or whatever, the choices are made too quickly without full understanding of what's going on. And ultimately, the bills are passed that benefit the corporations that are paying the politicians the most amount of money.
Facts.
So to me, a lot of this stuff, a lot of time is noise. I grew up hearing that Columbine was Marilyn Manson's fault, that video games would make me a very violent person, that Britney Spears would corrupt my brain because she showed her midriff. I mean, there's always things in every generation that people freak out about with kids and everything else. But my whole thing is that prohibition didn't work. Banning people from doing things is never going to work. And especially when you have governments that are out of touch with how much technology can do, people will always be one step ahead. The smarter people will be one step ahead. We're literally watching a trial right now where we had 2 sets of lawyers that couldn't figure out how to type in a web address to check something. So they can pass a law. It just means they'll find ways around it. And that's just kind of how I feel.
Well said. It's true. I mean, because while I agree in theory, it's usually never. Yeah, it's not really actually going to help the kids. It's going to help the lawmakers and the politicians make more money, or control something else.
You know what really grinds my gears, though?
Tell us, Steph. What grinds your gears? It's red.
Okay.
Look, it's turned red.
Right? Are you ready for this? Okay.
I'm ready.
Because every single social media platform, right? Never mind about the bullying and harassment. Okay, let's put that to one side, right? Every single one is like, we're opposed to child exploitation. We're opposed to the nastiest, most evil thing that could happen to a child on the internet, this, that, and the other, right? Okay, well, there's something you can do about it. ID the mofos. When they go onto your website and they sign up, let every single person provide ID. Because guess what? If they then start that business and someone reports them, yeah, then guess what? You've got their ID, you've got their details, pass it on to police, and then it'll be dealt with one way or another. You want to deal with child exploitation. You want to deal with the evilness that happens to children on the internet every single mofo day, because at the moment, everything that they're doing isn't working. Why? Because those monsters can act under this whole realm of anonymity. Right? Because they don't have to prove their identity. They could catfish them and turn around and say that they're a 12-year-old, 13-year-old, 14-year-old boy, girl, whatever, when they're actually a dirty freaking 50-year-old who's evil, nasty, and needs their balls chopped off and castrated for the rest of their lives. But guess what? The social media companies can do something about it. Every time you sign up, freaking send your ID in. Because I tell you something, all that catfishing nonsense with those evil mofos that deserve a special place in hell, you'll find that go down pretty quickly. So all their freaking bluster of, oh yeah, we're against child exploitation, we want to do our best to protect children on the internet, this, that, and the other, there's a quick and easy way to sort that out for the large part in terms of the catfishing element of it all. But they won't do it. They're just as complicit and just as evil as far as I'm concerned if they're not putting in the necessary tools to be able to protect children. All for the name of profit, more users, a bigger platform, whatever. Evil piece of shiz is the lot of them as far as I'm concerned. There we go.
Yep. And actually, and to your point, Steph, then the next thing that I kind of say is, if we're going to talk about protecting kids and the internet and people doing unspeakable things to kids and traumatizing them, what kind of punishments do those people get? A lot of them just get a year or 2 in prison and that's it. Then they get back out and they do it again. I don't see any laws being passed or anything right now about potentially making, the punishments harsher, because bluntly, it's worth it to these people. And the amount of time that these people get in prison after what they do directly correlates to the value that our law system actually has on children. But we can continue talking about TikTok. That'll fix everything.
Yeah, let's ban TikTok. Let's ban TikTok, because that's going to fix everything, right? The absolute idiots.
I mean, I think the TikTok thing's about China is what they're trying to... I mean, it's sort of separate, no? Like, they don't want China's taking all our data.
What I'm saying is it's distraction. It's distraction.
Well, sure. But I'm just...
Pay no attention to the man behind the curtain.
But there is a legit question there. Do we want China to have all that data? Because they are now going to be, they're overcoming YouTube, everybody else. But my whole thing is, do we want Google to have that data? Do we want Mark Zuckerberg to have that data?
They already have it.
I know, that's my point. But now we're giving it to China, and now they're starting to, now they're mad because it's a competitor to us versus us, because they can't charge China like they can charge Google and Facebook and everything else. That's what's scary about it. Like, we should have the same energy about China having our data as Google and Facebook having our fucking data, and Apple. That's what's so sad. We have become, we're getting all depressing, but the reality is we are literally turned into the Matrix. We are literally just bodies in goo, giving them data. Every day we're on our little phones, typing and selecting our purchase and going through our search history, doing everything, posting videos, posting content, all to funnel the beast and pay everybody else and keep us all drowned out on TikTok short reels so we can just sit there, drone, and be a body to watch advertisements for them to sell to us. I mean, that's really what it's becoming. It's kind of depressing when you really sit it. Like, social media and the internet have turned us into slaves to all of this power and money and control. So it's hard. We are bodies in goop. Yep. I brought it full circle. Did you see that?
Yep, you did.
But it is kind of, look, all in moderation. I think the internet is also a brilliant thing. You could sit and spiral about all the craziness of what the internet is doing. I do think it's rotting a lot of people's minds. I do think we are getting more depressed and more addicted and more thriving for the likes and the clout and stuff. It's scary. But there's still a lot of positives to it too. The other pivot, I was trying to get into what is it? Finally learning about Chat GPT or whatever. Holy shit, that's terrifying in its own right. Jesus Christ. The AI introduced chat, where you can literally just have it write whatever the fuck you want. Have you been doing Chat GPT, Kim? It's fucking wild.
Yeah, it's a bit crazy.
Anyway, it's going to get crazier and crazier as we go. Why can't I thought I downloaded it on my phone. I'm trying to log in here. I just got the trial, but I guess I don't have the right one. Oh, well, I was going to try and do some chat AI, but it's not seemingly working. Oh, is that one? They all have the same fucking logo trying to trick us.
Mm-hmm.
That's not that logo. I guess there is no one there's like several Chat GPI ones. Steph, do you have Chat GPT or whatever it's called?
I have had access to it before, but it depends on whether there's a lot of people on there or not. Sometimes it'll let me in, sometimes it won't.
Let's see. How can I assist you? Give me a summary of the Gwyneth Paltrow. See if this works.
I'm curious.
Show ski crash trial. As reported by Popcorned Planet. Okay, ready? Here we go.
Here we go.
I just asked it to give me a summary of the Gwyneth Paltrow ski crash trial as reported by news site Popcorned Planet. Oh, that's lame.
Oh.
I'm sorry, but as an AI language, I do not have access to current news. However, I can tell you that Gwyneth Paltrow was involved in a ski crash incident at the ski resort on February 2016. A retired doctor named Terry Sanderson claimed the Paltrow crashed into him from behind, causing him severe injuries. He later sued. Wow, it's really just, it's doing the whole, I guess it's less impressive because they're just reading a summary.
Mm-hmm.
Write me, okay, how do I stop it? Tell my friends Steph and Kim that they mean the world to me. And help my YouTube channel, Popcorned Planet, be what it is. Let's see. Will that work? It's thinking. Wow, this AI sucks. Here I was excited. I don't have access to your friend's contact information. No shit.
Oh my goodness.
I don't have access. However, I suggest you take the time to reach out to your friends and express your appreciation for them. You can also work on developing content from resonates to your audience and engages them. I guess, am I doing this wrong? I'm in the AI bot. How do I do? Oh, I'm chatting. Oh, write me an email. Here we go. Write an email for my friends, Steph and Kim, for helping me make. Hold on, make sure I'm not missing the trial. I wish I could show this to you guys. I can't. I need to figure out a way to get my phone screened on PC. Steph, how do we do that? Is there like a cord I can get? So it's like if I'm on my phone, I can hit it on the thing. For helping me make my YouTube channel, Popcorned Planet, a success.
I am going to lovingly encourage you guys. We've got almost 2,300 people in here, and we've got 1.4K likes. And I'm assuming that since you're here before trial has started, that you want to be here and that you like our coverage. So please hit that like button. Helps with the channel a lot. We really appreciate it. And I'm glad you guys are all here.
Here we go. It's working. Oh, just in time.
Thank you. You may be seated. Counsel, are we ready for the jury, counsel?
Can we just have an overview of the clock situation? I can tell you what I understand.
Let me pull it up.
I think I found something for you, Andy, with that question. I'm going to send it to you right now. Video. I'll explain it all.
My understanding is defendant has 4 more hours, including closing arguments tomorrow. Thank you for doing this.
Oh, sure. Sure. Well, between this afternoon and tomorrow, there's approximately 5.5 hours of jury time available. And the time that I have that each party has taken is 16, for the plaintiff, 16 hours and 1 minute, and for the defendant, 16 hours and 25 minutes. Does that comport with your computation?
What was it again?
16 hours for both of them in a bit.
16:01 and 16:25.
So, can you calculate what I have left? That will help me.
Well, if there's 5 hours and 30 minutes left, you get less than half of that, right?
If we take 1 hour apart, 1 hour for each party to occur tomorrow for closings, then can we calculate what's, we want to comply with the court's order on this. Both sides want an hour tomorrow for closing. Is that true, Bob?
I might want more than that.
Okay, at least 1 hour.
So that's about 6 hours and 30 minutes in front of the jury, including closing arguments. So which is roughly divided to where the defendant would have 3 hours and 3 minutes and the plaintiff would have 3 hours and 27 minutes.
And then if we take out the 1 hour closing tomorrow, 1 hour each, that leaves us about 2 hours each today.
203 for the defendants, 227 for the plaintiff. And I'm not saying that has to happen. I mean, that can't happen today because we don't have enough time to do it today. Because that's almost 5.5. That is 5.5 hours right there.
Well, the minutes are ticking away now.
Okay, ready for the jury then? Okay. Why don't you come on and take the witness stand, be ready. Mr. Egan, you may continue.
Thank you, Your Honor. Dr. Eastfold, we're back from lunch, and I think it'd be best to just go right into your opinions. Your Honor, do I have permission to do as we did with Dr. Hash, show the heading of the report?
Yes.
Thank you. So I'll put that up here on the screen here. Dr. Eastfold, is this the first opinion in your report?
Yes.
And maybe let's just read it.
Plaintiff suffered at most a mild concussion from the collision occurring on 2/26/2016.
Okay, so and why is that your opinion?
Okay, so when I'm forming opinion on whether there's been a concussion or not, there's three main things that I'm looking at. One, the mechanism of injury. Is it sufficient enough to cause a concussion? Two, the acute injury characteristics. What symptoms were present in the minutes and hours immediately after the collision? And then what did the clinical course look like after that? And I'm most interested in the 3 to 4 months after an injury. Things that are happening after that are less likely associated with the concussion. Okay, so those are the three things I'm looking at. So one, the mechanism. So there was a collision, two people ran into each other, he hit the ground. That is a feasible mechanism for an injury. Two, the acute injury characteristics. So there's two symptoms. One, loss of consciousness. Now, he's reporting 5 to 10 minutes of loss of consciousness. Based on all of the available evidence, that is improbable. And I can go into that more, but you've probably heard a lot about that. But my opinion is that if he suffered loss of consciousness, it was seconds, not minutes. Okay, the duration of loss of consciousness is important because the longer the loss of consciousness, the more severe the injury. Okay, so it is my opinion that there was seconds of loss of consciousness, if at all. And then by the time the EMT, Whitney Smith, arrived, she described some mild disorientation, which was kind of a rattled response to this unexpected collision on the ski hill. There wasn't any gross confusion or any other significant mental status changes. And then, of course, he was complaining of rib pain. So we've got the disorientation. He was seen at Park City Instacare 2 hours post-injury, and at that point he was complaining of a slight headache, rib pain, and I think a dullness in his head. But the provider there very specifically documented no signs or symptoms of concussion. There were no clear signs like dizziness, nausea, vomiting, any double or blurry vision, any of the really classic symptoms of a significant concussive injury. The next day, he was seen at the VA, and at the VA, he is only reporting, again, a slight headache and rib pain and irritability. Again, no other significant signs of an acute concussive injury. In the 2 to 3 weeks after that, the only person that really saw him was his girlfriend. And in her deposition, all she described was that he was really grouchy and didn't really want to be touched, and that he was in pain. She is also not describing any significant symptoms. Now, I know she's not a medical professional, but the absence of her description of other symptoms is notable. And then we've got some really important objective indices of injury. So, as we had started to mention before lunch, 1 month post-injury, he underwent an extensive battery of tests that assessed multiple aspects of attention. Now, attention is the cognitive domain that is the most sensitive to concussion. And he performed consistently in above average range on measures of sustained attention, complex sustained attention, divided attention, alternating attention, and selective attention. So very clearly, no objective indices of attention deficits. Then, 1 month later, so 2 months post-injury, he had a similar extensive battery looking at multiple aspects of memory. Same thing, no deficits. In May, which is about 2.5 months post-injury, he had a thorough vestibular evaluation. And so the balance system is actually really sensitive to concussion, such that even healthy, fit 20-year-old athletes will have impaired balance when they are concussed. So Mr. Sanderson's balance was described as exceptional. There was no evidence of vestibular dysfunction or balance problems. So that's another really important objective index of his brain functioning. Lastly, About a week and a half after the injury, Mr. Sanderson reported a markedly increased intake of alcohol. He reported to his primary care that he was drinking 5 to 6 drinks a week, 5 to 6 drinks 2 to 3 times a week, which is actually a quite significant amount of alcohol. And there's one thing about concussion is that one of the telltale signs is reduced tolerance to alcohol, such that when people are acutely concussed, if they drink alcohol, more often than not, they report feeling ill, or they get really intoxicated off of a fraction of the alcohol that they normally drink. Most people do not enjoy drinking alcohol when they're concussed. And so when I put all of that evidence together, sure, it's possible that he had a mild concussion, but at most it was mild. And by May, there really isn't any strong ongoing evidence of clear brain injury.
Is it possible that he did not have a concussion?
It's possible.
You mentioned in that answer the objective measures that were taken in evaluations following the accident. How would you evaluate the discrepancy that there might be between objective measures and a subjective report that vary? You know, and maybe that just for the jury's sake, and I can clarify my question, the patient is reporting certain experience of symptoms versus an objective finding through some sort of assessment.
Well, it's hard to make sense of, and there could be many things, but one of the most prominent things that was very clear is that his anxiety went sky high after this injury. His blood pressure was through the roof. He was emailing his providers saying, "I'm having a hypertension crisis." He was doubling his medication, and it wasn't helping. So it was very clear that he was experiencing a lot of anxiety, and anxiety can certainly drive perception of a lot of these difficulties.
Did you note a record a few weeks prior to the ski collision that included Mr. Sanderson's report that he was feeling old all of a sudden?
Your Honor, I don't think that's in her report, because I haven't seen it.
She's
overruled?
Have you reviewed that record?
I definitely have. And
does it play into your evaluation of where post-accident symptoms might be coming from?
It plays into me trying to understand where he is now. And there's been a lot of talk about decline, and some of those records offer some telltale signs that I see in older adults that decline is starting to happen. So there's a line in there that describes that he's overwhelmed with paperwork and trying to get things organized, and he's I can't remember the exact line, but those are the kinds of things that I'm listening for when I'm evaluating older adults, because those are the behavioral signs that functional changes are starting to happen in someone's life.
Okay, great. Let's go to your second opinion here. Give me just a second to pull it up. As I pull it up, you can read it, Miss.
Sure, I can read it from my paper.
Yeah, I apologize.
Plaintiff's course and evolution of self-reported symptoms is inconsistent with the known trajectory of concussion-related symptoms. So,
why would you say that?
So the thing with brain injury is that the symptoms are worse in the beginning and then they gradually improve. Now that rate improvement can vary greatly among individuals, and some people might experience some plateaus along the way, but brain injury does not progressively worsen. And Mr. Sanderson was reporting when he saw Dr. Fung in 2017, about a year and a half after his injury, and then Dr. Goldstein in 2020, he was reporting new symptoms that weren't present in those first 3 months, and he was describing a worsening of symptoms. And I think many of his family members are under the impression that things are worsening. So a worsening in 2017 and 2020 cannot be attributed with any medical probability to a concussion, a mild concussion in 2016.
And maybe so the jury has a sense of the new symptoms that you're describing. What are those in particular?
He was describing neck pain. There was some dizziness and a lot more just general dysfunction. I can't remember all the symptoms offhand.
Sure. What symptoms would you attribute to a concussion if, in fact, he did have one in the ski collision?
Well, again, there really isn't any strong evidence of symptoms in those first 3 months. He wasn't even really, he was reporting difficulties with his thinking skills, but yet on objective tests he was performing normally. So it's difficult to separate what was anxiety during that period and what was true concussive deficits. But I think another piece is that even one of his daughters saw him in May, I believe, for a graduation, and described him as feeling kind of slow and dull, not as engaged as he usually is. And that could certainly be a symptom of concussion, but even she said that fully resolved, and he has since returned back to his extroverted self. And so, again, that's the known trajectory that I would expect for a concussive injury, but not new or worsening symptoms years later.
Thank you. Let's move to your third opinion, unless there's anything to add.
I think that suffices.
Okay, thank you. So number 3, will you read that for us?
Plaintiff's medical history is notable for a number of comorbid conditions that better explain reported course of decline.
And why do you say that?
Okay. So as a neuropsychologist, a really thorough medical history is essential to understanding the context of the person, of the brain that I'm evaluating. And there are a number of medical conditions that are known to increase risk of premature cognitive decline as one ages, or risk for developing dementia. Okay, so this is a really important piece. So the biggest and most important one is the topic that we've been discussing today, is this abnormal brain MRI. Okay, a grossly abnormal structural abnormalities on his brain. There's volume loss, there's enlarged ventricles, there's microvascular ischemic disease. So there's a lot of problems here.
And are these the problems I think you were in the courtroom when Dr. Black was talking about
Yes.
the imaging, the same
Exactly.
things he was talking about?
Yes. And so that brain MRI alone, and no other information, that MRI alone predicts problems as he ages. It is a question of when, not if. And again, going back to, you mentioned the medical records 3 weeks prior to this collision. Again, there's subtle evidence that decline was happening, and I can talk about, well, maybe that's I'm jumping ahead. That's another, we'll get there, I'm sure. Okay, so the MRI, that's a huge red flag for me as a neuropsychologist, okay? Now, he's got a lot of other medical issues, and I'll briefly go through these, okay? So he was diagnosed with sleep apnea in 2003. Sleep apnea is a disorder where one stops breathing for short episodes repeatedly through the night. The consequence of that is that when you stop breathing, the blood oxygen levels go down. Reduced oxygen is not good for your brain, and over time that causes problems. Untreated sleep apnea alone will cause cognitive decline over time. And most importantly, it's also associated with fatigue and headaches, and most prominently, attention and executive dysfunction. Okay, so he was unable to tolerate the CPAP machine, and so that went untreated. He also has chronic insomnia. We know...
I object. There's no foundation. She's not a medical doctor.
These are...
She can't, just a second. She can't speculate about what these mean from a medical standpoint.
I think she qualified her answer as to what it meant to her as a neuropsychologist. So for that limited purpose, I'll allow the evidence.
Thank you, Your Honor. And
Simple country lawyer, please shut up.
I want to just make sure I'm following
I'm just a simple country lawyer.
the medical history that you point to that might better explain, or that does better explain Mr. Sanderson's post-accident symptoms includes the pre-accident imaging that you've discussed, the untreated sleep apnea, and now I believe we were going on to a third one, but because of the objection, I cannot recall.
There's a list. So again, kind of getting a very clear picture of what his pre-injury status is. Okay, so these are the ones that I'm going through are all risk factors from a neuropsychological perspective. And so chronic insomnia, we know that chronic insomnia is a risk factor for developing dementia. And what happens when the brain goes into deep sleep, there's a cleanup function that happens, and there's a cleanup of abnormal proteins and plaques that shouldn't be there. And so when the brain is not getting into those deep stages of sleep, that cleanup function is not happening, and over time this will cause problems. And kind of alongside that, because of this insomnia, he's been treated with sedatives and benzodiazepines since at least 2004. We know that long-term use of those medications is associated with a markedly elevated risk of developing dementia. He also has restless leg syndrome. Restless leg syndrome is another risk factor for dementia. When it occurs in older adults, it's often an early warning sign of emerging functional behavioral changes that are associated with dementia. He has chronic migraines, and his migraines were quite severe. In 2011 and 12, he was reporting up to 3 a day. Chronic migraines are associated with the microvascular ischemic disease on the brain. He also has hypertension and high cholesterol. These are also cardiovascular risk factors that adversely affect the blood flow. Reduced blood flow is bad for your brain, and over time can cause problems.
Sorry to interrupt you. You can finish. You've been talking about physical symptoms here, or physical conditions at this point, correct? Were there any mental health conditions?
I'm getting there. Okay. So a lot of medical issues that would suggest an increased risk of decline. Then we've also got a lot of psychiatric issues. He has been struggling with chronic anxiety and depression since the 90s, and he's been medicated for that since the 90s. And we know that chronic mood disorders is another risk factor for decline as we age. Now, the anxiety is actually really important. Mr. Sanderson underwent a full neuropsychological evaluation in 2017, just about a little over 1 year after this injury. And like his earlier testing, this neuropsych evaluation was completely unremarkable with no evidence of residual brain injury. And it was her conclusion that anxiety was a big factor here. And in fact, this second neuropsychological evaluation was sought out per Mr. Sanderson's report because he just had a friend pass away from early onset dementia, and he was worried. And so the neuropsychologist felt that anxiety was playing a big role in his perceived difficulties because his perceived difficulties weren't corroborated by the objective test data. Now, Dr. Goldstein himself, the plaintiff's own expert, concluded the same thing. Again, his testing indicated no evidence of brain injury, and he also felt that anxiety was a big factor that was driving a lot of the issues. And so this anxiety has been a big factor all along, and I think it's contributed to a lot of what he's perceiving and reporting.
Are there any other aspects of Dr. Goldstein's evaluation that give support to your opinion?
Yes, if we could bring up that executive function table one more time, that would be great.
Sure. And this, I believe, is Plaintiff's Exhibit 43. Yeah, thank you.
Okay, so if you look, that working memory, that very bottom line there, again, this is Mr. Sanderson's subjective reports. This is just his complaints. He's reporting really significant working memory problems. On Dr. Goldstein's testing, he exhibited exceptional working memory. So on objective tests, he was performing in the high average range, and his working memory index, which is an average of 2 scores, was at the 87th percentile. So this is a really great example how perception does not equal reality.
And are there any other aspects of Dr. Goldstein's evaluation that help support
Yes.
your opinion?
And so Dr. Goldstein made a conclusion that based on extensive personality testing that Mr. Sanderson was a well-adjusted adult, but his own data does not support that. And so if you could bring up that next, the Milan table.
Oh, sure. I believe this is, I wrote this down, pages 27 and 28 of Dr. Goldstein's evaluation, which for plaintiffs...
Your Honor, we object to this. This is not pre-disclosed. It's not an admitted exhibit. We had no notice that this was coming, so that's unfair.
It's in my report.
Why don't you approach the bench?
Oh my gosh. This is unfair.
This is almost over, right? Tomorrow?
This is unfair. Yeah. Just want to say something because I'm seeing people in the chat. If you have any of these conditions, it does not mean that you are going to have dementia or have dementia. Please, if you're concerned about any of this stuff, talk to your doctors, but also every case is different. There are treatments. It's not the dementia sphere is not the same as it was 20, 30 years ago, the way that things have been moving. And I've seen some of that firsthand. So nobody needs to freak out. We're all good. Go talk to your doctor. Take care of yourself. And if your doctor tells you not to ski, don't go skiing. And if your doctor tells you to stop drinking, stop drinking.
There you go.
Listen to your doctor.
Like me. Like me.
Exactly.
Like literally, I had my first ever pancreatitis attack, went into hospital, admitted night before I only had a bottle and a half of Alcopop, Smirnoff Ice, that were it. And they were like, yeah, stop drinking alcohol. You're not drinking ever again. Even though alcohol's not the cause, they were like, yeah, it's like taking a baseball bat to your pancreas, so don't do it. And I haven't done it ever since. And it's been, 15, 16 years? So yeah, when doctor says, don't drink alcohol, guys, don't put it down your gullet hole or any other hole. Just don't even try. Just stay away.
Or do, and then expect results.
True.
It's like I know if I eat popcorn, I'm going to have a stomach ache. But sometimes I just want
Really?
that fucking popcorn. Yeah, at a movie, I want to eat the popcorn, so I'll do it. And then the next day, I'm like, fuck, I shouldn't eat the popcorn. Or it's like Taco Bell. You're like, I'm going to go to the toilet after I ate this, and I still have had Taco Bell. And I'm like, oh, well, I'm going to do it. Sometimes you do it. But yeah, just be aware it may have consequences. Tickle Tits McGee says, Alexa,
Dr.
play
Goldstein,
James Egan.
Would it
I'm
be...
sure Eastful.
Gosh, we've been talking about Dr. Goldstein.
It's playing outside. Alexa, stop.
Would it be helpful for you to look at that page, the evaluation page, the data in
James
Goldstein's
Egan's now playing
evaluation that you
next
were
door.
talking about? Would it refresh your recollection of that data?
Yes, it would.
Okay, if I provide that to you, we'll talk through it, but we won't publish it to the jury.
Okay.
Okay.
Well, I actually don't need to see it. If you want me to just talk about it, if we're not going to show them,
For
sure.
time's sake, that would be great.
Okay.
'Cause she knows.
So, Dr. Goldstein administered a long questionnaire that assesses how one thinks, feels, and behaves. It's a measure of personality. And on this measure of personality, Mr. Sanderson's responses indicated a very high level of generalized anxiety. Along with that was also a very high elevation of what we call somatic symptoms, meaning that there's a high focus or preoccupation on health and physical symptoms. When we see high anxiety and symptom, it's symptom, I forget the title of the, I can't remember it's a symptom disorder or something like that. When you see them together, there's a high rate of somatization. Somatization is when psychological distress manifests as physical symptoms. So as a neuropsychologist, this is always something that I'm looking out for because it can certainly help me understand their presentation and their reported complaints. Additionally, as part of this evaluation or part of this questionnaire, there's a number of personality traits that are measured, and Mr. Sanderson scored extremely high on narcissism, and specifically the pattern of his responses within that category suggests
What did I say
somebody
earlier?
who might be feel that he is superior. He may feel that he lacks empathy. He may lack empathy. He might have an egocentric perspective on life, not see things from other people's perspectives. He may expect special favors or special treatment. There were additional skills that were elevated. There was a histrionic scale, but he was extremely dramatic and expressive. Other characteristics that go with that scale are volatile, overreactive, explosive. And then there was also some scales that indicated that he's someone that likes and needs attention and approval.
Does that data that you're going over tell you anything about the executive function chart we were looking at and the self-reporting that we get from Mr. Sanderson there?
No, personality by itself doesn't necessarily correlate with executive function or dysfunction. People who have high anxiety, executive functions is kind of a funny construct because people can have executive dysfunction for a lot of reasons. Some of them could be neurologic and some of them can be psychiatric. So most people with serious psychiatric disorders evidence some degree of executive dysfunction. You can also have executive dysfunction if you're sleep deprived or stressed. So it's an interesting concept. It's not necessarily, it can be, many things can affect it.
Do you have any opinions about whether Mr. Sanderson has exhibits any somaticization?
Well,
that's a medical diagnosis.
It's actually a psychological diagnosis.
And obviously, one of my questions is going to be explain to us what that term means. So, what was the answer to my question?
Yeah.
Somaticization.
Well, I mean that is one way to potentially understand why he's expressing all these symptoms, but there isn't actually objective evidence of these symptoms. So he's describing balance problems, but on testing he performs exceptionally. He's describing having all these cognitive problems, but on cognitive testing he performs well. So somatization is one thing that helps somebody make sense of what he's experiencing and understanding his presentation.
And then, is it unprofessional of you to render these opinions without having seen Mr. Sanderson?
Well, importantly, I'm not Mr. Sanderson's neuropsychologist. He's not my patient. I'm not treating him or making any medical decisions. If that were the case, then of course I would need to see him. But again, I was just hired to look at the records and provide opinions on the facts in the records.
And do you feel confident in your opinions despite having not evaluated him?
Objection, leading.
I do.
Ruled.
Why can't?
Sorry, what was the answer?
I'm sorry. I do feel confident in my opinions.
Why is that?
Because the facts are the facts. And again, that injury characteristics in those first few days and first few months that's the objective data. That's the most important time period to look at, and the facts are there.
Okay, that's all the questions for now.
Thank you.
Thank you, Mr. Egan. Mr. Sykes, are you the questioner?
No, civil country lawyer, no. Yep. Simple country lawyer. I mean, no, this is not good. You tried to do the whole, you can't diagnose that. Actually, yes, she can.
Today for your testimony.
I don't know. I didn't review my invoices.
You've come to court in an important trial, and you can't tell the jury how much you've been paid for your testimony?
Oh my gosh, can we not do this?
There were invoices for 6.5 hours, and I want to say 20 hours. I'm not 100% sure.
Is it more or less than $20,000?
Oh, way less.
More or less than 15?
Way less.
10,000?
Probably less.
Okay.
Simple Popular,
No.
how much are you being paid? What's your hourly rate?
Let me ask you about that first thing, the last thing you mentioned. It's important, is it not, if you're going to render an opinion about somebody like you have today, a lot of negative or contrary opinions about Terry Sanderson, right? In other words, he's maybe got dementia, he's somaticizing his problems, and you've rendered those opinions, have you not?
I have not said
without ever examining the patient, correct?
I have not rendered any specific opinions that he has dementia or somatization disorder. I'm merely describing Dr. Goldstein's results and offering. They're not. I'm not offering diagnoses.
Well, you sure fooled me on that one because I thought I heard a lot of diagnoses. But
No, that's the
since
thing
you're
you
not
thought
rendering
you did, honey.
diagnosis, I'm just a simple country lawyer. Okay, not rendering diagnosis. Let's talk about what you are doing. Could you, is it appropriate, is it responsible for a neuropsychologist to comment on somebody without actually seeing them clinically in the office?
Yes, you just
Again,
saw it happen.
If he was my patient, yes, he's not my patient. I was hired to review records and provide opinions on the facts in the records.
Aren't there standards with the American Psychological Association that recommend that you see someone before rendering opinions on them?
Those ethical principles apply to clinical practice and patient-doctor relationships, which does not apply in this situation.
So you don't have the same ethical principles in this case that you would if he was your patient. Is that the idea?
Ethical principles applies to clinical care. This isn't clinical care.
Okay. Do you agree that if you're going to evaluate someone and then come before a jury and tell us about him, that it's better to have more information or less information about them? What do you think? More information or less information?
The more information, the better.
Okay. Do you get more information if you actually have a clinical interview with someone?
As a neuropsychologist, my job is to evaluate for brain injury, and he had had numerous neuropsychological evaluations, and none of which have found evidence of brain injury. And so a fourth neuropsychological evaluation wasn't going to uncover brain injury that nobody else uncovered. So there was no point in me providing another evaluation.
Okay. So you're saying that you wouldn't have got any more information that would be helpful in doing a clinical interview with him or clinical testing, right?
Well, again, he had been previously seen by three different neuropsychologists who all did the same interview that I probably would have done. And so I had most of the information that I would have requested in addition to 20 years of medical history.
Do you have any idea why each one of the 6 defense experts, no one did a clinical interview with him? Do you know why?
I do not.
Okay. Did you request a clinical interview?
We discussed it, and again, I felt there was no point in doing another interview because or another evaluation because he'd had so many, and they all came to the same conclusion. No evidence of brain injury, and anxiety was a major factor.
Now, you have 2 other cases with my law firm. Is that correct? 2 other cases.
Your law firm?
2 other cases.
I'm not aware of this.
Okay. One in St. George, right? Where you did a 2-day clinical interview on a guy who had his eye shot out by a cop. Remember that one?
Relevance.
Sustained?
Yeah.
Sustained?
Okay. And you have another one in another ski case on Deer Valley and did a 2-day interview on him. Remember that?
Same objection.
Relevance.
Sustained?
On what grounds?
Relevance.
Okay. Well, isn't it true that you do a lot of work in your current situation for defense attorneys trying to defeat brain injury cases? Is that a fair statement?
No, 80% of my work is plaintiff.
Really? I'm just a simple okay, so, but you do a fair amount of defense work, don't you?
In the criminal realm, most of my work is defense. In the civil realm, most of my work is plaintiff.
Are you aware that all you have to do to get a clinical interview with someone on a legal case is requested? Because the judge has almost never turned it down. Are you aware of that?
Objection. Foundation, legal determination.
Sustained?
Yeah. Well, have you had any other, how many cases have you had in the past 5 years where you've been turned down for a Rule 35 independent medical examination? You had any?
I wasn't hired to do an independent medical exam in this
that.
case. I was hired as a consultant. That's it.
But
In those other cases, I was hired hired to perform an evaluation because neither of them had a prior evaluation.
Okay. Have you had anybody turn you down if you've asked? You can think of.
It's never come up.
Never
Asked
come up.
and
Okay.
answered. This is so stupid.
Now, excuse me.
I'm about to have an
As
Andy rant
a
up in here.
neuropsychologist,
Go for it, lass. Go
No,
for
I
it.
want to continue to hear the
Make me
stupid.
proud.
I want to
In
continue
the
to hear the stupid because I'm going to let him
evaluation
embarrass himself because he's making a complete idiot of himself right now.
of finding out, I'm just a simple country lawyer, how the person functioned before the incident, which is
He's an
February
asshole is what he is.
26, 2016, and after, right?
Yes.
Okay. Now, you can get some of that information by asking the injured person himself or herself, can't you?
I could, yes.
In this case, you didn't have that opportunity. But you had other information, did you not?
I had a lot of information.
Let me finish the question, please. Had other information about the before and after status of Terry Sanderson. Is that a true statement?
I had a lot of information, yes.
Well, on page 2 of your report, you have that handy there?
Yes.
You had the depositions of Polly Sanderson, Terry's daughter, and Carlene Davidson, his former girlfriend, essentially a fiance. Did you read those two?
I did.
Objection,
did.
hearsay.
Objection,
It has nothing to do with her clinical evaluation.
Nothing. None. Dude,
Well,
the
do
reaching
you
for
remember
straws,
Polly
though.
saying,
I
Polly,
think, opinion, conspiracy
Carlene
theory,
saying
whatever. The
that
reason why
she
they're
was living up here
questioning
300
absolutely
days out of a year.
balls
They
is
were
I think
together
they've
about
realised they've lost this case.
A year and a half before
Grabbing
the
at any
accident.
straws
Remember
now,
that?
they're desperate.
They're losing it even
I
harder.
remember that
though,
they
the way
spent a
did
lot
it.
of time
Oh,
together.
yeah, yeah.
I was under the impression
It's
that it was split more between
when
St.
you
George
start
and
getting
Salt Lake.
desperate,
Oh, really?
you make more
Okay.
mistakes, and this is where we're at now.
And that's
I
what you
think.
took out of the deposition? That it was split?
Actually, it's an irrelevant factor for me.
Irrelevant.
Because I knew that they spent a lot of time together, and that's all that mattered.
Are you telling this jury of the good people of Summit County that what a girlfriend who's essentially live-in says is irrelevant for before and after? Is that what you're saying?
That's not what I'm saying.
Sounded like it.
That's not what I
Okay.
said.
Now, are you
That's what it
aware
sounds like if you're
that
simply-
Carlene
I'm a simple
Davis
country
lawyer testified that there was a night and day difference between Terry Sanderson before and after this ski crash. You aware of that?
I do.
Okay. Did you simply disregard that? Because I don't see any reference to Carlene Davidson in your 5-page report here. Not a single reference. Why did you omit that?
So Carlene spent some time with him in that initial recovery period, and she described that he was grouchy and didn't want to be touched, and that was pretty much it. And then he withdrew from the relationship. He became hyper focused on his symptoms and himself, and he withdrew from the relationship. And she was heartbroken, and then they didn't really spend a lot of time together after that.
So your testimony is that all Carlene Davidson said about changes afterwards is that he was grouchy?
But the problem was he was recovering from broken ribs.
No,
and so
that was my question.
It's relevant in that, you know, he pulled away and he was focused on getting better and dealing with his health, and he didn't want to engage. So he's had a physical orthopedic injury that he was nursing, and that could explain some of the not wanting to go out and do things.
I'm just a simple country lawyer, okay? I'm going to try that question again.
He did it
Are
again!
you telling this jury that, I think you said, essentially that's all
He's
said,
a country
said
lawyer
was
when he wants to be
grouchy?
dumb, but then
Are you
he's
telling
not
this
when he wants to
jury
be smart.
Of the people of Summit County, that all Carlene Davidson noted in difference was that he was grouchy. Is that what you're saying?
In the first couple of weeks, that's my recall of the deposition.
First couple of weeks, okay. But she was with him for 6 months. 6 months after that accident, after that crash.
It's my understanding that they saw much less of each other.
First question.
Oh.
And didn't she say that he changed in a wide variety of ways? Socially, personality change, executive function, emotions. Didn't she say that? And you ignored it.
Your client had a
She might have
stroke
said
and
it,
has
but
water on his
importantly,
brain.
Mild concussions don't
Before he
produce
got into an
changes
accident.
in personality, social functioning, or behavior.
Okay. Now, Sam Goldstein, who you know, right?
I do.
He's one of the world's foremost experts in neuropsychology, correct? He's written dozens of books.
On children's neuropsychology.
Not just children's. Okay? Do you think that executive function test is for children?
Although, dude is probably
No, but it's not
like
one
child,
widely
so you
used
know.
in adult clinical practice.
Okay. He disagrees, by the way. I talked to him during the noon hour.
Okay.
Oh, I just talked to the guy.
Objection. Here's
Anyway,
a.
strike that.
Move to strike. Sustained.
What the fuck was that? I just talked to the biggest expert. He told me.
Isn't it true? I'm just a simple country lawyer. It's one of the two
Right, guys, I'll be
top
back.
tests used worldwide to assess executive function.
That is not my opinion. I would disagree with that.
Okay. Now, do you understand from Carlene Davidson that she stuck it out for 6 months with Terry? Understand that?
I believe that's probably
And is it your
about right.
testimony that...
Just a second. What did you say?
I believe that it was probably about 6 months. My understanding is they broke up at the late summer, early fall.
Is it your understanding that they broke up simply because he was cranky? Is that your understanding?
My understanding is that he pulled away from her.
My question was, is it your understanding that they broke up simply because he was cranky?
That is not my understanding.
Good. Okay. So let's go on.
This guy's such a dickhead.
Did you read the deposition of Polly Gresham,
I did.
his daughter? Did you by any chance watch her testimony here in trial?
I did not.
Okay. Is it Polly Gresham in her deposition said much the same thing as Carlene Davidson, that there was a massive, sudden, dramatic decline in her father after that ski crash? True or false?
I believe that she said that, but my understanding is that I didn't get a clear sense that she had a clear picture of her father's functioning in the months to year before this accident. When she referred to previous functioning, she always referred to when he was working, which was before 2010. So it was a long time ago and arguably an unfair comparison.
Okay. Have you ever read Hamlet? Methinketh she protesteth too much. Okay. My simple question.
I thought he was
I'm just a simple country lawyer.
But he reads Hamlet?
Say that there was a massive, fundamental, and dramatic decline in her father after the ski crash. Now try to give me a non-Hamlet answer. Yes or no?
So I read all three daughters' depositions, and I have a hard time keeping straight who exactly said what. I know that they all described some changes after the accident. Two of them felt that there were significant changes. One of them felt that there was a lot of the same behaviors before this, but they were just magnified after the concussion. And one of them noted that there were some significant changes, but a lot of it improved, and then a whole different set of behaviors really emerged. So
you can't answer my question about what Polly Sanderson said then?
I know that she endorsed a lot of changes. The problem is in clinical practice, I see this with families all the time. So with older adults, it's really tricky because many older adults are experiencing some degree of decline. Unfortunately, that's just part of aging. And then when you've got a complex medical history, it's more probable. And a concussion like this might happen, and the patient and the family grab onto this concussion as the defining factor that changed everything. And they misremember or underrepresent their pre-injury functioning and overestimate their problems after this, and everything gets tied to the concussion. And so that's what I saw happening with this family, is that everyone's really grabbed onto, including Mr. Sanderson, that this concussion was the cause of everything. And the behavioral presentation that he and his family are describing is inconsistent with a mild concussive injury and very consistent with what I would predict based on his medical history. And so, again, yes, they are describing a lot of changes after this concussion, but I can't rely on them to clearly indicate a causal relationship with this concussion, because I don't think that they were carefully observing and aware of his level of functioning in the year prior to this.
No. So the jury understands. That was a 2-minute answer to a very simple question. The simple question was...
I get it, simple country lawyer. It went over your head and it's hard for you, but can you please shut up and let the grown-ups listen?
I'm sorry, Polly Gresham. And you gave me a 2-minute Queen of Denmark answer. Now why did you feel a need to add all that detail when the question was very simple?
Because
Why?
It wasn't.
Because it's important for the jury to understand. I don't want them to be misled.
Mm-hmm. Okay. All right. So, you can't really tell the jury, because you either don't remember or you didn't read it, you can't tell the jury what Polly Gresham said about the dramatic changes, right? Instead of telling me, you can tell me yes or no, you know that, you give me a 2-minute answer. Is that what happened here?
No.
The changes that were described were changes such as severe disorganization, getting lost in the details, ruminative thinking, obsessive thinking, gross disorganization, confusion, getting lost. None of these are symptoms of concussion.
Okay, now let me ask you this. You talked about the concerns about these MRIs. Now, you're not a medical doctor, but you say you look at them, right?
They're an important piece of my evaluation, yes.
Did you hear Dr. Hesch's testimony this morning?
I did.
Yeah. Excuse me. He said, did he not? That I'm just 2009 to 2021. all the MRIs he saw, there's no change. Did you hear that testimony?
I did.
No change.
Mm-hmm.
So, this testimony you gave the jury about being worried about him, this explains he's getting worse because of this. There's no evidence of that in these scans, is there?
The structural changes are not worsening, and if I'm going to go ahead and add that, it's pretty miraculous that he wasn't having some more significant problems back in 2009, and it was just a matter of when, not if. And so I wouldn't predict that more structural changes needed to happen for him to actually start manifesting symptoms of that.
Okay, now before you give another 2.5-minute answer, let me just ask you this. Can you look in those records and see where any physician, not yourself, you're not a physician, has diagnosed those conditions that many people have asymptomatically, where anybody diagnosed those conditions as causing his current problems? There lie the books before you. Open them up.
I didn't understand that. Could you repeat that question,
That made
please?
no sense.
Show me a record where a physician, now he had many at the VA, right?
Yes.
Many, not just physicians, but speech pathologists, psychologists, neuropsychiatrists who are MDs. And no one at the VA diagnosed what you're saying is the case, did they?
I'm not diagnosing anything.
Well, you're saying that these scans explain his problems, but no medical doctor has done that. Now, how can you diagnose it and you didn't see him and no medical doctor has done it? Now explain that to a simple country lawyer.
The medical doctors have noted, it's repeatedly been stated that his brain MRI looks like he has normal pressure hydrocephalus.
Is there a diagnosis?
No.
Now, has he ever been diagnosed with normal pressure hydrocephalus? Ever?
He hasn't, because typically the diagnosis requires clinical correlation with a triad of symptoms that involves a very specific characteristic change in gait and confusion. They don't have to have dementia, but cognitive changes and urinary incontinence. Now, they say he's asymptomatic. I'm not convinced, because the most common mood symptom associated with normal pressure hydrocephalus is this lack of energy, lack of motivation, low drive, and he's been reporting this for decades.
Now, let me stop you there. Would it be accurate to say that you have a better handle on what these pre-existing problems that are identified have caused him than his medical doctors at the VA? Is that a fair statement?
No, I'm not saying I have a better handle than any of his medical disorders, but as a neuropsychologist, I have a very unique perspective, and I'm the one that puts together neurologic data and psychological data. That's my expertise, and that would be an important piece that I would take into consideration if I were evaluating him myself.
Okay. Now, let me ask you about executive function.
Got that cough.
I looked through your report. Again, I'm a simple country
make him
lawyer,
sit down.
but I can read. I don't see any reference in your report to executive function anywhere. Am I missing anything?
No, executive function is not commonly
That's
affected.
a yes or no? That's a yes or no?
No.
Okay, thank you. Now, let's talk about faking and malingering. Are you suggesting that Terry is faking these problems for money? Is that your suggestion?
No, there's no evidence of faking and malingering of any kind. He's genuinely distressed.
Now, you say that in your report that your diagnosis is somatization disorder. Is that what I'm reading here?
No, I did not diagnose him.
Okay. Well, you say on page 6, somatization may also explain delayed onset or worsening of plaintiff's reported symptoms. Your words.
Somatization is used more like a noun there.
Mm-hmm.
It's not a diagnosis.
Okay, that's what you wrote. And somatization, so the jury understands it. Okay, I don't need a 2-minute answer. It's a very short answer. Simple. Tell the jury what it means.
Somatization is when psychological distress manifests as physical symptoms.
Okay. Now, has any physician psychologist or anybody else diagnosed Terry Sanderson with somatization disorder? Anybody?
Not that I know of. But they all repeatedly talk about his anxiety and anxiety about his health and his symptoms and his preoccupation on his symptoms.
Oh shit! Oh shit! Nice of you to add that. Thank you. Kept it under 2 minutes. Okay.
Oh, you're such a douche!
I'll withdraw it.
Withdraw it.
Okay. Okay. Your Honor, I'm going to take 1 minute and just talk to my... I'm their capitalist running dog. I got to go talk to him for a minute. Thanks.
Go
I'm
away.
just a simple country
Please,
lawyer.
go away.
Time's on the clock. Like, not a lot of clock time. And now, what is this?
I love how he literally used the term when he was talking about
All right.
somatics.
Thank you,
Used
Mr.
it-
Egan.
Oh, are we done?
The cross.
Oh,
of the
he
cross.
just gave up. Okay, good. They probably were like, bro, please don't go back up there.
Dr. Eastfold, after questioning from plaintiff, is it still your opinion that plaintiff suffered at most a mild concussion from the collision occurring on February 26, 2016?
Your Honor, that's an improper redirect that's already been gone into.
Overruled?
Yes, that my opinion remains.
And is it still your opinion that plaintiff's course and evolution of self-reported symptoms is inconsistent with the known trajectory of concussion-related symptoms?
Yes.
And is it still your opinion that plaintiff's medical history is notable for a number of comorbid conditions that better explain his reported course of decline?
Yes.
No further questions. Thanks.
Can I add something, please?
Oh.
Please don't.
Please don't.
Sure, go ahead.
Okay.
Oh, we've listened to you add enough, sir.
I have a lot of compassion for Mr. Sanderson. I do believe that things are changing for him. It is terrifying when one starts to lose their faculties. And I'm not...
I object to this.
Sustain it.
Non-responsive, thank you.
It's a narrative. If you've got some more questions, go ahead.
Okay.
I get you to say that.
He's like, what do I do?
Okay.
No further questions.
Thank you.
Yeah, but the jury still heard it. You know what I mean? Yeah. Her trying to be empathetic while still being firm.
I think I know exactly what she was
Mr.
going
Egan?
to say.
Yeah, Your Honor,
It makes
we
sense.
called Dr. Galit Askenazi as an expert.
Judge, you want to take a short break? It's been an hour.
It has been an hour. Let's take a short recess.
Okay.
Did I miss out? Presumably not.
Oh, he just continued to be incredibly disrespectful, inappropriate, rude, all while simultaneously making it very clear to anyone that knows anything about psychology and neuropsych and anything like that he is an absolute
Short
raging
recess.
moron. That's what you missed.
Okay.
Oh, what? Okay, just to be clear, like what I mean by that is literally he was reading a description of something she wrote when she was talking about somatics or the physical manifestation of stress in the brain that can come from anxiety, trauma, all those types of things. People that have somatic flashbacks where traumatic things that have happened to them come back and they feel it in their bodies the same as it happened back then, because that's part of how it manifests. It's real pain. It's horrible pain, but it is neurological. And notice how I'm not saying that it means that they're crazy. I'm not saying it on an emotional level. I'm saying that what has happened to them has been so bad that this is the way the brain can deal with it. Somatic symptoms are not a joke, but somatics themselves are not a diagnosis. And he was referring to it like it was a diagnosis. And she kept on trying to make that very clear, that she was not diagnosing him with a disorder that included somatics. She was just saying that this is something that he is experiencing, which is suggestive of other things. She's also not saying she's diagnosing anything, because she's not. She was called in to take a look at 3 separate reports from different doctors and make her own analysis based on the information. And that's why she didn't do another clinical interview, because what is the point of going and doing it and putting Terry through it for a 4th time? Because the other problem is, if you keep putting people through those things over and over and over again, they start to notice things. That's why we had an issue in the Amber Heard trial, where Dr. Curry was like, after she did her analysis and then Amber's doctor came in and did similar tests, Amber had already had a dry run through of the test. And when it's all self-reporting, you can kind of tweak your answers a bit, potentially, if you're looking for a specific outcome. And considering we have Terry over here, who's already admitted to potentially doing that with doctors, I think she made the right decision. What we're talking about is brain scans. What we're talking about is other interviews and things like that. And she's coming to that conclusion. And she's not making a diagnosis. But I mean, if you're talking about someone that, you know, has lost motivation, has low energy, has a lower mood, has lost interest in things that they like to do. This has been going on for more than like a 2-week period. There's a past history of other issues. Well, that certainly does look like depression now, doesn't it? Potentially a very serious symptom. Does that mean that it's MDD? I don't know. Does it mean it's cyclothymia? I don't know. It depends on the specific situations. And she's not trying to say that. So what she's attempting to do is explain to this moron what somatic symptoms are, because obviously he doesn't get it, because he's using it incorrectly, reading a sentence. He's not even understanding what is coming out of his mouth. And then he goes off on this whole thing that she needs to keep her sentences short, and that the lady doth protest too much, like in Hamlet. Attempting to make himself look smart with your grade 9 Shakespeare English reading, which I cannot even handle. It's just the most ridiculous thing. It was like listening to the dumbest mansplaining I've ever heard in my life. And he just made himself look like a moron.
Well,
I mean, he made himself look like a.
Up and gets to the mic, he's already looking like a moron, really.
Like, I mean, chat, if you disagree with me, I am not a psychologist. I've been through a crap ton of therapy, and I've done a lot of like my own study into it, and I did take it a bit in school. I'd love to go back and learn more about it, but it's just like the most ridiculousness of, he doesn't know what he's talking about. He doesn't know, and he's trying to tell an expert that she doesn't know what he's talking about. And it's stupid. It's so stupid. And it's also, I also felt like he was really downplaying like psychological diagnosis in a way, of saying like, well, you know, you didn't meet with him or whatever, or you didn't take into account what these other people had to say. That's not really like a thing. I'm sorry. A lot of the time, psychological diagnosis, it does not require other people to come in and sit on a couch and talk about you for hours or give a deposition for them to be able to make their decision. They make decisions through things like the MMPI test, which is a 500 question interview that is timed, and it's specifically designed to trip you up and to really expose your thought processes. For example, one of the questions that's in there a lot of the time is you have to say true or false. I have never lied. If you say true, they know you're lying. Because everyone has. You're just saying you think of yourself as someone who is not capable of being dishonest, or you're trying so hard to hide it, you don't realize how stupid you sound when you do that. It's an indication of other psychological issues. And then those 500 answers, depending on how long it takes for you to answer them and the answers you give in combination, that suggests potential diagnoses. This is the science of how it happens. It's not based on Carlene's deposition. It's mental.
Oh, he's mental, all right.
Yeah.
He's just a simple country lawyer.
I'm just a simple country lawyer.
He's a simple country douchebag.
Now that coming from Kim is like everything.
I know, it's so
I get
rare.
it. I know. I see some people in the chat going, "Move on, Kim. I feel for you." I don't get mad like this very often. I'm
No,
allowed
let her
to
rant.
get pissed. I'm allowed to have an opinion about these things.
100%. A Kim
Dude,
rant is
what you've
rarity
just
that I'm all for.
witnessed is a unicorn moment. Very rare unicorn moment of Kim absolutely being savage.
And
like,
quite bluntly,
come on.
ladies up in this chat, if your skin did not crawl when he said the lady doth protest too much, I'm sorry. No. Mm-mm.
That was gross.
Mm-mm.
That was gross.
Mm-mm. But now
This
I am
dude-
going to sit and I'm going to enjoy my Frappuccino and try to take a moment before this madness begins. What did you think, Andy? What did you think, Steph?
Oh, it was a good time. I was having a good time. He was just all over the place. Yeah, I mean, he's trying to play. I can't stand when someone's trying to do that. They're like,
I'm just a simple country lawyer.
but then he's clearly trying to be smart. It's like, you don't get to have it both ways. You're either playing dumb and slow to me, but then you don't get to start throwing out books and trying to school her like you're smart. The whole thing came out disingenuous. And he was just blustery. It's like this, the whole plaintiff team have just been awful. And Gwyneth, with the exception of Egan, I don't think James, what's the other guy? Owens? Owens has been a little snooty at times. Like he feels a little Paltrowy. But yeah, too much bluster, too much coughing.
Ready for the jury?
Can I also... Okay, bring it
All right.
Okay.
Why don't you let
I'll
him
also
know?
just say one thing I forgot to mention because I took notes because my rage was growing. There was the one question where he tried to be like, you have other cases at this law firm where you talk about, ski accidents and things like that, and tried to bring that up, and they were like, why is this relevant? And that got thrown out, and he seemed really pissed. And I'm like, was that going to be something to try to discredit her? Because quite bluntly, he was already trying to discredit her based on how much she was paid. And I'm sorry, I feel like if you're going to dish that, you should be able to take it. I want to know how much Southern Country Lawyer is getting paid.
Mhm.
I want to know about all the people he has defended in his career. Because I'm betting there's probably been some despicable people that he has defended. Does that mean that he shouldn't be a lawyer?
100%.
It's just the stupidest thing. I think he needs to go lay down.
Would the lawyers approach the bench, please? Well,
Come on, really? We're quiet again? Oh God, this will never end. I really am excited for this trial to end. I'll be honest, guys. It's a tough one to stay motivated for. Doth either of you ladies protest too much?
It depends on the situation. You asked. You asked.
I think the old man doth cough too much, but
He definitely doth cost too much.
If it ain't dipped in gold, then I may protest.
Yeah, dildo and gold. That's too much.
Yeah. Although I wonder on the Goop website if Gwynny is or will start to try and push products that enhance and help with memory. Wouldn't that be funny? Be like, suffering from memory loss and issues with your brain? Use this dildo to head screw yourself with or whatever. I don't know. It'd be somewhat weird, wouldn't it?
Lisa in the chat, she just said he was making a point that she saw them in person but did not see his client in person. So there's in like she saw the doctors in person, but not Terry in person. Yes, because part of what I was trying to explain in my rant is that if you keep on giving someone the same interview over and over and over again, it can taint the results. Right? Because they're looking for potentially the patient is looking for a specific outcome. So that's why you can't have the things over and over and over again, because at that point you likely can be coached or other things of that nature, particularly in a lawsuit case. It's literally better data to just use what's already been done. That would be my argument on that point.
Thank you. Mr. Owens, you may proceed.
James is back up.
Or Mr. Egan?
Yep. Thank you, Your Honor. We call Dr. Gwyneth Ashkenazi.
Do you swear that the testimony you are about to give in the case now before the court will be the truth, the whole truth, and nothing but the truth, so help you God? Yes, I do. Thank you.
Good afternoon. Would you begin, once you get seated, give your full name and spell it?
My name is Galit Ashkenazi, Galit, last name Askenazi.
Dr. Ashkenazi, thank you for being here. Let's begin by asking you what you see your role as an expert here today.
So I was asked to review records of Mr. Sanderson in order to determine if, due to the ski accident, he suffered any cognitive or mental health issues, and if he did so, to what extent.
Your Honor, we briefly approach the bench. I think this may be put to the...
Oh my gosh. And if we took shots every time there was a sidebar, I think we'd all be dead.
Do you know what? The sidebar would probably be more entertaining if it was actually a bar to the side. Be like, get your drinks in! Get your drinks in! That looked really, really dodgy right there, but I was supposed to be like emphasizing the whole like making a mocktail cocktail situation. I mean, at least I wasn't going like that. So there we go. You know, sometimes, you know, when the cocktails go like this and they go like this, do you know what I mean? So at least I didn't do that. Well, technically I did, but you know what? Hi, Kim's parents. But yeah, you know, be like, you know, actually go to a bar to the side. That would be cool. And then they could get really, really drunk. Oh, okay. Question then. What do you think Colonel Sanders, the simple country lawyer, would be if he were like flat out drunk off his tits drunk? It'd be fun.
Be a mix of mumbling and coughing.
I think he'd be like, yeah, cowboy. Yeah, cowboy. And what's the character on Simpsons now, Andy? The one that's like proper like gun toting.
Oh, the cowboy, the Texan.
Yeah, the Texan. Yeah, I kind of see him a little bit like that. The country lawyer.
I'm just a simple country lawyer.
You know
Tickle
what?
Tits McGee.
You know
Tickle
what I would
Tits
love?
McGee. Oh, sorry. I was going to say, Tickle Tits McGee. Doth James cometh into mine chambers. So are Terry's daughters experts in brain injury? Asked Starflower. Good question.
Bonk.
And Tickle Tits It was the worst KFC ad ever. Guess it's back to El Pollo Loco or Popeyes. He's not helping Colonel Sanders. You tell him, Kim. Go, Kim, says Sarah Wingham. Tingle Tits again. Physics Zaddy, if you're watching, this is my inertia to enter my mass. And he spelled ASS bigger in the mass. Ninja Vestos, which is the most chaotic trial? Johnny Depp, Daryl Brooks, or this one? Oh, Daryl Brooks probably
Daryl
is the most
Brooks.
chaotic.
They migrated courtrooms.
Johnny wasn't really chaotic. Johnny was just wild. A lot of wild stuff was revealed, but the chaotic was Daryl. This is the most boring. Tinkle Tits, not dementia. However, Alzheimer's is getting diagnosed via eye exams now before cognitive symptoms. Alexa, we already did that. I'm not doing it again. Derek Brown, read the bill. It's not about China. It's about the freedom to spy on anyone with no warrant and restricting freedom of information and control. Well, we said that. It's about a lot of stuff, but they're trying to say it's China. Tinkle Tits, China owns Grindr, and that's more of a new national security risk because maybe half the politicians are on there. That's valid. So if that's true. Sebastian Mueller, preach, Steph. Tinkle Tits again. When I was under 18, I always clicked I was over 18 on PORN sites. Not enforceable. Now here's our sponsor, NordVPN. Claire says, my 9-year-old granddaughter has an iPhone. Don't agree with it. She's too much. She knows too much. I share your worry sometimes. Tinkle Tits McGee, Physics Zaddy. If you're watching, hit me up. You really want the Physics Zaddy. All right, now we're caught up. Josh McKenna, lawyer Von coughs a lot is annoying. And Deborah Ivy, they are all sneaking shots at the sidebar so they can make it through this drag of a trial.
Asserted to the plaintiff.
I'll take that under advisement.
Thank you.
What'd he say?
I'll take that bench conference. Can we have asserted to the plaintiff?
It's under advisement right now because it's a pending objection based on what's going on with the questioning.
Thank you.
Okay, Dr. Eskenazi. The next question I was going to ask you was, did I ask you to, in particular, look at Dr. Fong's assessment of Mr. Sanderson?
Yes, I was asked to specifically look at cognitive effects and Dr. Fong's assessment and his treatment while he was there.
Okay, thank you. We'll just start with the main point. Do you agree with Dr. Fong's assessment?
In terms of persistent post-concussive syndrome, no, I do not.
And why do you have expertise to be able to offer that opinion?
Okay, are you asking about, to start with my education?
Yeah, sure, you can give us your background, yeah.
So I completed my undergraduate degree at Princeton in psychology. I then spent 2 years after that working at Harvard Medical School and Mass General Hospital assessing dementia and doing work in the diagnostic clinic there. I then completed both my master's and PhD in clinical psychology at Case Western Reserve University, which is in Cleveland. It's a general clinical degree, but I specialized in neuropsychology. I created for myself my own training experiences in neuropsychology. I then spent a year as a neuropsychology intern at the VA in Cleveland for my pre-doctoral internship. And then after I graduated, I completed a 2-year postdoctoral fellowship or residency in clinical neuropsychology in accordance with what we call the Houston Guidelines. It dictates how you have to finish 2 years of supervised training with a board-certified clinical neuropsychologist and how it's required that you continue your education so you have more expertise and then complete an examination with that. And then once I finished all that formal education, I got board certified in clinical neuropsychology, which is a few-year process. There's a few steps to it: written examination, samples, oral examination.
We'll just go right
and then
to
I
the money.
respecialized in forensic psychology. I did an internship or postdoctoral fellowship in forensic psychology, and I also got board certified in forensic psychology. I'm currently one of 6 people in the country with those dual certifications.
Taken away from your day job, brought into court to use your expertise and your brain power and your knowledge for your side, their side, or whatever. Damn right they should get paid. Do you know what I mean? Yeah, exactly.
Dr. Fong
Show me the money.
sufficiently assess Mr. Sanderson's medical condition and history to render the opinion that she did about his persistent post-concussive symptoms?
No, and as people have already said today, and I don't want to be too redundant, in order to assess a concussion, first and foremost, you need to know the symptoms at the time. It's considered an acute and immediate condition, so you need to know the symptoms at the time. Then to establish if someone has post-concussive syndrome, you actually have to show the path from the concussion to those symptoms that a person is claiming. Dr. Fong reviewed absolutely no medical records, even though this was a legal referral to her. She took at face value his report that he'd been having certain symptoms for a year and a half straight, which we know through the medical records that is not true at all. He had some symptoms at the beginning, completely resolved, and then actually his records after that show full resolution with multiple, of course, neuropsychological testings during that time.
And are you familiar with Dr. Fong's testimony that as I believe it, if I'm remembering it correctly, that the defense experts, which would include you, don't recognize post-concussive, persistent post-concussive symptoms?
So post-concussive syndrome is a well-known condition, but the thing is, its symptoms overlaps with multiple other conditions, and that's why you have to connect it back to the acute concussion. Now, the term persistent post-concussive syndrome is one that's considered in the neuropsychology community to be one that's under research. There's no real evidence that after 3 months a person continues to have symptoms from a concussion or a mild traumatic brain injury. So that's still under investigation if those symptoms are truly persistent.
So Dr. Fong, as you said, did not review prior records, but did you review prior records?
I reviewed the records from around the time. I reviewed 15 years of medical records beforehand, and as many of the medical records given to me afterwards, as well as some of the reports associated with the accident.
And you have your own opinions about that prior medical history and how it might relate to Dr. Fong's diagnosis, is that right?
Yes, that's correct, especially because when you're talking about any acute condition, you need to know what are the changes from before to after to say, well, this acute condition caused those changes possibly.
And as I understand it, you've created some slides that go over some of those opinions, is that correct?
Yes, so I created slides that summarize the records I reviewed and the information I thought that was relevant to form my opinions.
And to respond to Dr. Fong?
Yes.
And so with that, Your Honor, I move to admit or to publish to the jury as a demonstrative exhibit, Defense Exhibit 105 is A through another letter. I got to go to the end here. A through V, as in vehicle.
V? Victor?
Yeah, Victor, yeah.
Okay. Any objection to Defense Exhibit 105A
Yes,
through V on for demonstrative purposes?
Oh, yes.
That have any objections other than those that have already been voiced?
I haven't voiced any objections to it, but I object.
Oh my God.
It's not in her report, and it's undisclosed. So we've never seen it. They could have shown this earlier this week.
Well, yeah, so
It's in our
are these demonstratives that were they provided under the pretrial order?
They were provided before the deadline, Your Honor.
These slides?
Yes.
They were.
105.
Oh, I've not seen them.
What's it? Can you cite them again?
I don't think we've seen them, Judge.
All right.
Your Honor.
I wonder if you could show me where you provided them to the other side so we can move on beyond this.
Sure.
Yes. One of the plaintiffs' side come up here so you can take a look at this.
These are the March 16th ones?
Yeah, I think Mr. Ferguson just showed you where we initially disclosed it. Is that fair? Very first issue. 13 years ago. Did we disclose it? Did we disclose them?
These are the March 16th ones.
I don't think no. November 4th.
very first one.
How we doing, everybody?
Judge, I see these in the document, but they were disclosed, I think, late.
Incorrectly.
But
Why
they
don't
were
you
never identified.
take a look at what just came over there, because
They were never identified as coming from her. Just
Doctor.
well, let me ask you this, Mr. Sykes. Do you want to take trial time up to nail this down?
well, give me 10 seconds then.
10, 9, 8, 7,
Seven,
6,
6,
5,
5,
4, 3,
December 31st.
2, 1. Time's up.
Go ahead.
Failed!
They are received for demonstrative purposes only to help this witness illustrate her testimony.
And Your Honor, can I have that delay of time attributed to the plaintiff, please?
Yes, you may.
Okay, Dr. Ashkenazi, I'm going to put your slides up here. And my iPad is not putting them there. Connect. I don't know why it keeps doing this. It works and then it won't work. Dr. Ashkenazi, while it's coming up, so we don't waste time. Oh, there it is. Are these the slides that we were just discussing?
Yes, they are.
Okay, great. And let's go into the first slide, which is Mr. Sanderson's mental health history. You note a number of things, but I would like to focus on some things that maybe have not been covered,
Okay.
including Mr. Sanderson's mental health history, how it relates to his emotions and relationships. So if you could discuss the mental health history with that focus.
Judge, this is duplicative of Dr. Eastwald, and we just discussed that at the bench.
Overruled? Some minor overlap, but it doesn't seem significant.
Okay.
Okay, go ahead. Do you remember the question?
Yes, I do.
Okay.
So I won't repeat the known history of anxiety and depression. And again, this is not something that Dr. Fong had assessed. And we know it dates back decades. But very specifically, he had sought treatment in 2009 because he was having relationship issues, both with his family and in other relationships, that he described as a conflictual interactional style that got him into trouble. He described that he is someone who likes to be in control, and he gets frustrated when he's not. And these were in the treatment records as to why he was seeking out treatment at that time.
Got it. Did you note in his history any significant anger issues?
It has been brought to my attention that there was an issue that he punched someone at some point who he believed was in a relationship with his wife. There was also a restraining order. So the first one was beforehand, and the second one was in the last few years, a restraining order against him.
Interesting.
Let's see. I think Dr. Eastwell covered a couple things there, so we'll move on.
So hard to hear that cough.
Here's the next slide. It's still under that same banner of prior medical history, meaning before the accident, correct?
Yes, that's correct.
And here you kind of talk about medications, which has not really been discussed, I don't believe, in too much detail. What was significant to you in the past, again, the pre-accident history in terms of Mr. Sanderson's medications?
So we've already talked about that he's long been on medicines for depression, anxiety, and insomnia, but multiple times over the years before this incident, he tried to get off the medications, and every time he tried to get off them, his symptoms would always rebound. He'd have greater depression, greater anxiety, couldn't sleep, and so it was a bit of a cycle that he would get off and then need to get back on it again.
And were these all being treated at the time of the accident?
So they were being treated, but what's interesting, in his last visit with his primary care physician right before the accident, the one that occurred on February 2nd, 2006, he actually informed his doctor that he had taken himself off his Wellbutrin, which was his antidepressant and the medicine that was also helping control some of his anxiety. So you're talking within a few weeks of his accident, he had disclosed that he had taken himself off his medication again.
And why was that significant in your evaluation?
I found it significant because the records beforehand showed that he had always had a rebound when he got off medication. So some of his reported mood changes in the months that followed when he was still off the medication could have been attributed to not having it properly treated.
Did he do anything else aside from take prescribed medications to deal with his mental health issues?
He did a lot of things. He was in stress management classes. He looked into Eastern philosophies, into meditation. He did yoga. He did a lot of different things in attempts to help better be stable, to supplement his medication, but again, also to try to get off his medications.
And were any of these things that he tried, medications or the what would be the word, the non-medication treatment, was any of that successful?
So I'd refer to that as adjunct therapies to the medication as well. So they were successful, but none of them permanently. So he always has cycled. So he'll be stable for a while, and sometimes even on medication, he destabilizes, and he tends to do it when there are family issues or relationship issues, or he has suffered an acute medical issue.
So why is that history significant to the assessment post-accident? In other words, what is significant about this history for your opinions relating to his concussion?
So you want to know what or how a person was functioning before any major event. You want to know, did the major event cause the changes, or would these be expected as sort of the normal cycle of that individual? And what can you attribute to what?
I see. And these issues that you noted pre-accident, did they continue post-accident?
They did. Now, he did have an exacerbation right after the accident. He was in pain. He was on oxycodone. His hypertension was out of control. He was irritable from the pain and from the medication. He was feeling foggy because of it. And he also, of course, was not on his medication that he had discontinued right beforehand. So you do see a flare-up of his mental health complaints, his anxiety especially, but also his his depression in the months that followed. But then you can also see that by the end of July, beginning of August, he's back to his baseline.
I see. And when you say baseline, does that mean where his mental health conditions were before the accident?
Exactly. So it's his baseline, not anyone else's. So he always had some chronic anxiety. He'd always had periods of depression. The insomnia persisted. So he was back to his baseline. So starting about August 2016, you see that he doesn't have exceptional complaints about flare-ups of anxiety, flare-ups of depression. He actually has no cognitive complaints starting in August 2016 in his medical records, beyond those that would be normal for someone's age, some minor forgetfulness. So that's important because you see that there was an exacerbation, and about 5 months later, his ribs are healed, he's off the pain medication, and he's back to his pre-existing baseline.
And in your review of Dr. Fong's evaluation, she did not consider any of this that you're discussing, is that right?
No, she didn't seem to know that at all. She actually had documented that he reported things like dizziness, loss of balance, headaches, attention problems, memory problems that not only were present, but had been present the entire year and a half prior to her seeing him, which the medical records show is not true.
Let's go to the next slide. It's the brain scan history. I think this was covered earlier by Dr. Black. Were you in the courtroom?
Yes, I was. This has been covered quite a bit. But I'm not sure if this was mentioned or not, but the reason why he had the brain scan was not actually just because of that occlusion in his retinal artery. He had a flare-up of his migraine headaches, which he had suffered from his 30s or 40s, and they were checking his brain then, and that's when they found the normal pressure hydrocephalus, or found results they thought were consistent with it. But as you can see in my note there actually were no cognitive complaints at that time.
Okay, so here's the next slide relating
Wanna say hi?
to the skiing
Tommy
incident
says hi.
on February 26th.
She brought me a delicious green smoothie
You
to
were
wake
here
me
for
up.
Dr.
They say
Eastfield's
hi.
testimony. We don't want to cover things that have been covered already.
you up.
Do you have any opinions that would be new, any new insight relating to this particular incident?
She woke me
Mr.
up.
Sanderson's
Sorry, I was falling
symptoms,
asleep.
the way it may have contributed to those?
I absolutely agree with everything that Dr.
you tell I was falling
Eastfeld
asleep,
said
babe?
about
Thank you.
this. I had also read a little bit more about his claim of amnesia, of not recalling what happened before and not having formed those memories of what happened before. It was actually much later that he started telling stories of what he recalled. But that was not there initially. He said he did not know what happened that led to that accident. And then, of course, she had also mentioned, we talk about the oxycodone. He started drinking more. He was in pain, and his blood pressure was unstable right afterwards. So those are all things that occurred immediately afterwards as well.
You mentioned the telling of this accident story, and I'm wondering if you might comment on the term confabulation, whether it's connected. It has come up in prior testimony. Is that something that you know about?
So confabulation is a bit different. In a technical term in neuropsychology, we talk about confabulation as people making things up to fill in gaps. You often see it in dementia or, other type of neurological disorders where they can't remember it. It doesn't seem to be a real confabulation. I don't know if there really was amnesia or he really did recall things. But I'm not going to opine because there's no real source of him to confabulate. That's not something you'd see associated with a concussion.
I see. Are there any other maybe related notable patterns that you see in Mr. Sanderson? For example, maybe embellishment?
Yes, so he's very interesting because sometimes he embellishes his medical issues and sometimes he completely denies them or minimizes them. They're very extreme.
He admitted this.
The one issue that really comes to mind is when he cut his calf with a box opener. He was opening a box and he ended up cutting his calf and he needed stitches for it. And he went to the ER and he got stitches. He had some concern in the week that followed that he had maybe deep vein thrombosis or compartment syndrome. He went back to the ER. They said, no, you're fine. 5 years later, he tells his doctor that when he cut himself, he cut his femoral artery and almost bled to death. And that he's been having symptoms since that time, even though this is the very first time in 5 years he's ever mentioned it to his doctor he's been seeing over the course of 5 years.
So what does that tell you about...
This goes far beyond Dr. Fong. We just sought at the bench. Just duplicative testimony.
Sounds to me, dude likes to exaggerate.
Overruled.
So what does an episode or a trait like that tell you about Mr. Sanderson's symptoms after the accident? Does it give you any insight as to what's going on?
Well, I think he himself best explained it when he said that he has changed his report of things based on the attention he wants to get at the time.
I see.
Yep.
Okay, let's go to the next slide. This is, I guess I haven't been really saying these for the record. This is 105F, in case that's helpful. So again, Dr. Eastfold had talked about the concussion, but Dr. Fong also talks about the concussion, and you're aware of her testimony about it, correct?
Yes.
And is there anything that we haven't discussed already that you'd like to add in responding to Dr. Fong's opinion about that, the relating the post-accident symptoms to a concussion?
So the organization, the leading organization of clinical neuropsychology in the country is the American Academy of Clinical Neuropsychology. And in 2017, they published meta-analysis of research, meaning they looked at a lot of research out there about post-concussion syndrome. And what they found was that symptoms associated with post-concussion syndrome are actually more frequently reported in individuals with mental health diagnoses who've never even had a traumatic brain injury than someone who's had a mild traumatic brain injury with no other conditions. So I think it's important to realize that they're saying that once you hit 3 months, you really cannot use the symptoms that are reported to diagnose post-concussion syndrome. You really have to show the pathway from the concussion to those complaints.
And did you see any indication that Dr. Fong was aware of the study that you just mentioned?
I mean, this was a compilation of many, many studies with thousands of actual individuals associated with that study. I don't believe so. I didn't see her mention it whatsoever, that she seemed to be aware that they had published it was the leading authority in clinical neuropsychology had published this information.
Judge, we object to this. This violates your order on disclosure of medical literature is going to be used. We never received this.
Has this been disclosed?
This particular study?
Right.
I believe it's mentioned in Dr. Askenazi's report.
Okay. Overruled?
And they really are wasting time.
Did you note that, staying with concussions for just a second, did you note that Dr. Fong offered testimony that studies are actually showing that there are increasing numbers of people that have persistent post-concussion symptoms?
Again, that's still considered research because it's hard for us to distinguish this constellation of symptoms from other conditions. So whether or not it's really due to the brain, whether it's due to mental health factors, whether or not there's something else going on, it's hard to know. I am familiar with some research that has looked into it, and they haven't controlled for things like how many concussions has the person had in what time frame.
I see. And what would be the problem with your results if you didn't control for that kind of a thing?
So we know that if someone suffers a second concussion when they're still actively symptomatic from the first one, it will have an additive effect. It will actually make things worse, the symptoms worse, and the recovery longer.
I see. And let's go to the next slide here. This one you titled Complicating Factors, and you discuss, there's various things here, but I want to focus on the increased blood pressure. I don't know that that's been discussed very much. What's notable about the increase of blood pressure in your mind?
So a few days after the accident, and he was prescribed the oxycodone the second day, he contacts his doctor and he says, my blood pressure is really high. I believe he had assessed it at home at something like 196/104, which is exceptionally high and could be really contributing to symptoms. He followed up with her the next day, then he went in and saw her the next week. And it's important because it can be contributing to the symptoms of feeling foggy or unwell or not like yourself, that's pretty high blood pressure.
So, was that blood pressure contributing to symptoms Mr. Sanderson believed were connected to the concussion in your mind?
It appeared so, yes.
Okay, so let's go to the next slide. Uh-oh. It's not letting me undo this. It's kind of going slow here, so let me reset it. Okay, so the next slide is early cognitive assessments. I believe Dr. Eastfold covered these in her testimony. Is that correct?
Yes, that is correct.
So I think we can move on from those, unless you have anything to add that she didn't cover.
No.
Okay, and then this 2017 cognitive complaints, I believe this also covers things that Dr. Eastfold covered. Is that correct?
It did, but she didn't cover the interim. So in the medical records, between that August 2016 and through that early April 2017, again, he has not complaining exceptionally about mental health symptoms or cognitive symptoms. And the last time he sees his regular doctor is February 13th in 2017. There aren't complaints then. It was only when his friend dies from Alzheimer's disease that he starts worrying that he is experiencing cognitive decline.
So I think in the interest of time, we're on 105J. I apologize, just we don't have very much time, so I'm trying to figure out what to focus on here. I think most of this was covered by Dr. Eastfold.
Could you actually go back to that last one?
Sure. The cognitive effects,
Yes.
I didn't mean to skip that. Obviously, this is Dr. Fong's Cognitive FX is Dr. Fong's clinic. Is that correct?
Yes, that is.
And let's see. How would you characterize what her clinic does?
So what they do is, and this is her words, they do a boot camp to rehabilitate people from mild traumatic brain injuries, whether it's weeks, months, years, or decades after the fact.
I see. And what are the criticisms you have of their approach? And let's not talk about the imaging because that hasn't been addressed.
So the thing is, what is offered there is not unusual in terms of rehabilitation for traumatic brain injuries. But moderate to severe traumatic brain injuries, none of these treatments have really been established in mild traumatic brain injury. And that's fine if they're using this for research to try to establish that. The thing is specifically in Mr. Sanderson's case, he was cognitively assessed over and over again, at least once per day during the time he was there. They assess in the morning and sometimes also in the afternoon, give them tasks of attention, have them read stuff, see if they comprehend it, see if he has memory for it later that day or the next day. Every one of his cognitive assessments at Cognitive FX showed that he was cognitively intact.
Let's move to this slide that talks about a head injury. Do you recall Dr. Fong reporting that Mr. Sanderson had told her about a head injury he had experienced because he was dehydrated and fell down? Do you remember that?
So yes, but this didn't occur during his intake for Cognitive FX because it happened afterwards. I believe it was for her deposition that it was mentioned.
Right, and what's significant, if anything, about that injury in your mind?
Okay. So according to Mr. Sanderson, he arrived home one day dehydrated, passed out, hit his head, and he believed he was unconscious for at least 45 minutes. And then he awoke with a bump on his head. As he described, he thought this event could have killed him, and he couldn't believe that he didn't call emergency services for it. Now, whether or not this is an embellishment of what really happened or not, I don't know, because he actually didn't seek treatment for this event. But what I do know is by his own description, this is a much more significant event than anything that happened in 2016.
And did you note whether he reported this particular event to other providers, aside from Dr. Fong?
No, I did not see it in my original review of VA records.
There's been some talk about Mr. Sanderson's heart and heart conditions. Do you know anything about his heart conditions?
I know a bit. I know he has a history of heart palpitations. And
are those related to your opinions in any way?
It's not related to the opinions about his medical condition, but it's important to know his sort of decision-making strategies associated with it, because after Dr. Goldstein recommended he either try a psychostimulant for attention problems or something for early onset or early signs of dementia, he chose to go the psychostimulant route, and he asked to get on a medicine like Adderall or Concerta. And both his cardiologist and psychiatrist told him he should not, given his heart conditions. And he researched and he communicated with him all the reasons why he thought should be taking this, and even the specific medication he thought he should or should not be taking. And he eventually did go on the medication, assuming full risk, because both of his doctors had told him they did not agree with that.
So does do those events tell you anything about Mr. Sanderson's post-accident symptoms, the things he's connected back to the accident?
Legal team should just be like...
I don't know if it's connected back to the accident, but again, it shows sort of this pattern of how he approaches his medical conditions and how he deals with them.
And how is that?
It can be extreme at times. I mean, sometimes he overreports it, sometimes he denies it. We know before his accident, he delayed getting treatment for potential cancer for years. He got referred over and over and over again to have follow-up, and he didn't because he didn't want to deal with it.
I see. And you've talked about Dr. Fong receiving a self-report from Mr. Sanderson. Do you have any opinions about whether Mr. Sanderson has a pattern of being an unreliable reporter of his own medical condition?
So my concern is he's reporting symptoms to her in a way that it made it sound like it had continued through time. But he had complained once about gait difficulty. He was assessed, and it was normal. He had complained about attention and memory, but it was tested, and it was normal. And he wasn't providing the full picture of these symptoms he was complaining about and the time frame and the test results associated with these complaints already having been evaluated.
Let's go, just because we got very little time here. This is your last slide, I believe, your conclusions. And maybe we can just use this as a moment to sum up and make sure the jury understands your opinion. Do you believe that Mr. Sanderson has any permanent symptoms relating back to his ski accident in 2016?
No, by the end of July 2016, his records from his treatment providers are quite clean in that regard.
And do you believe he had a concussion?
It's questionable. There's been a lot of question regarding concussion, regarding loss of consciousness, regarding if there was real amnesia. Was his disorientation just a brief what happened, or was it real disorientation? But I prefer giving it to him, saying that, this event did cause a mild concussion, but we know almost immediately there's no more symptoms of it.
All right. Maybe my last question for now is whether you believe it's unprofessional for you to render opinions about Mr. Sanderson having not met with him and evaluated him personally?
Okay. So anyone that engages in a psychological evaluation for forensic purposes, meaning for legal purposes, we are guided by the Forensic Psychology Specialty Guidelines. So whereas the American Psychological Association oversees clinical work, the Forensic Psychology Guidelines oversees legal work. And whether or not you're boarded in forensic psychology, you're supposed to be abiding by those guidelines. And they very specifically talk about knowing that sometimes it may not be necessary to do an in-person evaluation. You may not have access to them. I've had cases where I've had to recreate mental status for someone who's passed away and change their will at the end of their life. Sometimes you just don't have that access. And they are very specific in saying that if there are any limitations to your opinions, especially due to if you don't see them in person, that you identify those. But I felt very comfortable in giving the opinions because I had all the records from the time and for at least 5 years afterwards.
Dr. Fong noted that Mr. Sanderson complained of cognitive issues after the concussion, correct?
Yes.
And what is your response to her conclusions about those cognitive assessments or cognitive issues?
Well, in the records, he does complain about being foggy and having trouble paying attention. And that's why he asked to get evaluated and why he was sent to a speech therapist for that evaluation in March and April 2016. So he was taken seriously at that time with those complaints. But as we know, that testing was clean, and even the speech therapist told him that there's a big difference between motivation and memory.
Did you see that executive function table that we showed Dr. Eastfold?
What was her name again?
And
Sorry.
Did you have anything to add to what she said about it?
No, I think she was very thorough in describing there's a big difference between self-report and what is objectively assessed.
Okay, thank you. That's all the questions I have for now.
Thank you.
I realize they put
Mr.
it in
Egan.
the header.
Let's keep going.
I'll just keep it blank.
How are we doing, everybody? I am so... We have 3,500 people in here. That is amazing. Thank you guys so much for being here. If you have not done so already, please hit that like button. It really does help out the channel. It's something really easy that helps get the word out that we're doing this, and we would really appreciate your support on that. Oh, please do not tell me that Simple Country Lawyer is doing this.
Oh, the Simple Country Lawyer is certainly doing this.
I noticed in your...
He is armed.
No,
with his KFC
no,
bucket.
no!
I'm just a simple country lawyer. That's, at least as far as I could tell, all of your experiences with criminal cases.
Oh gosh, no. Those were notable cases that I've testified on. About 75 to 80% of my forensic work is civil.
Okay. So, with respect to this case, you're telling the jury that, I mean, you knew this was going to be a big, important case, didn't you?
Yes.
All right. And did you ever request to do a personal evaluation?
So we discussed this possibility because I was originally asked to do a records review. And I let them know that if after reviewing the records I felt a need to see him in person in order to render any opinions regarding the questions that were being asked, that I would very specifically request it.
Isn't it generally for someone like yourself, a professional, independent professional, isn't it better to have a clinical interview and do testing yourself?
In a case like this, when you're talking about an incident that's more than 5 years old, no, because the longer you get away from an incident, the more distorted the memories get for that incident.
Okay. Because at 7 years old, you didn't think you needed to do an evaluation and actually have a clinical meeting with him.
So I was actually
7 years
concerned if he
old.
was starting to develop dementia based on his complaints. But
What's the
again,
question?
I'm seeing testing in 2020
Give me a second.
and even scans in 2021. Dr. Bohm did a mental status examination. All of it showed intact cognitive functioning. So if I was concerned that he had a newer onset dementia or cognitive difficulties, I would have requested it.
So, in this case, you're saying no exam, but no harm, no foul. Is that basically it?
Yes, because we're specifically talking about an acute mild traumatic brain injury years ago and the time after that.
Okay, now,
She called it acute, and she called
I
it
think
mild
the only
brain
expert we
injury.
had from the defense.
It technically was
I do
acute.
apologize,
Acute
this
could still be
call has been
bad,
bothering me for
but
a while.
mild, yeah. If healed
The
within
only
a few
expert
months.
we had for the defense.
But acute is
prepared an actual
something
report.
that is,
Okay.
generally
it's about-
speaking, a one-off. It's acute. It's a one-off
See
thing.
there.
Yeah, it's
If it's
Without
something that's
Vita,
more prolonged
it's 54
or
pages
something
single
that's
spaced.
repetitive,
Yes, that's
it's
sort of
then,
like a
generally
moderate
speaking, turns
range
into
for me.
chronic.
I sometimes write reports
So for her
well
to use
up to
the
and
term
over 100
acute rather
pages,
than
depending
chronic,
on how many years of
and then
records or other
boost it with
expert reports
mild.
that I might review.
Ooh.
I did a word search
Ooh.
and looked for the words executive
Coming
function.
in with the medical facts,
Executive
people.
function. The only reference I found to it was where you're simply reporting a test someone else gave. Is that a fair statement?
Yes, because there's no report in his medical records that he was having executive functioning difficulties.
Did you read the report of Sam Goldstein?
Yes, I
Did
did.
you read Alina Fong?
Well, she didn't really do a report. You mean the pre and post, like assessments?
Simple yes or no. Did you read a report from her?
That's what I'm saying. I'm not sure what you're saying when you say report, because I don't believe she wrote a report.
Did you watch the testimony of either Dr. Fong or Dr. Goldstein?
Yes, I saw Dr. Fong's.
Did you see her testimony about executive functioning? It's one of the main problems that Terry has.
That's the main problems he self-reports, but again, every single assessment while he was there showed he was intact. There was nothing in his actual medical records documenting executive dysfunction other than a self-report.
But if you come to Utah to testify in a big case, and you know that's going to happen, right? Isn't it, from a professional standpoint, lacking in responsibility not to address his biggest problem? His biggest problem. Executive function. You didn't even mention it in the 54-page report.
That's
Correct?
because in all the records I reviewed, that was not listed as his problem.
Okay. Did you read the depositions of Carlene Davidson and
Oh my God.
Shay Hareth and Polly Gresham?
Not of his girlfriend,
Doesn't matter, she's still
but of the
thanking you,
daughters.
kid.
Didn't read his girlfriend's deposition?
No, I did not.
Do you know that she was with him for a year and a half before the ski crash and 6 months after?
That sounds like a long time beforehand. That doesn't sound quite right, but I'll take whatever you give me.
That's what she testified to, both in deposition and in trial.
I don't know the specific length of their
Okay.
relationship.
Now, do you think a person like that might be able to tell you a lot about executive functioning?
A layperson? No, I trust the experts a lot more in that regard.
Oh, okay. So you don't look at before and after witnesses then?
If I had actually seen before and after reports of anyone who knew him, I of course would have looked at that. I never saw that.
You didn't think that her testimony by deposition was important enough to read it, did you?
It has nothing to do with important or not. I wasn't provided it, and I specifically asked for all the objective data that there was, including all the medical records. When you talk about depositions of family members, you get into a very murky area because they oftentimes have a vested interest in the outcome.
So the defense did not provide you the deposition of Carlene Davidson?
I wasn't provided any depositions until last week after the trial actually started.
The defense didn't provide you the deposition of Polly Gresham.
That's correct.
The defense didn't provide you the deposition of Shay Harith.
Yes, that's correct.
Okay. Do you understand that each of those three women, 2 daughters and a girlfriend, a longtime girlfriend that was hoping to marry him, okay, said that there was a sudden and dramatic change in his condition beginning with a ski crash? Are you aware of that?
Yes, as I told you, I did read them last week, and the main issue is if you look at one of them, they said it was immediate and he recovered from his slowness. There's a lot of contradictory things between the depositions and the actual trial. So I did review them, but again, you can't give the same weight to a family self-report to symptoms when you're talking about reviewing 20 years of medical records that literally documents objective information from before to after.
Okay. It's a very short question I answered, and you gave me a very long answer. Let me try again, okay? I'm just a simple country lawyer. I'm not very smart, okay? But I can't read. Now, do you
Doesn't
think
work when you keep saying it over and over again, buddy?
that the depositions
Do you
of
know
3
what?
people who know
that
him
must
very well
backfire for him when it comes to jury.
could give you insight on what his
Trying to play
condition
dumb.
was before and after the ski crash?
I don't think it provides
hear it over
much
and over again, it
objective
becomes so much less
information,
effective.
but it provides personal
But it's not
context.
just that. What I'm trying to say is, for the jury,
Hey, are you aware that
him
Dr.
saying that
Fong
over and over, the jury
has
then
treated
has this
thousands and thousands
conception
and thousands
that
of people
Terry's
with
side is dumb.
traumatic brain injury? You aware of that?
They
her
don't know what they're
businesses,
talking
yes.
about.
Okay.
They are.
Are you aware that
Well,
Dr.
they
Goldstein
are, but
has written
they're not supposed to show
dozens
that
of
to the
books,
jury.
and book
Like, I
chapters,
mean, come on.
and authored
It's
many
not jury
tests,
concern. They're supposed
including
to look like
one
the
on
best
executive
looking
function? Are you aware of that?
lawyer group.
Yes, but I don't
legal
refer to that
group
as a test.
in the
When it's
courtroom.
self-report, it's referred to as a scale, and that's how he refers to it.
Okay. Are you aware that he developed that?
Hi, Lacey, by
Yes,
the
I am.
Are you
way.
aware that he testified here in open court that it's
She's
in
looking
use
at me.
worldwide?
No,
need a
I'm not.
puppy
I did
break.
not see his testimony.
Were you
Yes,
aware
please,
that
puppy
Dr.
break.
Fong
Okay.
treats
Let me
about
know if I missed
40%, I
anything.
think, of her patients
Yes.
that come from other countries?
Lacey,
No, I don't know that.
You know, she was last week. She was in Holland, Netherlands, giving a lecture on what she does. Were you aware of that?
No.
Okay, let me ask you if you made an effort to tell the whole story in your report.
I tried to tell the story as completely as I could, as you said. My first report was 56 pages long. That was a
Now,
summary of
all
all the
we need to
materials that had been
do,
given at
okay,
that time.
is set her up with some rave gear, right? Like some glow lights and little mini doggy
objection?
sunglasses. I'm sure there's some
Object
you
as to
can
hearsay.
buy and like put her in a nice little
There's an objection as to
trilby.
hearsay that be
get
sustained.
to rave, like yeah.
The
She'd be a
report is
proper
hearsay.
cool little rave, I'm telling you.
Witnesses here to testify about it.
Can we
She
admit
ain't
it?
impressed.
No.
Nah.
She's here to testify about it, so surely I can
You
cross
will
examine
be Lacey, okay?
She's like, no, I look
Sure,
the other
you
way.
can do that. You can do that without showing it to her.
Don't worry about
Fair
it.
enough. Showing it to the jury
It
anyway.
might sound really bad, but then
This
when
is
you
why I show you your own report. So let me read it to you.
Your Honor, admit it as a
Oh,
Reports
what's
are
even
never
going on
admissible.
about?
We have a
There's
bunch
a
we could
simple
admit
country
to, but
lawyer
I
and
think
it's
it
a
would bore the
dumbass.
jury to read
All
it.
right.
So,
Go ahead and ask your question.
turn in your. You had your report handy?
No, if you want to give me a copy.
You have a copy she can use? First one, yeah. Let's take a look at it, page 23. Now, Your Honor, I can show her an admitted exhibit, right? Sure.
For the record, which exhibit are you looking
This is 28, 27, excuse me, 27.
Plaintiff's 27?
Yep.
Okay.
It is. Let's take a look here. Now, going to take my trusty red pencil made by Pentax, and I'm going to
made by
put a
what?
little bracket out here so you can follow along. Now, this is, by the way,
It's so blurry.
an evaluation done at the VA on June 1, 2017. Okay.
I'm chewing on a dart because I'm bored.
All right. Now, on your report, page 23, did you say the following? Although he did not meet...
I'm sorry, could you tell me
page
where?
20, page 23.
Okay, where?
Second paragraph down.
Okay, thank you.
Although he did not meet the full criteria for major depressive disorder, he did not have some features and symptoms of depression. It was noted he, open quote, does not meet criteria for any type of cognitive impairment. Period, close quote. Is that what you wrote?
Yes.
Okay. Let's look at the actual record.
Yes.
Counsel, you didn't read it quite right. You inserted the word "not" in the first sentence.
Excuse me.
After the first.
It was noted he does not meet criteria. That one?
No. You said he did not have some features and symptoms of depression.
Okay, I'm sorry. Let me start over. Thanks for catching that.
I just want to correct you.
Yeah.
Also,
Although he did not.
all the markings are yours, Bob. Is that right?
Yes. Although he did not meet full criteria for major depressive disorder, he did have some features and symptoms of depression. Okay? It was noted he, open quote, does not meet criteria for any type of cognitive impairment, period, close quote.
Yes, correct.
Is that what you wrote?
Yes.
And then the next sentence says, ibuprofen was increased to 300 milligrams a day. So that's the next sentence, right?
Yes.
All right. However, the actual record you were quoting from says what you wrote is he does not meet criteria for any type of cognitive impairment at this time. There's a comma there. However, as patient clearly a high-functioning individual, I think is missing, at baseline, this may be masking, compensating for any deficits. Now, you left that out, didn't you?
Well, yes, that portion
No, I
doesn't
didn't ask
make
you
any
why.
sense to me.
I just said, did you leave that out?
Yes, I don't write word for word everything in the record in my report.
And the language that you left out, however, as patient is clearly a, I think means is, high-functioning individual at baseline, this may be masking, compensating for any deficits. That language that you left out, intentionally, that language says, does it not, that the fact that he is a high baseline, high-functioning individual is going to mask his cognitive deficits. And you left that out, didn't you?
Yes, because that didn't make sense to me, and I can explain that.
No further questions. Thank you.
Clark Kent, ask, why didn't it make sense to you?
My first question will be, will you explain that?
Okay. So first of all, you can't, what we say in neuropsychology, you can't fake good. Unless someone's given you the tests and you're cheating, you can't perform higher than you can on any sort of test. And when he was tested by Dr. Madsen, he was performing at a high level of abilities, average to above average functioning. That's exactly what you would expect with someone who was a B student all of their lives, went to optometry school, was basically a high-functioning, high-average person their entire life. His testing was 100% consistent with his test results, so I didn't understand what it would mean that he could be masking deficits because he wasn't showing deficits, and you can't fake good.
Did you watch any testimony of Mr. Sanderson's daughters during this trial?
Yes, I did.
And did watching their testimony change any of your opinions?
Not from a clinical sense. I'm not going to address any of the family issues, but it's clear that the daughters who testified in court were not very knowledgeable about their father's mental health history.
I'm going to just put up on the screen here again. I believe this is your last slide, 105V, and ask you whether any questioning from plaintiff's counsel has changed your opinion that Mr. Sanderson has no permanent psychological or cognitive issues due to the February 26, 2016 incident, and he is never tested as being cognitively impaired, and his brief emotional exacerbation abated as of July 2016.
My opinion remains the same.
That's all. Thank you.
Thank you. Mr. Sykes?
No questions.
All right. You may step down. Thank you.
Your Honor.
We will take our final recess.
Wow.
Short recess.
Yes, I do want, before the jury comes in, I wanted to talk about time remaining. And I can do that now or in 5 minutes.
Why don't we do it in 5 minutes to give me a chance to look at what we have?
Thank you.
How about 10 minutes so we can take care of business?
Let's come back in 5 and then the jury will come back in 10.
Wow, guys. How are you both doing?
Dude's losing. Dude's lost. Dude has to just be like, yeah, I'm done. Like that witness there, that expert, I'm really rubbish with names. She was basically like, nah, dude literally has a history of over exaggeration of his symptoms. Yeah, did not want that in the court being said. And we all suspected it anyway, that he was over exaggerating and, you know,
yeah,
and all that malarkey. But to actually hear it from an expert's gob,
brutal.
Yeah,
Absolutely brutal.
yeah, he ain't getting that 300k. No way. Nah. Gwynny's winning.
I think too, it's just that
Andy, oh, sorry, no, he's on the phone.
Yeah,
Sorry,
he'll be back in a second. No, I think for me, it's the like, I just made notes of this because I was kind of like, do we need to get clips of it to talk about the recap tonight? But I'm going like this, if I get clips of all of this, it's going to be too long. And it's just basically the idea that he has avoided cancer treatment. He's taken medications that his doctors told him not to take. He's stopped taking medications. He's lied to his doctors. He went skiing after told not to go skiing. I give up. You know? And so much of that was before. It's like I honestly get the feeling that he wants to do things his way and only his way. And no one can tell him anything different. And then his body started to break down. And he didn't want to accept it. He didn't want to deal with it. He just ran from it. And then this incident got him to a place where he couldn't run anymore. And instead of taking accountability and accepting that his health was declining, it was all Gwyneth's fault.
Do I believe that he really thinks it's Gwynny's fault? No. I really don't. This may be a controversial opinion, but no. I think it's part of his element to, in my opinion, conspiracy theory, whatever, over-exaggerate.
Mm-hmm.
And he's over-exaggerating to such an extreme, like this expert says, over-exaggerating to an extreme, that he is lumping in a big-time A-list Oscar-winning celebrity by saying all these over-exaggerated extreme symptoms that he is now having is because of this A-list Oscar-winning celebrity.
Yeah.
Him blaming Gwyneth, in my opinion, conspiracy theory, whatever, is all part and parcel of this over-exaggeration of his symptoms, all for one aim. Again, opinion, conspiracy theory, whatever, which is ka-ching, 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 ka-ching. I really think, hand on heart, he is blaming Gwyneth for the payday rather than actually believing that Gwyneth actually caused the accident and all of his symptoms.
I don't disagree.
I think he is, again, opinion, conspiracy theory, whatever, that vindictive. Because he is, as we all know, as it's been said in the trial, he's been suffering from mental health issues to the point where he doesn't have, let's say, too much of a great relationship with certain members of family, with certain daughters, this, that, and the other, right? Why? Now, if you're a nice person, you're going to have nice relationships, right? But if you're not so much of a nice person, then you're not going to have not so much nice relationships. So, yeah.
I kind of feel like, too, if I can just be completely honest, one of the things that I'm seeing when we talk about Jenny is just that it was such a messed up it was such a messed up relationship, judging from what we're hearing. And I kind of speculated potentially that this could be a scapegoat situation where the whole family kind of goes, oh, well, this person's different. They're not the same. So the family issues are related to the scapegoat. And it seems that she has removed herself from the family dynamic, which is part of why she's not here. All of a sudden, she can't be blamed for things maybe anymore. I don't know. So he found somebody else. And it was perfect because it was cool to him. It was cool that he hit a celebrity, that he got the attention. It's so
well, he made
twisted.
that comment, didn't he?
Yeah, he did. And that's the thing. Like, I feel like I know it's a horrible thing to say, and I feel bad. And purely it is speculation. I am not an expert, nor do I know these people in real life. But it's just like, it just looks weird. It all looks weird. Yeah.
Yeah. I'm not sorry saying it out loud, though. I think dude's trying to milk it.
100%.
Opinion, conspiracy theory, whatever. I think he's trying to milk it.
I think it's very likely.
Again, the expert said over-exaggeration of symptoms. And he'd only over-exaggerate years after the initial acute mild diagnosis. Oh, well, what did you think? Okay.
I think my favorite thing is the lack of evidence of being unconscious.
Yeah.
No one's been able to prove that he was actually unconscious. That the damage sustained was enough for that.
No. And the time as to when he was allegedly unconscious, well, there's contradictions in that. Couple of seconds, couple of minutes, a few minutes. Like, there's different testimony as to allegedly how long he was actually unconscious for in the first place. But let's just remove that. Even if, right, you could prove, yeah, he was unconscious, even for literally a freaking nanosecond, right? Okay, fine. But the main burden of proof, as far as I'm concerned, when it comes to Terry's side and the country lawyer, is, okay, well, what empirical proof do you have that categorically indicates that Gwyneth Paltrow went into him, and that by going into him, it literally caused or exacerbated his symptoms thereafter. They've not been able to set that link and prove that link. They've been dancing around it and trying to freaking discredit witnesses on how much have you been paid to be here. Well, of course they're going to be paid to be there. You've taken them away from their day job where they get paid. Like, of course they're going to be compensated for you taking them away from their normal job to be in there. Wouldn't you? If you were called in as an expert witness in some kind of law case? Like, come on.
Yeah.
Let's call a spade here.
Because you have to be an expert in order to be called to be an expert witness, which means you likely have the credentials which cost, and therefore it costs to get it. Period.
Welcome to capitalism, folks.
Yeah.
Like, what the deuce? But no, let's not focus on proving the premise that A, Gwyneth Paltrow went into Terry, and B, as a result, it exacerbated his symptoms. Direct result. Oh, no. Let's just discredit the witnesses by saying, well, you've been paid to be here, haven't you? The frick?
Yeah.
And the ironic thing and the contradictory thing about that is that these country lawyers, simple country lawyers, right, use their own experts.
Yep.
To try and prove their case. Well, how much have they paid those experts, right? Goes both ways. I swear, if this jury turns round and rules in favour of Terry, I will lose my shit. I really, really will. Like, yeah. Nah.
Yeah.
No.
Well, I think too, like, you nailed it there. Just this is capitalism. It's like, I have to love that lawyers who we know are paid quite handsomely for the work that they do. It's a career that is associated with wealth and status and intelligence and being successful, you know? That someone who is paid handsomely, believes in education, does all these things, has to go through massive amounts of education to get to that point, will then turn around and talk to somebody else who's gone through massive amounts of education to have or to have a career that would be successful, and then be like, but you're paid for this.
You may be seated.
It's like, bro, mirror.
Would it be possible
you know?
to let us take our coats off again? I mean,
Sure.
I'm the only one, but...
Yes, you may. So did you get the printout here?
Yes.
Okay. So if we assume that there's 3 hours and 45 minutes of jury time left, that's 2:45 for tomorrow and 1 for today. So that's 3 hours and 45 minutes. If we assume that, then by my computation, the plaintiff gets 2 hours and 23 minutes, which includes your closing, and the defendant gets 121. Did we agree on 1 hour for closings?
I need an hour and 10. 10 on rebuttal.
So 1 hour and then plus 10 minutes. So 110 for defendants as well?
No, 1 hour for defendants. Your Honor, I think some of these delays on evidentiary matters which were overruled should be attributable to the plaintiff and not to us. You took one matter under advisement. We're working as hard as we can.
Well, there were 14 minutes of delays with the last witness that I'll charge to the plaintiff.
Whoa.
Can I add that to my time then, 1:35?
We may have to ask the jury to come early then tomorrow in order to stay on that schedule. But
and can I tell you
Then
what
I'll
I
come in
envision,
early?
Your Honor?
What's fair's fair?
We all want it to be over.
Protection, Judge. Shouldn't be tangled that.
I thought they were already calculated in the numbers.
no.
Okay.
So it's a total. So the defendant has 135 and the defendant has 223 remaining.
Thank you, Your Honor. And I intend to use 30 minutes now and reserve 105. The 1 hour is for our closing. The 5 minutes is for if they're calling a rebuttal witness tomorrow morning. We do intend to rest today.
I would like to know if they're calling a rebuttal witness tomorrow.
Yes, we are. 9 a.m.
Is it
We have a motion for a directed verdict also.
is it one witness?
Is it just one?
Maybe two.
Well, let's not play games.
We're not playing games, Steve.
It's tomorrow morning.
There's for sure one witness.
All right.
Who is it?
So you're dividing your closing between the two of you, liability and damages?
I'm going to take 45 minutes, and Mr. Egan's going to take 15 minutes.
Okay. And have you decided how you're going to split your closings?
Not yet.
Okay.
Mr. Bueller will be involved.
Okay.
Yeah, definitely don't play
And I don't have any problem
one,
with
maybe
going
two.
an
No, be
hour on
definite.
their,
Hello?
on their
Do the
main
one witness,
argument
two
and then
witness.
10 minutes for rebuttal. Do you?
So the reason I want to know what their rebuttal plan is for tomorrow morning so that I can decide how long to take with this very witness. So this idea, one, maybe two. One.
Why don't we get the jury in here and then we can have this conversation at the end after that?
No, his whole
Well,
point
it's
was
about, do I
right
take
now.
30 or 35 minutes with him right now? That's why I want to know.
This judge is the worst.
So we really only
He
have
is the
probably
worst.
another 45 minutes of trial today, right? Because there's
Depending how long
not, there's
their
not another
process-
witness if you rest.
That's true. I want to make sure our exhibits are in. I also have a court TV objection to make, Your Honor.
Well, why don't we deal with that at the end of the day, unless it needs to be done right now?
It does.
All right.
Oh wow.
We've had two
No, to be
decorum
fair,
order
I'm glad that this
violations.
lawyer right now
I'm
is just
reporting
kicking
a
ass and being
third
like,
right
no,
now.
I'm going to be very, very assertive now. Yeah, brilliant.
Media?
Yes.
No, wait. The two previous ones, by that media or by the AP reporter?
Sometimes it's hard for me to tell, Your Honor.
If it's a still photographer, it's not court TV.
No. My client, I've had this on two reports, two individual reports. There is a direct camera on my client's face in the last, for the last bit of testimony. I wasn't speaking, and it was just focused on her. Direct violation of how the court has interpreted the decorum order.
This is so dumb.
Do you have a picture of that?
Reports of close-ups of Gwyneth Paltrow on court TV today when she's not speaking and I'm not speaking. Do we have actual documents of it?
Photos? No, not that. I don't.
Try to get them, would you?
Is this really worth the time?
Well,
You're talking about you're out
Okay,
of
so
time, and
that's
now we're.
noted, and I'm going to ask Court TV to, if they need any clarification on the decorum order, to ask for it, but otherwise, they should only be going on the lectern and on the witness, unless an objection is made at counsel table, and then they can show counsel table.
Thank you.
Judge, we've had, I don't know, 8 or 10 objections about the decorum order. I think you ought to charge all of that to them. We've had not one on our side. And Mr. Bueller is very famous, and so I think that, you know.
My cousin's Ferris.
So, I'm
Oh,
sure
get
a
bored.
lot of these decorum things.
And none of them have been charged to either side, because they have been out of the hearing of the jury that we've dealt with those issues. So it's,
Yeah.
you're being charged for jury time.
Okay.
Yeah, get boned. That's
So we'll
nasty.
take the last
what you
witness
just tried.
right now, and you're going to take
Very
about 30
nasty.
minutes.
F
correct?
this dude.
Is that right?
Yes.
And then
Something hard
then
and
we'll-
sandpapery.
Your Honor, I don't expect taking 30 minutes
Oh, cactus
on
list with
our
chili
side,
oil.
but what I'd like to do is, I mean, obviously I don't want to be charged with that because we need to use that for tomorrow morning, but we can use time for defense to enter in their exhibits, all of the motions outside of the jury, et cetera.
Okay, well, let's get the jury in
Can
here
I-
now, and then we'll deal with whatever issues that we have.
Can I predict one more thing? We're going to start showing exhibits from Defense Exhibit 111.
Why don't you get the jury lined up?
Defense Exhibit 111, starting at page 47. I don't want objections on foundation of these. I went through every single one of them on his deposition. He recognized it. He didn't dispute the date. And if I'm being charged for times. I don't want objections as to foundation on any of those documents.
Page 47?
Correct.
Damn right.
And
Lay
going
down
on
there.
for about 30
Quite clearly,
pictures.
Judge A.
There's about 162 pages in Exhibit 111.
I'm gonna stop at 87. So 47 to 87.
So those 40 pages, any objection to receiving those?
1 through 80, what was it?
47 to 87.
47 to 87.
I mean, yeah.
And this was the subject of a motion in limine, I believe?
Yes, it was.
And I indicated that if there were objections that were made that were valid, then they're valid. But if they're not valid, they'd be charged. The time would be charged to the objecting party.
Your Honor, as long as we note that many of these, the counsel ascribed these documents to being produced by my client, and they're obviously not, because he's in the photo.
My question is just, do you have any objection to the court receiving them as an exhibit?
No, Your Honor.
Okay, so Defense Exhibit 111, pages 47 through 87 are received. Anything else before the jury walks in?
No, thank you.
Okay. Mr. Owens, you may proceed. Mr. Sanderson, you'll need to be sworn.
Do you swear that the testimony you are about to give in the case now before the court will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you.
Good afternoon, sir.
Oh, he's back on. He's back on.
Let's pay attention. This will be the interesting
Here we
part.
go.
Might just ignore everything else we just did.
Mr. Sanderson, we met before. We didn't finish, so we're trying to work our way in. I'm on a 30-minute clock, so I'm going to try to ask questions very directly and just have you say yes or no.
If I can, I will.
Did you, upon filing your lawsuit in a press conference, compare my client to King Kong coming out of the jungle? Yes or no?
That was not my intention.
Did you do that? Did I make up those words, or are those your words to the press?
I'm not sure, but probably sounds familiar.
Do you dispute it?
I dispute my intentions, that's all.
King Kong coming out of the jungle.
Press conference.
Pardon?
Press conference. I was pretty...
Did you say those words about my client?
I meant to say King Kong just chased someone out of the jungle. That's what I meant.
Did you refer to her as Godzilla to your daughter?
I did not. I don't remember that.
She testified to that.
I don't remember that. It's gone. Sorry.
Don't remember, so.
You told everyone it was a hit and run, right? Wrote to your own hometown newspaper and said, she hit and ran me.
I did say that.
And that's been dismissed by this court. You understand that?
Yes, I guess so. Yes.
I want to talk, please bring that up. This is D110. And do you see it on your screen, sir? 104.
Yes. Page 400.
Can you maybe enlarge the first half? Post-incident travel by Dr. Sanderson. Mr. Sanderson. Did you go to Peru?
Yes.
After the collision. All of these are after the collision, okay?
Yes.
Visit Machu Picchu?
Costa Rica, yes.
Walk the Golden Trail?
Yes.
Machu Picchu is in Peru.
Yes.
Floated down the Amazon?
Yes, I guess so.
Costa Rica. Did you do a zip line?
Same trip, yes.
Did you go to Europe, visit Netherlands, Germany, Switzerland, Italy, France, Belgium?
With my daughter, Jenny, yes.
Bottom half, James, please. Did you go to the Netherlands 3 times?
I don't remember.
Well, if you're disputing it, then we pull it out of your deposition.
I don't remember. I have no reason to dispute it or agree.
Okay, Morocco twice. True?
Likely, very likely.
Canary Islands. I need to know if you're disputing these things.
I can't dispute it, no.
Thailand. Did you go to Thailand after the collision?
Yes.
Did you visit at least the states of Washington, Oregon, Montana, and Idaho after the collision?
Probably, yes.
Let's go to the 1:11:47. You're a Facebooker, right? At least you were at the time. You posted a lot on social media.
Relative to other people, it didn't seem like I did. Very little.
All of these pictures are from your personal Facebook after the collision.
Okay.
Let's go to number 47. And is there a way to enlarge it, James? Is this you doing a selfie in your backyard?
Beautiful sunset, probably so.
Page 48.
Oh my God, I can't stand
Having
this
a
guy.
party in your backyard?
No. That was somebody else's party. I just dropped it. It was my renter's party.
If you can straighten it up.
Cinco de Mayo. And she wanted to use the back deck.
And enlarge if you can. You went to a party in your backyard after the collision, true?
I just visited to make sure they had everything they needed.
Yes?
Yes.
Page 49, not very good quality. This is from you and your girlfriend at the time, smiling, true?
Yes, yes.
Next one, number 50. This is a picture of you and your girlfriend.
Yes.
And smiling big, right?
Smile, camera, yep.
Next one, 51. This is you and your girlfriend. Is that southern Utah hiking?
I don't remember where.
Looks like you have one of those cool backpacks with water on. Is that true?
Yes, that's true.
Next one, 52. This is you going on a hike, taking a picture of a moose, right?
Yes.
Nothing like fresh, cool air, a running brook, and easily entertained and hungry company. That's your personal post. Is that true?
Yes. Definitely.
53. This is another picture of you on a hike. True?
Yes, trying out my camera saying smile.
Every one of these pictures is after
Terry's
the collision.
probably,
Page 54.
regretting and not putting
This
his
is you
Facebook
and your
on private.
girlfriend at the time. Is that true?
Yes.
You look pretty happy. You agree?
Yes.
Page 55. This is you and your girlfriend. This is this very same year, 2016, as the incident in question. This is you and your girlfriend on your Facebook, all smiles. True?
Yes, true.
56. Let's look at another picture. You and your girlfriend on a hike, smiling. True?
Yes.
Do you have that cool backpack on again?
Yes.
Camelback. Is that the brand?
It is.
Page 57. Let's go again. Is this you, same year of the accident, hiking?
Yes.
That looks pretty steep.
Trying to get back in shape, yeah.
Page 58. Is this you kayaking after the collision? We're 7 months after the collision.
Absolutely not.
Is that a kayak above you?
I don't know what it is.
Sir, I asked you about this in your deposition. Is this you kayaking?
No, absolutely not.
Oh, boy.
I was trying on helmets to protect my head.
Did you go kayaking after the collision?
I don't remember that, but this is not it. This was in a local
It's a
store.
whole different question. Let's ignore the picture.
Thank you.
Did you kayak after the collision?
No, I don't think so.
All right, let's try to find it. You went scuba diving, right?
What year?
After, I don't even care what year. After the collision.
I did go sometime after, yeah.
You went to an auto show in Germany. Does this sound right?
With my daughter, yes.
Went to a shooting range. Does this sound right?
Yes.
BMX bike show, right?
Maybe, not sure.
Scuba diving 4 different occasions. Is that true?
Probably on the same week, on the same trip, probably.
Went on a boat ride, several canals in the Netherlands. True?
Yes.
You rode bikes?
Yes.
Did bus tours?
Yes.
Boat tours?
Yes.
Auto show we talked about. Explored older towns in Central Europe. True?
True. With my daughter, it was wonderful.
Morocco.
No matter who with you went, mate.
Is there a word called Marrakech?
Yeah, yes.
What is that again?
It's a city.
All right. You visited there twice?
I did. Zakia.
Explored Jewish markets there?
Yes.
Cultural sites. the Dior Museum. Is that cool?
Ooh, there you
Yes,
go,
I
Steph.
did.
You'd like that. The Dior
Hey, good
Sauvage.
Hang on. I got so much Dior back here. I liked to collect the Christmas
All right,
editions.
let's move on. The kayak. Is there a reason you're...
exclusive airport editions, not anymore because they're
Are
all
you wearing a
certain.
helmet for a kayak with a kayak right above you?
I've got.
You know, I'm in a sporting goods store on the west side that has everything in it, and there was a mirror right there. And I was trying on helmets for protection, not for kayaks, just for general protection. Maybe for skiing at that time. I was looking, they didn't have anything I wanted.
All right.
I was looking for a MIPS helmet.
Let's go to 59. You went to a rock concert. Is that true? After the collision?
I probably did.
Same year. Let's go to 60.
I think this is when I tried working for the green team recycling again.
That's after the collision?
Yes, that's the team. I tried it.
That's you on the first row on the right with the big smile. True?
Yes, that's me.
Let's go to 61.
Oh, and Carlene's there.
61. Is this your girlfriend at the time in a cool looking waterfall?
It is.
Let's go to 62. Is this you after the collision up in the ski resorts, or what is this?
Yeah, about a year later. I think I was just walking up in the hills above my house.
Okay, page 63. Is this you skiing after the collision?
It could be. I did go with Robin one time to try it out. I tried it by myself twice.
Okay, 60. Well, I'm asserting that this is you skiing after the collision. Do you dispute it?
It was that following year. I don't dispute it.
Okay, 64. Is this you out with your drinking buddies?
Yes.
Did you have an installed breathalyzer in your car? Yes or no?
I had a personal one that you just hold in your hand.
Page 65. Is this you and your notes? Is this you and your...
Yes, being proud of my daughters, being strong daughters, because we're in an exhibit that was about strong women.
Page 66, and you went to that exhibit, right?
I did.
Is this you? This is a post highly recommending the escape room for fun, family engagement, and problem solving. Yes?
Especially if you go with teenagers, it's a ball.
Okay, but you're actually contributing to figuring out how to get out of a kind of a scary, mysterious room.
You just put the kids in charge. They figured out. It's amazing.
67. Is this you wheels up at Salt Lake bound for Europe the year after the collision?
That's the empty seat next to me that Robin was supposed to sit in and told me she didn't like me anymore, that my personality changed.
Did you go to Europe and did you post this? Wheels up bound for Europe.
I posted it.
It doesn't say, I'm really sad that my girlfriend won't come with me. It doesn't say that. It's like...
Nope.
Okay.
I
Page
just
60,
wasn't sure that would happen.
68, Switzerland. Lots of wondrous sights in my travels through Europe, right?
Yes. My daughter took Robin's place. I got
69, the Frankfurt International Auto Show, year after the collision.
Yes.
The Mercedes exhibit, page 70. Another beautiful day in paradise with your girlfriend. Is this your post after the collision? Feeling happy, it says at the very top. Did you post this?
I believe I did.
71. You're on some kind of tour boat in the Netherlands or something. Does this sound right?
I don't remember where, but yes.
Page 72. Is this you and your girlfriend in the Netherlands?
That was a new friend, yes.
Page 73. Is this you on a bike ride looking fit and happy? Yes?
Yes.
Page 74. Is this you at the Siam Park with some friends?
Just the two, just Sakia and her son, Shaquille.
And what country is Siam Park in?
I think it's Canary Islands, just off Morocco. It's
Page 75, you and your buddies. One night, it's my turn to be wingman. There's no chicks and dancing girls. Do you see that?
Man,
That's
I
your
do.
post?
I do.
Traveling
Page
a lot.
76. Is this you doing yoga or Mamba or what?
It's Zumba, and she let me bring my two granddaughters there, and we had a blast.
Yeah, he's really suffering, isn't he?
Page
Still, even right now.
77.
Look at all this suffering he's
Crazy
going through.
fun.
But Zumba
Pioneer School.
is really like
Did you post that?
intensive. You need to know what
I
you're
did.
doing.
That's
Is that you in the green hat?
Yes.
You were sort of the centerpiece, the spotlight person in the play?
Yes, I played Zero the Hero for my kindergarten.
It's cool you did that. Page 78.
And you had to
Is this one
remember
of the
your
other
lines,
pictures you posted
mate.
from that event?
You're done.
Looks like it.
And you're the centerpiece of the whole thing, right? You're the star?
I loved having those little kids sitting on my lap and
Oh,
thinking I was
shut
a hero. Yes.
Page 79. Is this you golfing after the event?
Actually, just showing Shaquille how to hit balls. I don't remember golfing.
Don't
I think
matter,
I just
you
took
still
him.
golfing?
Driving range,
Oh my
right?
gosh!
80. Is this you? Are you in this river cruise, river boat?
I believe so.
Okay.
Yeah.
Page 81.
Oh, good lord.
White
Someone you
water
were
rafting.
with or you go parish sailing?
This was in Switzerland. No, I didn't go parasailing.
So this is just a stranger in Switzerland?
Yes.
Okay. 82. Is this you and your girlfriend?
It's my daughter,
We
Polly.
suspect a little
Thank
perjury
you for telling me
there.
that.
What do you
I
say?
hope she was not offended by my question. Is this
the,
something you posted?
paragliding
I
picture.
don't know. She
He's
probably
denying
posted
it's
it, I
him
believe.
in that picture.
83. Is this you on a camel?
It is.
And so
What country?
It's
lawyer
Morocco
around
because
was
the kid
like,
had Morocco heritage.
Oh,
Let's
so
go to
that's just a
84.
stranger then that you just put
Is that
on
you in
Facebook,
front of
on your Facebook.
something cool?
Yes, one of millions of temples in Thailand that I kept telling my friends I got to travel. So
Page 85. Is that you?
it is. Yes.
Poster boy for fitness at age 75. Would you agree?
No, not at all.
And he's
Page 86.
riding
Is
a
this you
scooter
doing
stroke
miniature
moped.
golf?
Yes.
Page 87. Is this you and your girlfriend on Facebook?
No, that's my daughter, Polly, again. She looks
Ugh.
just like me, I think.
I did
Except
it
50,
again.
100 years younger. Yeah.
Sorry, Polly, if you're listening. All right. Let me just... I have more pictures. Let's
The
go
pictures
to
aren't even. It's
99Z,
the combination of the
defendant
pictures and Terry's laughing,
99Z.
smiling. The whole package just looks awful to him.
Those, I don't think those have
So
been
much of
admitted
this
yet.
case
Move
is
to
about
admit.
the damage that he sustained in
which
the
ones?
accident
99
caused him to not be able to live his life the way he wanted
through
to.
as
Does
many
he
as
look
I can get
impaired?
through in the
Does
next
he look like
5
he had to not do
to
things
7 minutes.
that he lost out?
Sure.
Dude did more than the average person does,
Yeah.
Oh.
and he was doing it in his 70s.
Yeah.
Yeah, I don't think we're seeing the real Terry on the stand.
I'm told I have 10 minutes. So we're going to go through some more pictures. Move to admit 99Z
He's just gonna eat up
through
going through every image.
99GGG.
Like rafting? Whitewater rafting?
Collection. I've got 99.
Yeah, did he, if Steph, go back, was the picture him?
their
That's a
picture.
good
Go
one.
ahead.
Was he not paragliding?
99Z through
The
GTG
thing is,
is
in terms of the
received.
picture, you only saw the back of the person. You
hit
couldn't see
several
the
of those,
face. That's
so
why
perhaps
Terry could
I'll go
be
address
like
something
plausible deniability there. No, that's not me.
Also, can I just say, I don't want to hear the lawyer say anything more about Gwyneth Paltrow spending $9,000 and having trainers for her children.
Seriously.
How much did all of this cost?
Yeah.
Did you say when you said decided that you had been hit from behind that you felt like you were flying?
I didn't know how else to describe it.
Yes.
I was weightless, yes.
You told me about 3 near-death experiences after the collision. True?
I did, yes.
One was where you knocked yourself out, and you were out a long time because the whatever had melted had actually warped the wood floor. Do you remember this?
I did, yes.
Did you seek medical care for that?
No, wasn't tuned in.
Did you think you were out at least 45 minutes?
At the time I did, but now I've come to conclusion that it was 2:30 in the morning and I just wiped up all the water on the floor and I didn't get it all. I think that's what caused the swelling. It usually takes about 45 minutes, so I'm pretty sure that would be impossible to be out.
Did you think it was important for you to maybe go see a doctor and having hit your head and being out for a long period enough that the water warped the wood floor?
At the time I thought that, but I was not making good decisions, and that sort of near-death experience happened twice again.
Another near-death experience was you were cutting a cardboard box and cut your leg. Is that true?
With the box cutter, yes. Through the femoral artery. Looked like a murder scene.
And then a third near-death experience was an accidental overdose of medications.
Yes.
And they had to give you Narcan because you'd taken OxyContin and Tramadol. Is that right?
I didn't know I'd taken Tramadol. I took just the OxyContin that I had for my ribs, actually. My ribs had been broken from the ski accident.
And you blame Miss Paltrow for all 3 of those near-death experiences after, true?
I don't know if I said that.
Are you claiming it right now in this lawsuit?
Yes. Very unusual for me not to make good decisions, medical decisions.
Except you avoided cancer treatment. You went on medications you were told not to take.
I think I'll reserve my remaining time
I'm
for
sorry, but what kind of doctor
redirect.
is going to prescribe
Your
a
Honor.
patient with both Tramadol and Oxy? I ain't no doctor, quite clearly, but that is freaking insane.
They're playing the clock. This has gotten a little bit more interesting.
All right.
See, they only got so much time left.
Terry, you've been shown lots of pictures about all the different travels that you've done. Have you always traveled in your life?
I have. Well, no, just since retirement mostly, but
You've traveled before?
yes.
Traveled after the accident?
Oh, yes.
She's trying to tell you.
Have you ever told this jury or tried to insinuate in this trial that you couldn't travel?
Absolutely not.
Why did you travel? After the ski accident, why did you travel?
It was part of the healing process. I was told by several neurologists and cognitive therapists, get back to your routine. The sooner you can do that, the better you'll be, and that's been proven in some research.
Now, all these
Routine
pictures,
was
they
going
look
whitewater
really great.
rafting?
I mean, you're smiling, you're happy.
Reflexive.
Did
But
you
he's
struggle
turning
on
around
those
and he
trips?
said the Gwyneth
Yes,
Paltrow
I really
caused
did.
Caused such a mental
I couldn't go by
impairment
myself
that he
anymore. And
couldn't
I
go
found
back
that
to
out
his
the hard
normal
way
routine and
when
do his
Robin
normal
decided
things and do
that
what he
she
wanted to
didn't
do.
like me
And
anymore.
we
I want to
were
hear.
fine.
He's explaining why he can't do that right now.
I
Steph,
asked my
listen.
daughter to go along, and she didn't get there until the next morning. Bought her a flight, and she came over, and what did I do? Stepped off the curb.
Now, which daughter was that?
Jenny B.
That's Jenny. That's the
Yeah.
Jenny that we've heard all about that said all kinds of nasty things about you. She went on a trip to Europe with you.
Yes, and we had a great time. Yes, we did.
Did you have a great time, or were you struggling? I'm confused.
Holly
You were
said
shown some
different.
pictures of the green team and volunteering.
Yes.
You talked a little bit about that last week, but what has this accident done to you with volunteering?
Wow. It has just shut down my volunteer work. I tried dozens of different volunteer groups I worked with, probably 200 hours a year volunteer easily. And Green Team was a big one. I'd go up and pick up aluminum plastic, hard work, bending, stooping, lifting, 16,000 steps, and you get everything done by 1 o'clock in the morning, go home. And my plan was to do that, but I got lost. And it took me a long time to figure out how to get home. I refused to use my maps. I just don't need it. But that was the first real time that I thought, oh my, something is really different. I have no instincts for north anymore like I used to.
And you've been here now all this week. You've heard all kinds of doctors talking about how you were getting old, how you were worried about dementia, all of these mental issues. This is just a natural progression of how you were. The jury's heard from family and friends that witnessed how you changed.
This is leading, Your Honor.
I'm just setting the background. I'm going to ask the question right now.
Okay, well, I'd like to hear it.
What is your perception, Terry, how you changed? Was it dramatic? Was it slow? What changes did you see and did you perceive following this ski collision?
Looking back on that time, I was determined to prove I didn't have any mental issues. Everything I did was to stamp that in my record, that this guy is trying hard. He does not want to bring that into his life. It was a big deal. And I just found that it was like flipping a switch. It was like I looked back and it was the bright side, and now I'm in the dark side. And my volunteering stopped, so a lot of my self-esteem stopped. I couldn't do it. I couldn't do the job. In fact, I got chewed out by somebody I knew for 30 years saying, not that long, 15 years, saying, Terry.
Sounds like hearsay, Your Honor.
Excited utterance.
Sorry, honey.
And it's not offered for the truth.
You may answer for it'll be accepted for a limited purpose.
I can
You
answer.
can answer, yes.
I kept getting chewed out because I couldn't remember what I was doing, even though I'd done it for so many years. And I tried it again a second time, maybe 2 years later, and I got chewed out again by a lady I'd known for quite a while. I said, something's different about me. So.
And Terry, how did that make you feel?
Oh, it's always nice, and you know that, if you walk into a room and it says, hey, come on over here, it's Terry, you know. But when they just say, oh, it's Terry, there's something different. There's people don't
aging.
see me the same way, and I don't feel the same, and it's very disappointing, to short answer.
And you can't accept it, so you're blaming everyone else and not taking care of yourself.
You were asked about the press conference and referring to Miss Paltrow as King Kong. Were you referring to her as King Kong or the noise that you heard?
That's leading, Your Honor.
What did King Kong refer to?
King Kong?
I'll withdraw it.
Overruled. Go
That's
ahead.
fine.
My apologies to Ms. Paltrow, because my intention got twisted up in my intentions and was to say it sounded like a lady getting chased by King Kong out of the jungle. It was that kind of I'm really scared.
And I want you to describe that.
So was he King Kong then?
You kind of whispered it a little bit last week. When did you hear a scream?
As I passed those big signs that said slow down, seriously, I just went into a glide. I just started gliding. I was going plenty slow, not passing anybody on my left. I just started gliding. And then the silence was broken of that, just simply gliding down the hill, not making turns, and always on the right side. And the silence was broken with a hysterical scream, the very best hysterical scream you've ever heard.
At what point did the scream happen? Was it before you were hit? When you were hit? As you're going down? When was it?
I heard it and tensed up. Absolutely, a half a second probably before I got hit. In fact, I'm not so sure the scream even ended when I got hit. It ended as she hit me, and then over we went.
Okay. So there was some testimony from Ms. Paltrow again that she was hit in the back by a very large man, or that there was a very large man. Could you just step down for just a moment?
This states the testimony, Your Honor. Can we get a question?
Could you just step off the stand for just a moment?
Could you get a question? What does that mean?
I'm going to ask the question.
From the questioner.
She's
Okay.
inserting evidence into the record.
Overruled. The jury will remember what the evidence was.
Terry, do you... No, right here. Right here. Do you consider yourself a very large man?
Many times I wish I was, but no. Definitely on the small side of most people.
If you run into someone, it doesn't matter. But she's a very thin woman. What's your point?
The reason I asked Ms. Paltrow why she was 5'10", or how tall she was last week.
Commentary. Let's have questions.
Ms. Paltrow testified she was
Overruled. It's just prefatory. Go ahead.
Thank you. Ms. Paltrow testified she was 5'10" last week. How tall are you, Terry?
5'5".
Thank you. The accident that day, the ski accident that day, were there a lot of people on the run? Was it crowded or was it deserted?
Most runs that I've seen, it was, compared to most runs, it was very crowded. I would say moderately to high full is what it seemed like. Lots of people.
And were you skiing back and forth on the run, or did you stick to the right side?
That's another fact that's been changed. I was on the right side, exactly like I said. Saw all the people congealed in the middle and just went diagonal straight over to the right side and stayed inside of that 5-yard boundary where nobody was. One lone person coming out once in a while that I was wary of that was down on
How could you tell if you couldn't see?
And that's
your
when
right?
the scream happened, and that's when you were hit.
Absolutely, and there was no one in front of me.
And how did you land, to your recollection?
Downhill, of course. I'm going downhill, so our heads are downhill. So that's, I saw down the hill and crashed there. And I didn't remember doing this, but I did put my hands out to catch myself. That was instinctual, saved my face. But we landed, and I remember lurching off the right foot. As I got hit, I thought I got to use whatever I can, and I pushed deliberately a little bit to the right, because I did not want anyone in the crowd to get tangled up in us as they were going by. And I did see, just before I hit the ground, I just remember seeing a skier on the left go by. I was safe.
Mr. Owens asked you, hit and run. You said it was a hit and run. Why did you say it was a hit and run?
I always considered a hit and run was something when you ran into something or somebody and then you just left the scene. And as far as I'm concerned, there was no one there when I woke up. No one except an angry man, as I said, and then I saw Craig.
And is that how you felt, that it was a hit and run?
That I was, yes, that was like if you get knocked down and knocked out and nobody's around afterwards that did it, that's a hit and run.
Okay.
Thank you for clarifying.
You've been here for a number of days. You've heard all the doctors testify. Your entire life has now been broadcast to the world.
I feel like I've been fleshed out, and anyone up here, I think, would feel the same way. Very painful.
In fact, I think you just told me back there, well, I could never go on another dating site again.
It's true. Everyone knows too much.
Do you regret bringing this lawsuit?
No, they don't.
Well, that's the purpose, I think, is to make me regret this lawsuit, and it's the pain of trying to sue a celebrity. It's just very difficult. I will tell everyone that. You're going to get exposed.
Your Honor, we're not talking about this case now. He's talking about the world.
Sustained as to the generalization.
Was it important to you to bring this lawsuit?
It was. I felt like I was seriously injured, And then I had so many insults added to that. I think, as I said the other day, so many insults added to that and layered on that after a while.
Your Honor, post-collision conduct is not an issue. Layered on insults is not part of the lawsuit.
Overruled?
Yeah, I'm classifying as an insult, but it's absolutely ignoring me, ignorance. And that's what it felt like. It's like, what is going on here? This is obviously an issue that someone needs to be accountable for. And if they're never accountable, what are they going to do? They're going to do it again. Now we have the molesting of young children on an island.
Your Honor,
denial.
This is ridiculous testimony. What? He's talking about...
Sustained as to relevance, the last part, the jury should disregard.
That's all I have to.
What the hell?
What the fuck did he just say?
What did I just hear?
What? Goodness, look at her.
Did he just
face
Jeffrey
now.
Epstein
What
himself?
the frick?
Even Gwyneth was like, what are you talking about?
Do you realize you
There's your
are
hook,
the
Andy.
reason your life has been exposed to the world? You, not Miss Paltrow.
I'm realizing that now, yes. Painful.
Do you remember, you've said you shrunk and lost weight since the incident, right?
Well,
He changed his height again, didn't he?
Now, when we stand you up, you've lost like 15 pounds and shrunk 3 inches, right?
I had
Yes or no?
I had no idea. I guess yes. I was
Just a few days ago, you said I was 175 to 80 and 5'8". Remember?
I said that not here. Oh, you know what?
In this very trial.
Overruled.
I know why I said that. It's because the VA records weighs you with all your clothes and everything on, and I knew that's what you were reading. Was what
Clothes
the VA
don't
reported.
give you 3 inches. You with me?
Heels do.
Did you have heels on?
No, not that.
All right.
He
You
changed
even
his
called
height
yourself pudgy at the time.
Again.
You were pudgy. Do you remember that word?
What
Do you
time?
dispute using the pudgy?
What time frame?
The time
God,
when
who
I
cares?
deposed you, you said you were pudgy.
Okay, that's kind of a fun term. Yeah.
Do you dispute it?
I don't.
What does that word mean?
I never thought about it. Just sort of got a little more roundish, I guess. Haven't defined that before.
Did I hear you say you didn't like to be ignored? Don't ignore me. Are those the words you used?
Just now?
Just 2 minutes ago.
I probably did say that.
Let's go to page 170 of your deposition and ask that it be published and brought up. Do you have your transcript right there?
I do. I think so. I think that's what this is.
Your Honor, may I do that?
You can just read it.
It hasn't worked in the past, and
So I'm under 32. You can use the deposition. You can certainly read it into the record, but we don't need to.
All right, let's go to page 170.
Matt Bond, you are 100% correct in
and
just
I'll
a super
assist
chat
you
you
if
just
you
put out.
want me to.
I don't even know where 170. I don't see. I see. I mean,
Can I
have
approach
exhibits.
or-
Oh, it's another whole other. Can I close exhibits?
Yeah, close that up and then I think it's the 3 piles of paper there. One of those.
Counsel, if you could just get him to the page, that'd be great.
Do you want me not to approach him?
No. I said if you want to get him to the page, that would be great.
Yes,
Thank you.
that's what I want to do.
Thank you.
I wouldn't have known which ones to look at.
Oh, this like fake kindness that he keeps putting on, which I see through it so much.
We're starting. Okay.
He's trying to play all like, oh, I'm just a nice, gentle man. Well, yeah, well, thank you for correcting me. Oh, yeah, I guess. I don't remember. Oh.
And you see, I'm going to start reading at line 12.
You skip the good
Saw
stuff.
something.
This lady is on my left. Well, let's go back for a little. Remember, I said I want to know what's going on in the 10 seconds before the impact. Do you remember?
I do remember that, but is it written here? I don't know.
Yes, that's my question on page 169. And then on 170, you said, and then I remember there's this lady on my left that was kind of tentative. So I deliberately, in fact, I think I said passing on your right. Pretty sure I did. I usually do. Passing on your right. And then, it was just easy. It was just as easy, smooth glide. And there were not a whole lot of people. And I'm not...
I don't want to be interrupted right now, please. Page 170. And when I got to that point,
I could see the bottom of the hill. I could see that the trees came in a little bit from the right, it seems like, and then the whole slope was opened up. There were a few occasional people out there, but I could see all the way to the bottom. There were nobody. And then this, and nobody could have passed on my left except the gal I had just passed. So that gal I was really conscious of, because I still worried about her. And so as I went past her, I went inches per second past her. I just remember it took forever for me to get past her. And there were skis. And when they disappeared out of my vision, that's the time I heard this. That's the time I heard this saw, indicating scream, and then bang, it happened. It was about a second and a half, and it just hit me right in the back. All right. So do you recall that in the seconds before the collision, you were worried about the person to your left? Do you recall that?
I gave her plenty of space because she seemed like I moved way to the right before the off-piste, yes.
But you were with inches of her.
He said he went past inches
no, I was not
from her.
within inches of her, no.
All right, what did you say here? Well, first of all, did I correctly read your testimony?
Yes.
All right. You were inches per second past her.
Moving very slowly, yes.
I just remember it took forever to get past her, and there were skis. Now, your right eye has problems, right?
A little bit, yeah.
Not a little bit.
Yes, a little bit.
Blind.
No.
You told 3 of your providers at the VA, I'm blind in my right eye.
I use the word loosely.
You used it, and you're an optometrist, right?
I did.
All right.
Seriously.
So let's not say little bit, because that's pretty different from blind.
It is.
All right. So you're trying to not hit this person on the left, and you're blind in your right eye. Do you agree that you turned to clear the person on your left?
No, I knew I had plenty of room before I started by her. I wouldn't go by her without knowing I had plenty of room.
You took great care, didn't you, to make sure you didn't hit the beginner skier on the left?
Yeah, she just don't go over.
Is that true?
Yes.
That's all. Thank you.
Ms. Van Orman?
Were you
Destroyed.
skiing cautiously?
You know, I've had a long time to think about whether I want to be dangerous or cautious, and I choose cautious. Yes, I don't take chances.
What is
had a
your
lot of
vision
time to
like in
think
your
about
right
that.
eye?
My vision, I will compare it to a flat light day. I have flat light days, if anybody knows what that means. It seems you just can't tell the contours as well of where you're at, and so you have to be a little more careful.
You had a lot of
Make
time
sure
to
you
think whether
pick
to
the
be
right spot at the
dangerous
right
or
time.
careful.
So
Did you catch
I
that,
get a lot of
Kim?
practice skiing flat light.
yeah. Did you
That's
say
what
that?
it amounts to, I think. It's how I describe it.
Any trouble skiing with your right eye?
Never any trouble. And unrestricted skiing. They don't handicap me on the ski slope or driver's license. I'm unlimited. I do fine.
That's all I have.
Yeah, because you probably don't declare that you're blind in your right
Thank you, Mr.
eye.
Sanderson.
Thank you.
They knew they probably would, in my
Any more
opinion.
witnesses, Mr. Owens?
No, Your Honor.
Okay.
Given our court limitations on time, the defense rests. We reserve the right, maybe as soon as the jury's gone, to admit into evidence each of our exhibits.
Okay.
As long as we have a good understanding of our ability to do that.
So we'll reserve your formal resting until after we deal with the exhibits.
Thank you.
Members of the jury, we're going to recess now until 9 o'clock tomorrow morning. You're probably wondering what's going to happen next. And so now the defense will be resting today. The plaintiff has indicated that they may have a short amount of testimony to put on tomorrow morning. And then right after that, we will do the jury instructions, and then the attorneys will have an opportunity to sum the evidence up for you, expecting that should all be done in the morning tomorrow and start deliberations after that. It may bleed into the afternoon depending on how things go.
Oh, it'll bleed
You
into
never can
afternoon.
tell these things exactly, but that's what we're shooting for. So have a good evening. Remember, still following my admonition not to try to learn anything about the case, not to do any of your own investigation, and avoid any press reports about this. And please don't discuss the case with anyone. If they try to discuss it with you, just tell them you can't. The judge has ordered you not to. So thank you.
Wow. All right, we're going to go
Did
through some of your
anyone
comments.
have-
We're going to do a quick hello and thank you, and then we're going to retape our standalone as we clip those things. Brandon, I don't know if you got that last one too, the weird one where he's like, I chose to, a lot of time to think about whether I do this or that. It sounds like they're still going to bicker over here about some items to put in. But as we wait, there's Gwyneth as she goes, White Tower of Genesis. This man is beyond unlikable. What arrogance.
So do you
Jonathan
have your
Sweet,
exhibits lined up for
he's
entry
5'9"
right
on
now?
Grindr Tinder, but he's 5'7" in real life. Ha ha ha. Matt Bond, it was at this moment he realized he fucked up.
Yeah.
I'm sorry for saying this. He makes me feel so uncomfortable, specifically when he
The
pretends
easiest
he's
thing to
laughing. I'm
do
sorry if
might
it's nothing.
be
It has nothing to do with Gwyneth.
To stand in front of you with the official one that's going to go to the jury, because there are a lot of different things floating around. If you want, we can do that so we don't take your honor's time. I think we can do it in 10 minutes, but I don't think. I think between the lawyers and your clerk, I don't think we necessarily need you to do it, because I think we'll come to a stipulation.
Okay. Well, I'll be here for at least another hour. So if anything pops up, or whenever you're ready for me, you can just message me and I'll come out and we can enter the exhibits. And I put on your tables earlier today what I believe may be the final jury instructions, but we can talk about those in the morning. Maybe 8:15 tomorrow morning.
Your Honor, may I have a suggestion as well? I think maybe everybody can kind of work together, get all of their exhibits in, whatnot. Maybe at 8:15, the defense can rest. And then we would like just a few minutes to make some motions.
Right.
So if we're all here at 8:15, that'd be a great time to do that.
Okay, why don't we do that? And so as I mentioned, Ms. Van Norman, I put jury instructions on both tables, a couple of copies. So I'd like to get your take on whether those look final to you. And then what we don't have is a final verdict form. And I don't know, I wanted to get your take on it. Do you want to go with a special verdict form? Do you want to each present your own verdict forms for your side of the case? Do you want to have a general verdict with special interrogatories? How do you want to approach? I don't see where the parties have talked much about the form of the verdict. So
we've talked. We're only off by, I think, 2 questions.
Okay.
I think I would love a copy of what Your Honor has.
I don't have anything. I have what you have. And
Okay.
then beyond that, I usually start with the Muji jury, or the Muji one that's on the website.
Right. The counterclaim, I guess one issue on this special verdict form, for instance, is can we fill in just $1 instead of you must find damages? That's one of the issues.
I think that makes sense.
Your Honor, they can do that in their closing argument.
Yeah, but just to avoid an error of some kind and an argument and objections if they do something different, why not fill it in if it's a stipulated amount of damage?
Yeah.
Well,
What's the problem with doing that?
Okay.
We're just inviting error otherwise.
I think that's appropriate, and then it would just be a yes or no on that.
Right.
Your Honor, spoliation, we sent in just 3 hours ago, a proposed spoliation one. We reworded it. Peter, I should say Peter and give him credit.
You guys have that?
Reworded
We haven't
it.
had a chance to look at it.
It's 3 hours.
Did they get it, Peter?
Yeah, I sent it to you and all the parties.
Could we handle that briefly tomorrow?
Yeah, absolutely.
And, yeah. I think
Okay,
we can
so
do it.
special verdict form. I don't know that we can do more, and you come up with what you like best, and then give it to us, and then we talk.
I'm looking for the parties to provide me with this, with whatever form you want the verdict to be in.
We like the Muji one, I think.
But your verdict form, first of all, it didn't track. If you
Okay,
look at the
this
bottom,
is all just boring
or if you
jury
look just
verdict
after
forms.
the first part of the verdict form where it talks about Terry
If
Sanderson.
something else interesting happens, I'll lift it up. But
Two questions about Gwyneth Paltrow.
I'll put this
The instructions
subtitles on,
don't
so if you
track.
want to hear him, you can.
And then the other thing is it has nothing
I'm on,
about the
K to the
counterclaim.
T says I'm on both
And
of
I'm
them.
not
I'm
sure
not
how,
allowed
you've
to
got-
drive.
So we're dealing with
Not even a
comparative fault.
provisional.
And
Thank you, K to
it's
the
not
T.
really clear how
Jonathan
that's
Sweet.
going to work with the counterclaim.
Tramadol is
on
the
your
lowest opioid on the scale. On the oxy, they
think it's
shouldn't be
close.
mixed, especially
I
if he's
prefer the
reported
language
respiratory
that
issues,
you
as
guys have
opiates
because that's
slow
what's
down your
from the
heartbeat.
website form.
Yep.
Yep. You care says got
I'm willing
concussion
to use other
falling from a
language if you
camel.
want to,
Well, I'm sorry that happened. Or no, he did.
I
Is that what
guess
he's
I'm
saying?
looking I'm looking to
White
you to
Tower
put
of Genesis.
together
I hope
the
this will all be his
Yeah, we
downfall.
prefer that.
Looks not good.
Defense counsel may have other ideas.
Bonnie Beal, this is the best. You guys really liked that when he got grilled at the end there.
Cooperate.
He just wanted to meet her in person.
And then we can address it tomorrow.
I'd give both
when we
nuts to do
appear
half
at,
this stuff.
8:15. After
Okay,
the
so-
motion.
Thanks, Matt. Strove, he's running
Anyone who
out
wants
of
to
money
argue,
through this lawsuit.
Be here. Or object.
I'm just a simple country
boy.
You like that?
Oh, we just made fun of him.
But he's just a simple country lawyer. Did we just say that at the same time?
So, Your Honor, we did file both parties.
It
I want
just
to
totally
make sure
prepped
you
them.
have what both parties submitted.
Circus.
Do you? Pre-trial.
For the verdict form?
That's if Brandon, if you're still there, they just did the judge.
Or object.
I'm just a country boy.
You like that?
I walk past him in the hall, I object.
But he's just a simple country lawyer. Did we just say that at the same time?
So, Your Honor, we did file
roasted by
both
your own
parties. I want to make sure you have what both parties submitted. Do you?
He
Pre-trial.
does that. I haven't put my finger on it,
Yes.
Massa, but you just did.
Okay, you have that.
He's John Malkovich. That's what his voice is.
I'm going to be working on closing, so I almost.
He totally has a Malkovich
Is this a
voice.
burden to place on you for you to put together your favorite?
I spent some time with it, and I, couldn't put the two together. I admit that I could spend more time on it, but you've got some.
Jonathan Swift asked,
junior
do you think
lawyers
the
that could
KFC
probably
lawyers
figure
paying
it
off
out
the
between
judge
the
with
two
buckets of
sides?
chicken?
Yes,
That's why they're
I'm
getting
not
all this
trying to
time,
add a
maybe.
burden. Okay, James.
Char says
you
it
be-
matters, Andy,
you be
because
in
of
charge
Terry
of our
not
special
having to show up
verdict,
to
huh?
court. Yeah, he didn't show up to court. Holy shit, I'm so glad I went to work
Okay,
today,
if you, want,
Jonathan.
if you want to email
Thanks
it
for the,
as soon
the
as
super
you
chats,
guys
Jonathan
agree on
Sweet.
something, then maybe
You
I
were
can
very
have a
sweet.
heads up before we meet tomorrow.
Neil Talbot,
I mean,
thank
the
you.
only other
Rose's
alternative,
Vengeance, please
Mr.
clip.
Owens,
I'm
is,
not very smart.
I
When
guess
did he
to
say that? I can't
recess,
remember.
after
Roses,
the
thank you
evidence
for your
and
super
to
chats.
take
Nina,
the time
or
to get
Nita
it hammered
Patterson.
out. And we'll have to do that if
Thank
we can't
you.
agree
I'm sorry, I'm
before
trying. I know
then.
you guys are listening, but they're just wrapping up some boring stuff here at the end. And I want to read your
We
comments.
both get a
Jersey
final
Girl,
count, too,
Chronic,
on time. I
Yes,
think
Simple
both
Lawyer,
sides would like that.
Excellent point.
Tinkle Tits McGee, I'm a simple country lawyer.
Give me just a minute.
I'm
I'll
just a
get
simple
that
country
put
lawyer.
together.
Still a window. Whoop whoop. Kim Rant in 321. Yeah, she had a good one. Cat C, this guy has never seen a bottle of throat spray in his life. No. You'd think after the cough starts, you'd throw a Ludens in or something.
I'm just a simple country lawyer.
Tinkle Tits McGee, is Physics Daddy. I hope your flight landed safely. Hit me up. You've really said quite a few chats trying to get his attention. Liar, pants pants for hire, says Matt Bond from Patrick Starr. Tinkle Tits McGee, Gwen's going to get her $1.
Hang out. I'll be right done with it.
Matt Bond cut his femoral artery. I call horse shit. Tinkle Tits again. I can CUM on Wellbutrin, but not Paxil. Boprocan is not a reason for mood changes compared to this SAH. Okay, Tinkle Tits. Tinkle Tits, a girl in the gallery has mask. It's spreading. Yeah, I would not have stepped foot in that courtroom after all those germs from
I'm just a simple country lawyer.
Derek Brown, I didn't mean read like you don't understand. Read it like you scream it from the rooftop. It's not about punishing China, but punishing us. That was from earlier. We were talking about that. I think I've caught up. Any other final thoughts or tips? You can tip Steph Alternerd on Cash App and It's Kim on PayPal. Matrix Tech Solutions, thank you for the $1. If anybody else would like to step up, you can. Before we wrap up, make sure you go to my link tree. It's pinned because you'll find the ways to donate, along with how to support Kim, who's been here all day. Woo woo! Show her a PayPal tip. You can also go over to Steph. You can support her through her links and her PayPals, etc. And Lewis, he'll be live after us, and all the other links are there. So go support if you can. Yeah. Anything you guys want to add before we cut and go to our recap? Kim?
The last half hour was not on my bingo card for today. I don't know if anybody else had a similar experience. That was one of the most insane things I have ever seen.
It got weird. All right.
I have nothing else to say. I got
we
nothing.
will save our full recap for the recap, which we'll tape after this. It's just been a 7.5 hour video, so I don't want to do it at the end here, and I can't trim it. So we will be taping it separately so you guys get that. And thanks for you guys watching that later at night. Steph, final words?
Thanks for watching. Make sure you subscribe to Popcorn Planet, hit the bell so you're notified when we next go live or we upload a video, share, all of that good stuff. Watch out for the YouTube short for tomorrow on Popcorn Planet, our Popcorn Bites. I just have some really good inspiration right now about Terry calling Gwyneth King Kong and Godzilla. Oh, tomorrow's Popcorn Bites is going to be nuts with a capital N.
Love
I
it.
think there'll be a few chuckles.
Steph is making those shorts, for those bites, we call them. We're calling them bites to make them more appealing because of popcorn. Smart. But yes, bravo. Thanks, Steph. Great first week so far. And everybody watching, you guys are awesome. We got lots more. We will be back live tomorrow. It sounds like it'll be a morning session. So, yeah, I don't know. We'll be here. It doesn't sound like it'll be too long. And then they may take a break. So then we may just cut until the reaction comes live, Steph. What do you we'll figure it out. I'm going to talk to Steph and Kim. But we will be here covering this verdict. I don't think we're going to wait too long for a verdict on this one. That's just my gut. I don't think so, but I would be surprised. You never know. Let me make sure I have Lewis. Lewis is going to be over on Nuke the Fridge. He's holding a party. And I'm going to get my review in tonight. I forgot to do my Dungeons & Dragons review. He's going to have a Dungeons & Dragons party, maybe even giving away some stuff. So why isn't it there? Hold on. Let me get the link real quick for him because I know he's ready. Nuke the Fridge is next. He's going on his movie channel to hang with you guys. I don't see the link, Lewis.
Hey, Lewis!
Let's go!
Get your sense sorted, mate.
Yeah, his link's not there. I don't know why. Nuke the Fridge is where we're going to be heading over, guys, to here. He'll be live talking, just hanging with you guys. So let's go show him some love over on his movie channel. And I'll be posting on my movie channel in a second as well. Over on Movie World, I'll be getting my review up of Dungeons & Dragons, which I really enjoyed. So stay tuned. It's going to be a fun review. I want to give you share my story about... Is it there now? No, that's not it. What the fuck is this channel? You piece of shit. That's not me. How did you try to copy my shit? Bastards. They did that after me too. There it is. Movie World Plus is what I've called just so I can own the name. Because it's streaming and a video store. That also covers streaming you can find there. Lewis, where the fuck is it? Lewis!
Hey, Lewis! Otherwise, we're going to end.
Oh, there it is.
Is he here?
What's
Oh, it's
everyone up to? 3 likes.
There we go. All right, Lewis is live. Go say, we love
Phil,
you,
what's
Lewis!
up, Phil?
If
Head
you don't
over
know
to
who Lewis
Popcorn
is, just go over there and be
Planet.
like,
Let
who
him know
are
that
you? I
I'm
don't know who you are,
live
but I
on
came
Nuke
from
the Fridge,
Popcorn
though.
Planet. We're going to go
Miss
raid
Kim,
him right
everybody
now.
go
It's a
there.
cool
Let him know
feature.
that I'm
So
live
going
on
over,
Nuke the
raid
Fridge,
Lewis,
so you
support
can
Steph,
redirect.
support
So you're not
Lewis,
sending
support
people to
Kim,
Nerdy
support
Report,
us
'cause
all.
I'm
We're going to go
gonna
do our
do a special
recap.
show.
It'll be up later, so after you're done with Lewis, you can catch us.
I
So go
think
hang with
Popcorn
him,
Planet's
all you
live right
Planeteers.
now. Send
Go
him
over
this
there.
link in his comments.
Say hi, Lewis. If you don't know who he is, I want you to
for
say
Nuke
who
the
is Lewis.
Fridge.
I don't get it.
The link
So
I'm playing
go
now.
just
This
do
is
that. Also, real quick. Andy, have you noticed he has a cameraman and a person looks like a director? There are 2 senior people come and go with him every day. Terry? Is he doing a documentary about it? I didn't know that. Holly Mommy.
Gosh.
Terry is so sus. I'd be ready to vote right now. Yeah, I can't imagine there's going to be people really trying to fight this one in the courtroom and who don't want to go home. Neil Talbot. Andy said, how do you pronounce tramadol? Tramadol? I don't know. Did I do it right?
Tramadol.
Tramadol. There you go. That's
Tramadol.
don't ask me how to pronounce things. I'm not very good at that. All right, we're heading over to Lewis. Go check out Nerd Report. The link will be in the comments. And where'd it go? There's the link. Boom. All right, the redirect is set. We will see you guys in a minute because we're going to tape our recap. Thank you guys so much for watching. Hit that join if you haven't already. You'll be able to catch the member-only replay for some time afterwards because this will all become members only. So if you're watching and you wanted to go back, become a member today. Hit that join button, pick a tier. Lots more perks coming. Appreciate you guys so much. Thank you, Kim. Thank you, Steph. Thank you to Kurt earlier on civil law. And head on over to Lewis next. Bye, everybody.
Bye.